Thank you for your wonderful performance. A very good and energetic morning to all of you. Present here with great joy and immense exultation today, we will be witnessing the gracious presence of so many learned personalities across India and the globe.
We feel privileged to extend our hospitable and gracious welcome to our honorable guests, other dignitaries and delegates who are brought together for the International Nursing Conference 2023, which is being introduced by the Nursing Teachers Association of India in collaboration with PG College of Nursing and Cancer Hospital and Research Institute.
We also welcome all the participants and respected principals and faculty for different colleges. And let me inform about the theme proposed for today's conference, which is Innovation in Nursing and Key to Progress in Universal Healthcare.
Now I respectfully invite our prominent guests with a request to come on the stage and have their seats on the distinguished chairs. I am profusely elated to take an opportunity to invite our chief guest of the day, Dr. B.R. Srivastav sir, Managing Trustee of Jan Vikas Nyas. We feel honored to have with us the guest of honor, Dr. Punendra Bhasin sir, Chairman Ratan Jyoti Charitable Foundation and Director Ratan Jyoti Apollo Spectra Hospital. I consider it a great honor to welcome Professor Shuli Sarkar ma'am, Principal PG College of Nursing, to have us on stage.
I am immensely proud to welcome National President of Nursing Teacher Association India, Dr. Farooq Khan sir.
We have with us Honorable Special Guest Mr. Abhinav Jain sir, Director ANS Group of Colleges. I am immensely proud to welcome National Secretary of Nursing Teachers Association of India, Dr. Manish Kumar sir. Please have a seat sir on the stage.
On the behalf of the management, I thank our all honorable and special guests for providing us the gift of their presence.
Now it is customary in our culture and tradition to start the occasion with an auspicious beginning, and light is the testament in assuring the positive vibes. I firmly request our guests and dignitaries to join us for the lamp lighting, and please come Madhu and group for Saraswati Vandana. Please come on stage. Thank you for the Saraswati Vandana and thank you our special guests for the lamp lightning. Now it is a part of our culture to welcome our guests with something warm and pure. I humbly invite Dr. Farooq Khan sir to felicitate our chief guest Dr. B.R. Srivastav sir with welcome garland, the shawl and shrifle as a gesture of affection. Please sir.
I would like to request Professor Shri Sarkar Ma'am, Principal of PG College of Nursing, to facilitate our guest of honor, Dr. Punendra Basin sir.
I kindly request Professor Poonam Thakur ma'am, National Treasurer Nursing Teachers Association India, to come forward to offer the same symbol of adoration to Professor Shri Sarkar ma'am. Please ma'am.
Thank you, ma'am. I would like to call Dr. Manish Kumar sir, National Secretary, NTI, Vice Principal, RJINS, to welcome up special guest Abhinav Jain sir with shawl and shrifle.
In addition, I cordially invite Professor Pavan Babu Sharma, Principal KS Nursing College, to felicitate Dr. Farooq Khan sir, National President of NTI. Please come on the stage, sir. Please welcome Siv Lahari sir to felicitate Dr. Farooq Khan sir, National President of NTI.
Now to offer a gesture of gratitude to National Secretary NTI Dr. Manish Kumar sir, I would like to request Professor Sushil Kumar Gupta sir, Vice Principal of PG Con, to please come upon the stage.
Thank you, sir. Now I look forward for the presence of respected Dr. Farooq Khan sir, National President NGI, Principal UNS College. Please come for welcome address and have some words of greetings. Thank you, sir. Please come on stage.
A very pleasant good morning, ladies and gentlemen. Myself, Dr. Farooq Khan, President, the Nursing Teacher Association India, Principal, the Academy of Nursing Science and Hospital. Would like to thank everyone for gracing today's program. Dear nursing fraternity, who are here present over here in most awaited international conference organized by the Nursing Teacher Association, sponsored by PG College of Nursing, the Academy of Nursing Science and Hospital, KS Group of College, and RJN Institute of Nursing Science. It's my privilege to produce welcome address for all the distinguished dignitaries, guests, and participants of this much awaited international conference who have joined us physically as well as virtually. It's very special day for me as today our NTI Foundation Day also. I am very much delighted to welcome today's honorable chief guest, Dr. B.R. Srivastava, patron of this international conference, Managing Trustee Jan Vikas Nyas. I heartily extend my warm welcome for Sir genuine and benign presence who has supported us in many ways for smooth organization of this conference. Welcome you, sir. I would like to extend my warm welcome to Dr. Archana Srivastava, Madam, co-patron of this conference. Although she is not here, but all time direction guidance present here in among us. Next, I extend my heartfelt welcome for today's special guest, guest of honor, Dr. Puren Basin, sir, Chairman, RJN Charitable Foundation Trust, who has been guided and supported us for this conference. I would like to welcome today's special guest, Shri Abhinav Jain, Executive Director, ANS Group of Colleges and Ebenezer Group of School, who has motivated during all the preparatory times of conference. Welcome you, sir. I heartily welcome today's keynote speaker, Dr. Mrs. Bimla Kapoor, Professor and former Director, School of Health Sciences, Nursing Program, Coordinator, IGNU, and Chairperson, NNMC Bill, without whom we cannot expect a wonderful conference. Welcome, ma'am. Next, I welcome the eminent speakers of the conference without whom we cannot imagine to organize such a valuable event. I extend my warm welcome and greetings from India to our eminent international resource person, Dr. J.K. L. Michael, Associate Professor, Associate Chair of Nurse Practitioner Program, belong to Arlington, Texas, USA. Next, I am delighted to welcome our next eminent resource person, Professor Dr. Piti Kaul Ma'am, Dean SGT University, Gurgaon, former Director, IGNU. I think so, Madam is on the way, she is coming. I am elated to welcome Dr. L. Gopi Chandran, sir, Associate Professor, College of Nursing, AIMS, New Delhi, Executive Advisory Committee member of our NTI, who has been always a great motivator for nursing fraternity. Next, I am very glad to welcome conference chairpersons, Professor Dr. Madhusudan sir, MP State NTI President, Principal at Maharani Lakshmibai Government College of Nursing, Jhansi, and Dr. Biren sir, Principal Dean, NIMS University, Jaipur, Rajasthan, Professor Himanshu Trivedi ji, State President, Gujarat, NTI, Professor Poonam Thakur, National Treasurer and HOD of Department of the Academy of Nursing Science and Hospital. I extend my warm welcome to all the organizing committee members of this conference, especially Chairperson Dr. Manish Kumar, National Secretary NTI, Vice Principal Ratan Jyoti, Institute of Nursing Science, Organizing Secretary Madam Professor Seoli Sarkar Madam, Principal PG College of Nursing, and other members, Suchita ma'am, and other organizing committee members. I heartily welcome to all the organizing committee members. I bid a very warm welcome to our respected NTI committee member from various states attending this conference offline as well as online, especially Professor Purushottam Kumbhatji, State President NTI Rajasthan State, Professor Om Prakash Meghwal ji, State Treasurer Rajasthan State, Bharat Veniwal ji, President All India Student Medical Association, Dhiren Parasar ji, National Spokesman NTI, and others members who are virtually, they have joined, and online they are present offline also physically. I'm extremely delighted to extend my warm welcome to principals from various distinguished nursing institutes from Gwalior and outside of the Gwalior, and all the participants present at auditorium as well as online. So I welcome each and everyone for your valuable presence. I would like to share some word regarding NTI also. The Nursing Teacher Association was established in year 2019 with main objective to create growth and impact in all aspects of nursing education around the world. And to achieve its goal, we are organizing such an international conference. And we hope that in future also we will conduct such type of international conference to our nursing fraternity. NTI is having own nursing journal since 2020, Journal of Advanced Nursing Research. We are publishing. NTI has conducted many of the webinars, 40 webinars, and NTI is having the collaboration with Delhi TNA branch, Society of Cardiac Nurses, as well as Rajiv Gandhi University of Health Sciences, Bangalore. Their theme of today's conference, Innovation in Nursing Key to Progress in Universal Health Coverage. I am pretty sure that today we are going to get advanced knowledge in terms of nursing education practice and what are all the challenges we are facing and discover new era of nursing. I wish this conference enlighten us and provide approaches to deal with the challenges of tomorrow. So I welcome each and everyone. Thank you so much.
Thank you, sir.
Now it is time to invite Honorable Chairperson on the stage, Professor Madhusudan Sir, State President NTAI, Principal Maharani Lakshmibai Government College of Nursing, Jhansi, to introduce the respected resource person, respected Dr. Bimla Mem Kapoor, for keynote address. Thank you, sir, for your presence.
A very warm good morning to you all, respected guest, chief guest, all the principals, National President Dr. Farooq Khan, National Secretary Dr. Manish, National Treasurer Poonam Madam. I welcome you all to National Conference organized by NTAI. It is a great opportunity to speak about someone to whom I grew up reading her books. So it is great pleasure, because during my third year in 2000 I read her book, and it was only the book which has given knowledge about psychiatry, where very few books were available during my undergraduate. So it is again a great opportunity to say few words. Dr. Kapoor Madam has extensive experience in the field of nursing pedagogy and administration, spanning more than 5 decades. She has written her first textbook in psychiatric nursing especially. She has completed her PhD from IGNU as a first scholar. Also completed her post-graduation diploma in distance education, completed her MPhil in nursing, MSc nursing and bachelor's in nursing from a single institute, RAK, which is one of the pioneer institute. She is a chairperson committee and expert in National Nursing and Midwifery Bill 2020 with Ministry of Health, Science and Family Welfare, Government of India. If I'll talk about awards, it will be a evening. So I'll mention few. She's been awarded President's Gold Medal Award for MSc, awarded TK Andenwala Prize for Research, Nehru Foundation awarded for her excellence in nursing, awarded WHO Fellowship as a country representative to Bangkok on rational use of drugs in SEARO, awarded NHS 15th Anniversary Fellowship by British Council of UK, inducted as a member of Sigma Theta 2 International Honors Society of Nursing, elected as a first president of Delhi Nursing Council. She is also awarded by India International Friendship Society Vijay Shri Award and Certificate of Excellence for outstanding services, achievements, and contributions. During the year of 2020, as the year of nurse and midwife, Professor Kapoor Madam was nominated one among the 100 outstanding women nurse and midwifery leaders under the category of innovation, science and health, nurse from India by Women in Global Health. She was also awarded Lifetime Achievement Award by Nursing Scholar Society in the year of 2021. Now, she has written first textbook of psychiatric nursing, volume 1 and 2, established Delhi Nursing Council, and she was the first president. She is also was a consultant, eminent speaker, advisor in nursing curriculum development in states of India, University of Nepal, and other many universities like Brigham University, Zimbabwe, Doha, Abu Dhabi, HCT University, Bhutan, Maldives, Thailand University, Hong Kong, and many others. So, still there are number of achievements and awards she has received. I have mentioned few. So, I welcome Madam for a very important and a new era of learning. Thank you.
Now, thank you, sir. Now it is time for the keynote address, for which I would invite respected Dr. Vimla Kapoor ma'am on the stage, and I also invite Dr. Rakesh Kumar Dhaka, a School of Nursing, ITM University, to felicitate Dr. Bimla Kapoor ma'am with the cluster of flowers, shawl and srifar. Please come on stage, sir.
Good morning, everyone. Are you awake? Okay. Uh, respected members of the dais, especially Dr. Srivastava and other people who have supported the Nursing Teacher Association of India. It's really a proud moment for me because I remember the day when Farooq came to my home. Just like that, he rang up with his friend and he said, I'm coming, ma'am. We have established the NTAI. I did not know that there is a backbone behind him to help. And seeing all of you, I feel really thankful to all of you to be present here and support him and support the Nurse Teacher Association, which is first of its kind in India. We had the Nursing Association, Trained Nurses Association, other unions, but we didn't have anybody to speak about the teachers. And I think that is why I'm here. Otherwise, most of the time I avoid traveling. But because it was first of its kind, and I think because of your support, he is really flourishing. Thank you very much for being with us. Well, let me be very formal, for which I am asked to come and speak about. So, dignitaries on the dais, the PG Institute, which has been supporting Ansh Institute, RJN Institute, who have been supporting to have this international Nurse Teacher Association conference in the country. It is international, first of its kind, physical, because we were not able to have due to COVID. But I'm proud that we are all able to meet here. Dr. Manish Kumar, Secretary, EC members, eminent speakers who are sitting in the first row, chairpersons, very, very dear nursing teachers, very dear students. I can see the work done by you all, and I must congratulate the teachers who guide the students to really start developing discipline and develop themselves from the beginning, and which can be seen in the corridor of the conference hall when we were walking in. Well, it gives me immense pleasure to be present here, not as a keynote speaker, but specific to be a very old or senior teacher. I don't call myself old. I'm young old, senior teachers, because I have seen through what went on in nursing from a very beginning time till now. And there are moments of pride, there are moments of pleasure, but there are moments of distress also when it goes to the clinical side. But learning how the youngsters are coming up and innovating things is really a great pride for me today standing here. Now, when we talk about the theme, I think the theme chosen is very, very appropriate. In nursing, we keep on calling on evidence based nursing. Can I have some water? We keep on talking about the individualistic care. Thank you. The reason is that I think the people in the medical profession would agree with me. Nursing is promotive, preventive, therapeutic, and rehabilitative care. Now, this care which is given to the patients is very individualistic. It is not that you are suffering from CA breast, you are suffering from CA cervix, or you are suffering from prostate CA, or you are suffering from heart disease. It is not that. We take it as Bimla Kapoor as a patient, A as a patient by name. So it is very individualistic, you know. The symptoms may be common, but the needs are not common, because me as an individual have a family, have my children, have my social circle. So I want that I should be considered as an individual. And in nursing, to our students, from the first day itself, we teach them this individualistic care. And that is why the student nurses, when they go to the clinical area, we tell them to introduce yourself and also get introduction of the patient and call the patient by name and not the bed number. That is why I call it as individualistic care. Also, there's a lot of passion and compassion which is to be practiced by the nursing people. It's a very hard task. Lot of innovations, lot of research studies have been done for the teachers how they should teach in the class. If you ask from me as a young teacher, when I was teaching, there was my senior sitting at the back of my class. You know how my hair was tied up, how did I put my sari to look mature, to look tall, you know, that I can see the last student sitting. Not that it's a personality. It's a personality of a teacher or aura of a nursing teacher which has to go till the last student who is sitting. And that's what was taught to us as a teacher. And fortunately, we practiced that. And I think none of the teacher objected when we sat at the back of the class and when we came back and told them that how good she was in one of the examples, but how good she could have been in the other example where it was not done so properly. So look at the innovation done by the teachers, you know. They may look like that nothing was done, but I think teachers, nursing teachers, kept on improving day after day. I was talking to Dr. Gopi, who is going to be a resource person. I'm so proud that he is talking about informatics. And he himself is preparing to learn more and more about informatics in nursing to improve the nursing care. Let me tell you, the nursing practicing personnel are the offshoot of the nursing teachers. So we should not forget today, that if teachers are not there, you cannot have the students, you cannot have the profession growing up. So that's what is the importance of you all sitting over here. That's what the responsibility you have, and that is why more and more of research is required, more and more of inputs are required to improve the nursing profession. I understand, I just let me tell all of you, of course, except the nursing professionals, we teach physics, we teach microbiology, we teach biology, we teach social sciences, we teach behavioral sciences, psychology, sociology, we also teach anatomy, physiology. Look at the subjects which are to be taught to these young girls by the teachers, and look at the preparation the teachers have to do to see that how well you are able to teach to the students all these subjects. Now, because why we are teaching all these subjects as teachers? Because we are dealing with the human being, we are not dealing in the lab. And that is why you will find some of the I remember one of the young teacher of my college, where I was a teacher. She came back, everybody thought I taught one of the topic, uh, now we call end of care, but those days we were calling that how do we give care to the dying patient, death and dying. Nowadays we use the word end of life care. I mean, it's just a nice word rather than death and dying. It was known that I used to take that class as a teacher very well. But one of my students, who was a post certificate student going through a teacher training program at RK College of Nursing, believe me or not, she is now in Australia and she is CEO of HIV/AIDS of whole of Australia. But she took the class. Janet Othro was her name. She took a class. I think I have never heard that kind of end of life class. So you can imagine the potential the students have. But as teachers, we need to encourage, and I incorporated certain aspect of her, what she taught in the class as a teacher next time. So you learn, a teacher learns to innovate the things and teach better to the students. Well, we know medical technology is moving very fast, but nurses have to innovate every day. Look at during COVID period, the PPE the nurses used, such a big PPE they used, and they innovated how to manage their basic need of food and other biological need. I mean, salute to those nurses who worked in the COVID units, how they managed that. And we didn't have time to do the research that time. But those are small little things which put many of the researchers to do a systematic research and innovate the technique. God forbids, in future, if we have such a tragic moments for the care of the patients, how do we improvise these kind of facilities? Now, innovation in nursing necessarily does not mean that we have to sit in a research lab or we have to take a leave. What you can do is, the small little things can be done, the solution can be found out, and we go to a research cell. Unfortunately, for nursing, we do not have a research cell in the hospitals. Sir, you are honorable trustee of this very prestigious institute. But if you have a nursing cell, the cost of patient's care will get reduced, because it depends upon the care patient gets after the work is done by the surgeon or after the care is given by the specialist. So nursing care improves if lot of small little ideas is given to research cell, and also the solution that how did I manage this particular patient. Now this research cell researcher nurse sits down and says, oh my lord, let us do a quick research and come out with the result, and that becomes an innovation. See, it's a small thing, it's an immediate need which is met, but then the solution is for the long run, and that what becomes the innovation in the nursing profession. Now, nursing is key to universal health coverage. That is the reason that community health officers course was started, and it was given to Indira Gandhi National Open University, seeing the scope and seeing to the reach of the students. And it happened during Professor Pitiko's directorship, that she took the leadership, that she will make the program. They made the module and it is running all over the country. But why out of whole health system, nurses were picked up to look after the community as a community health officers? Because nurses could reach to the people. They are good at communication skills. because they are taught. I'm not saying doctors are not good, but they are not taught. Only 30 hours is added. That also, I think in 2005, it was added in the medical curriculum. But in the nursing curriculum, communication skills and interpersonal skills are added from the day one when the students enter in a nursing. So they can reach to the public, they communicate, they relate with them, and the people are able to understand. And that's where the community health nursing officer course was handed over to the nursing professionals with a BSc nursing, and I think it is going on very successfully, and I hope that we are able to bring a change in the society because of this. Now, research has shown that nurses are there to bring a change. What change in which areas? There are numberless areas, There is a gap in nursing education and practice. Why I'm saying this, I worked in a government sector, RK College of Nursing, which is a Southeast Asia region, first of its kind college it was. Now we have excellent colleges comparable. I will not say that is the only college, but that is one of the first colleges in the country. And then I worked in Indira Gandhi National Open University. With all my phobia I had entered, but I tell you, the scope which Indira Gandhi National Open University provided to the nursing professionals, Professor Pitikol and me, we worked, shoulder to shoulder, and we know how much difficulties we encountered, but we really discussed, we argued, and we came out with a good result all over the country and also world across. They recognize the distance education model of IGNU. In the UK, when I was presenting a paper, the UK was shocked because we took UK Open University model. Indira Gandhi National Open University took UK Open University model. But when I presented that how we conduct the practical, which is supervised by the teachers, and how we train the teachers to conduct those practical, they were surprised. They said, we only are able to teach theory, but how well you are able to give hands-on to the nurses. No nursing, whether you do master's nursing, BSc nursing, and if you are PhD nurse also, whatever nurse you are, remember, we are basically nursing professionals. And if I cannot give effective care with my PhD has no meaning. I have to improve the nursing care of the patient. That is where people should be able to say, how come you are a different nurse than the other nurses? So your education, your practice should speak, and that's what is very important when we do the innovation. Closing the gaps in nursing curriculum and specialized field. Very, very important. This is another nursing innovation we have to think about. Also, nursing for well-informed clientele and clientele for the corporate sector. Often, when I go for certain meetings, the private sector say, ma'am, the nurses are not ready for the corporate sector. I have my two opinions. The teachers have taught best of the curriculum. Now, when they go for the practice, the Cancer Institute will have different requirement and Max will have different requirement. When you do the induction program, please focus on that rather only talking about the paperwork, You should say what are the procedures required. For example, in communication skills, in government sector, just to tell you that one nurse at night or two nurses at night looking after 48 and 50 patients, or evening four nurses cannot really communicate, because even though they take temperature of the patient, 1 minute if you put in the mouth, 1 second to wash and 1 second to dry and put in the Dettol bag. Of course, nowadays we have got different kind of thermometers, but does the government hospital have that? I don't want to quote a thing, but a person is sitting right in the hall. When I asked, do you have, during COVID, I'm saying during active COVID, I just asked one question, do you have the hand sanitizer in each of the cubicle? Because I know that hospital setup. And the person said, ma'am, you are asking me, we don't have sanitizer in each of the cubicle, which has got 6 beds. And there is only soap, and soap also not liquid soap, that old Lux soap. I do not know when the government will learn the nurses also need a liquid soap to wash their hands rather than having that small cake of liquid, the Lifebuoy soap. So that was during COVID period, and I was shocked knowing this, that and from that institute, big, things would come up which government will follow. But ground reality where nurses work is we only know that with what kind of restricted resources we work. So in the corporate sector, we have to tell them that these nurses have worked and learnt in the hard situations. Now you do the induction and give us the result, and we will innovate the technique as nurses, teachers, to see that it is implemented all over the country. So these are some of the innovation. There are many we can do. Decreased access and equity of nursing professionals. I mean, you have the nurse patient ratio, doctor nurse ratio. The nurse patient ratio, last being the chairperson in Ministry of Health and Family Welfare on the nurse patient ratio, principal secretaries of health except Sikkim, Nagaland, Tripura, we are not able to get a data. The government is not able to get a data. So how the nursing team sits down and works on the nurse patient ratio? We can only talk of innovation if the data is available with us. So we are struggling hard to get those kind of data. Also facilitating specialization. Even in this hall, you will have a specialized people, but they are not given specialized responsibility. Being in charge of a clinical area of that specialized unit. I mean, the OB-GYN nurse, the mental health nurse, the pediatric nurse, they can make a lot of decision on their own. But we had to really struggle to start with a nurse practitioner course. And when we are starting a nurse practitioner course, we really do not know what are their career pathways. So we need to innovate first the career pathways and then develop the courses, so that the nurses who do the course do not get frustrated or leave the country and go abroad. But now I don't mind if our nurses go international, because many of them, they learn and come back and contribute to the nursing profession. Well, quality assurance in nursing education has to be there. Nursing Teacher Association must do a research and find out which are the colleges who are not able to give a clinical. My dear friends, simulation was there in 1964-65 when I was a student. Simulation was there. We as teachers taught rice tube feeding by hiding it in the hot water bag and covering the patient and sucking out that this is a gastric juice, then feeding through the rice tube, and the students will get flabbergasted. Where is the fluid going? This dummy cannot speak. It's a dead dummy. Then came the mid fidelity simulators, then came the high fidelity simulators. We should give the training on all these simulators. But please, my request is, you cannot teach the student unless they go and touch the pulse of the patient, unless they speak with the real patient. So please place the students in the patient care, but have the simulators. High fidelity, see, high fidelity simulator is 1 crore 40,000 plus the maintenance is required. So you can have 3-4 colleges innovate a technique that how each one of them can have 6 days training on the innovators, simulators. High fidelity, mid fidelity you can buy because it is not that expensive and it goes for a long run, and low fidelity you already have in your institutions. But innovate it, just don't keep on asking the administration, we need the high fidelity. If 4-5 colleges get together, students can come in turn and then you work on the high fidelity. Because I have seen in Max, we had to lock up after some time all the high fidelity when I was advisor to them. When I worked with Berkeley as dean, academic dean, we had to get the people. It is only Bhutanese, because government of Bhutan helped them. So 100 nurses of Bhutan, we could train them on high simulators. But otherwise, whether we should have high fidelity simulator in each college is a very, very expensive affair. So you can club together, innovate a technique that how we can train everybody. Nurses focus on mental, physical, and psychosocial well-being. So innovation is needed in quality care, seeing the psychosocial needs of the patient. I think COVID has given a real example that how mental well-being of team members, of your co-workers, doctors, nurses, patients, their relatives is required. So psychosocial needs are very important. So as clinical setting nurses, we do not have much time to think. If the patient who is suddenly gasping or suddenly having breathlessness, you don't have time to think what research studies you have done. Quickly, based on what you had learned and what comes in your mind, you give the position, you start giving the oxygen without waiting doctor's prescription. Unfortunately, the private sector nurses cannot start on their own the oxygen. They cannot even give hot water back to the patient. This is what we need to innovate and tell to the private sector that what are the scientific tasks which the nurses have learned, and tell the private sector that how important it is for nurses to make certain decisions. Well, I think I should not be taking much more time, but there's so much to say that in nursing innovation, universal health coverage is basically being done by the nursing professional with collaboration of the medical fraternity and all the team members. Because we cannot say that one particular profession can only do the work, it has to be team, and we have to collaboratively work on this. We need to really work on pressure ulcer, we need to work on stress, we need to work on relationship building and collaboration. We need to work on increasing the representation in the government policies, government techniques. We need to work on automatization of the services, which I think one of the speaker is going to speak. And I know that the speakers of today are very, very learned people. You will gain through all these things. And also the nursing teachers in the country to innovate and bring changes in nursing practice. Basically, for one thing, remember, for quality of patient care. All of us, we exist only for one person in the hospital, and that is a patient. And most of the time, we forget about the patient, because if there's no patient, none of us are required. So let us innovate to give best quality care to the patient. May I also request NTAI and myself as a part of it, that let us have the representation of teachers in all these committees, and the very big leaders are sitting here who are running the hospitals. Probably if they make you a part of the policy decision, you'll be able to contribute as nursing professionals. Also work on sabbatical leave of the nurses working in the private and the government sector, so that they can do some research and come back. Fellowship can be done, exchange programs can be done, and that will bring back to you more and more. From the Cancer Institute, the best of the nurses can be sent to international level, or even Rajiv Gandhi Cancer Institute or any other international level. The teachers can be given for exchange program. They can be invited in our country. The foreign dignitaries are ready to come to India to learn more and more, and they are ready to have the exchange program. So we can go those kind of things and see that how our nursing teachers improve and bring more knowledge and skills for the students, so that they can be best nurse practitioner. Thank you so much. God bless you all. Thanks very much.
Thank you, ma'am, for your informative words. Now we have our guest, Dr. Gunjan Srivastav, ma'am, Medical Oncologist, Cancer Hospital and Research Institute. Welcome, ma'am. I request Mrs. Varsha Prajapati, ma'am, Assistant Professor, PG Con, to welcome Dr. Gunjan Srivastav, ma'am, with welcome garland, shawl, and shrifal.
The next dignitary to honor us with his presence hardly needs any introduction. He has made all of us proud by his distinguished work in numerous capacities. It is my privilege to introduce him to this wonderful gathering with his line, नजर नजर में उतरना कमाल होता है, नफस नफस में बिखरना कमाल होता है, बुलंदियों पे पहुंचना कोई कमाल नहीं, बुलंदियों पे ठहरना कमाल होता है. Please welcome Dr. B.R. Srivastav sir for his wonderful words. Thank you.
डॉक्टर कपूर, मैं ये कहना चाहूँगा कि एक बार अगर गावस्कर हम लोगों के टाइम में या सचिन तेंदुलकर बैटिंग करने पहले आ जाए तो उसके बाद के बैट्समैन की क्या हालत होगी वो ये समझ सकते हैं। आपके इतने अच्छे उद्बोधन के बाद मुझे ये समझ में ही नहीं आ रहा था, मैं बैठा था कि अब मैं क्या बोलूँगा। आपने हम लोगों की इतनी ज्ञानवर्धक बातें कही हैं। वी आर रियली थैंकफुल फ्रॉम आवर हार्ट दैट वी आर अटेंडिंग दिस प्रेस्टिजियस प्रोग्राम। आज के इस समारोह के गेस्ट ऑफ ऑनर मैं कहूँगा कि जो हमारे ग्वालियर के जवाहरों का जो मुकुट है उसके कोहनूर हैं डॉक्टर पुरेंद्र भसीन, डॉक्टर जैन एंड डॉक्टर फारूक, डॉक्टर मनीष, सिवली सरकार मैडम, डॉक्टर गुंजन and galaxy of elegant fraternity which is sitting in this prestigious holy auditorium. Dear students, colleagues, सर्वप्रथम तो मैं याद करना चाहूँगा उस शख्सियत को जिन्होंने की नर्सिंग एजुकेशन, ट्रेनिंग ऑफ नर्सेस को इतना महत्व दिया कि एट द टाइम ऑफ फाउंडेशन ऑफ द इंस्टीट्यूशन, बिसाइड द कंस्ट्रक्शन ऑफ द वार्ड्स फॉर द पेशेंट, ही स्टार्टेड कंस्ट्रक्टिंग स्कूल ऑफ नर्सेस एंड हॉस्टल ऑफ नर्सेस। ऐसे थे हमारे आदरणीय संस्थापक न्यासी स्वर्गीय श्री शीतला साहाई जी। 42 years back he started this nursing training. दो लाइनें कहना चाहूँगा कि मंजिल तो मिल गई है मगर सोचते हैं सब रास्ता दिखा के आप ना जाने कहाँ गए। He was such a person devoted totally to upliftment of this nursing fraternity. Day and night he worked for this. And you can imagine that nurses trained in this school of nurses, college of nursing, they are spread it not only to this country but many prestigious hospitals of the world. उनका साथ दिया श्रीमती कमला सहाय जी ने, जो उनकी धर्मपत्नी हैं थी। उनकी याद में कहना चाहूँगा आई एम एज ए ट्रस्टी कि जब भी मेरी कश्ती सैलाब में आ जाती है माँ दुआ करती हुई ख्वाब में आ जाती है। ए अंधेरे जा तेरा मुंह काला हो गया, माँ ने आंखें खोल दी और सवेरा हो गया। ऐसी थी श्रीमती कमला सहाय जी, जिन्होंने कि शीतला सहाय जी के साथ कंधा मिला के इस संस्थान को विकसित किया। साथियों, उसके बाद कमान संभाली श्रीमती अर्चना श्रीवास्तव जी ने। उनके बारे में एक शब्द बहुत अप्रोप्रिएट है, ड्यू टू सम हेल्थ रीजन्स इज़ नॉट हियर, कि सी जस्ट लाइक ए कोकोनट। ये सारी जो नर्सिंग फैकल्टी यहाँ बैठी है और स्टूडेंट्स हैं पीजी कॉलेज ऑफ नर्सिंग के, दे रियलाइज दैट शी इज़ लाइक ए कोकोनट। वाई कोकोनट? आई एम टेलिंग दैट शी इज़ हार्ड फ्रॉम आउटसाइड। शी विल try to teach all the discipline at any cost to the faculty and to the student, and from inside she is very polite and she will always take care for the welfare of the student and fraternity, and she is the person whose heart level has provided this PG College of Nursing to such a great height. I must remember her name today. She is not here because of some health reason. Friends, I am a clinician doctor, retired professor from medical college. मैं हमेशा इस बात का महत्व समझता हूँ, जैसे मैडम ने कहा कि टीचर, हम बहुत सारी टेक्निक्स में आज एडवांसमेंट ग्रहण करते जा रहे हैं. एज ए सर्जन आई कैन से previously we were operating physically, laparoscopic surgery came, and now robotic surgery has come. Diagnostic field, simple x-ray, ultrasound, CT scan, MRI, PET CT, PET MRI, artificial intelligence, so many developments has been done. It means that we are teaching our faculty is learning, and students are learning new techniques for the treatment of the patient, for the welfare of the society. But the very important thing which madam told, that whether we are adequately teaching the communication skill to the student, whether we are adequately teaching them the value of the ethics, whether we are really teaching them that what are their exact responsibilities when they are coming in the contact with the, I must not say only the patient, because now the role of the nurses, they are not confined just to give the medicine to the patients. They are the leader of the society. They play many important roles. तो आज यह विचारणीय प्रश्न है कि क्या हमारे टीचर्स वह संस्कार विद्यार्थियों को दे पा रहे हैं. गुप्त जी ने लिखा है कि हम कौन थे, क्या हो गए और होंगे क्या अभी, आओ विचारें बैठकर ये समस्याएं सभी. एंड आई थिंक दीज कॉन्फ्रेंसेस, सेमिनार्स, दे आर मेंट फॉर दैट पर्पस, कि हम ये विचार करें कि क्या समाज हमसे चाहता है, क्या मरीज हमसे चाहता है. जैसे डॉक्टर कपूर ने कहा कि इट इज नॉट द बेड नंबर 42, दैट इज इंपॉर्टेंट. महत्वपूर्ण इस बात का है कि उस बिस्तर पर लेटा हुआ व्यक्ति राधे श्याम, उसकी क्या आवश्यकता है. हो सकता है एज ए नर्स हम उसको दर्द की दवाई दे दें, हम उसको बुखार की दवाई दे दें, बट बिलीव डियर स्टूडेंट एंड टीचर्स, अगर आप जाएं, उसका हाथ पकड़ें और उसके पास 5 मिनट के लिए बैठें और टाइम दें, पूछें कौवी राधे श्याम कैसे हो, आज कुछ नाश्ता वगैरह घर से आया कि नहीं आया, क्या नाश्ता किया, कैसा लग रहा है तुम्हें, और तुम्हारी बच्चे कैसे हैं, क्या हैं. व्यक्ति जो कहता है कि डॉक्टर भगवान है या नर्स भगवान है, मैं मानता हूं कि वो आज भी गलत नहीं है. हमको ईश्वर ने जो वरदान दिया है कि हम दुखी व्यक्ति के डायरेक्ट संपर्क में आके उसकी सेवा करके जो प्रतिफल प्राप्त करते हैं, वो हमको उस सम्मान का बताता है, रिस्पॉन्सिबिलिटी देता है, जो कि ईश्वर को या देवी को दी जाती है. लेकिन ये हमारा कर्तव्य है कि जब समाज हमको भगवान का रूप देता है, समाज जब हमको इतना बड़ा सम्मान देता है, तो क्या हम समाज की अपेक्षा के अनुरूप, उनके एक्सपेक्टेशंस के अनुरूप काम कर पा रहे हैं कि नहीं कर पा रहे हैं. और यह विचारणीय प्रश्न है, नॉट ओनली फॉर द स्टूडेंट्स, ये विचारणीय प्रश्न है ट्रस्टीज के लिए, संचालकों के लिए, प्रिंसिपल्स के लिए एंड टीचर्स के लिए. इफ नॉट, देन वेयर इज द फॉल्ट. मैं आपका ज़्यादा समय नहीं लूँगा, बिकॉज लॉट ऑफ साइंटिफिक एक्टिविटीज हैज़ टू बी डन. एक छोटा सा उदाहरण मैं देता हूँ आपको. आई वॉज प्रोफेसर देयर इन मेडिकल कॉलेज. एक मरीज का मैंने ऑपरेशन किया और वो मरीज मेरे से बोला, दूसरे दिन के साथ मेरी छुट्टी कर दीजिए. मैंने कहा भाई अभी तो आपका 1 दिन हुआ है ऑपरेशन के लिए, क्यों आप छुट्टी चाहते हैं. मैंने समझाया, वो रुक गया. फिर दूसरे दिन फिर आया, बोले साहब मैं तो जाना चाहता हूँ और जब आप कहोगे तब टाँके निकलवाने के लिए आ जाऊँगा। तो मैं उसको एक अलग कमरे में ले गया और मैंने उससे पूछा कि परेशानी क्या है, क्यों जाना चाहती हो? तो उसने मुझसे कहा कि सर आपके जो ये जूनियर डॉक्टर्स हैं, स्टाफ है, इसका बिहेवियर मुझे अत्यंत कष्ट पहुंचा रहा है, पीड़ादायक है। मैंने कहा आप चिंता मत करो, आई विल सी दिस मैटर, आप रुको। जिन लोगों के बारे में उसने मुझे कहा, मैंने उनको बुलाया, डॉक्टर्स को, नर्सिंग स्टाफ को। मैंने कहा कि ये व्यक्ति आज यहाँ से दुखी होके इसलिए जा रहा है कि जिन उम्मीदों से वो यहाँ आया था, हम उसकी उन उम्मीदों को पूरा नहीं कर पाए। एज ए टीचर मैंने कहा मुझे आपसे शिकायत नहीं है, मुझे खुद से शिकायत और शर्मिंदगी है कि मेरे टीचर्स ने, मेरे माता पिता ने मुझे ऐसे संस्कार दिए कि मैं अपने मरीजों से कभी इस तरह का व्यवहार न कर पाया, और वो संस्कार मैं आप लोगों को नहीं दे पाया। शर्मिंदगी मेरी है, मैं खुद शर्मिंदा हूँ। They realized and they promised me that in their life they will never do such type of things. मैं कहना चाहता हूँ ये जो आज की कॉन्फ्रेंस स्पेशल कॉन्फ्रेंस है, बिकॉज इट इज़ फॉर द टीचर्स एसोसिएशन। सही टीचर वही है जो कि स्वयं एक ऐसा एग्जाम्पल सेट कर सके, जैसा कि मैडम ने कहा, when you enter in the class, when you introduce yourself as a teacher, when you take and start taking the class, every action matters. जो स्टूडेंट है वो हर चीज़ आपकी ऑब्जर्व कर रहा है, और अगर आप एक ऐसा उदाहरण प्रस्तुत करते हो तो आपको सिखाने की ज़रूरत नहीं है कि आप मरीज से पोलाइटली बोलें, आप मरीज के साथ ये व्यवहार करें। क्या होता था पहले गुरुकुल में? पहले गुरुकुल में यही तो होता था कि बच्चे जो टीचर्स की हैबिट थी उनको एम्बाइब करते थे, उनको ग्रहण करते थे कि गुरु हमारे 4 बजे सो के उठते हैं, फिर गुरु हमारे ये करते हैं, ये करते हैं, और वो सारी आदतें ऑटोमेटिकली स्टूडेंट्स में पास ऑन हो जाती थी। हम भी चाहेंगे कि आज की जो फैकल्टी है, आज के जो टीचर्स हैं, वो अपने आचरण में, अपने व्यवहार में वो परिवर्तन लाएं कि उनके स्टूडेंट्स जीवन भर उनको याद रखें कि नहीं, वो हमारे टीचर थे, उनके हमने ये सीखा, और हम उसको जब अपने दैनिक जीवन में उपयोग करते हैं। मैं फिर कह रहा हूँ कि नोबडी इन दिस वर्ल्ड कैन प्रिवेंट यू टू हैव द स्टेटस ऑफ गॉड और देवी इफ़ यू आर डूइंग योर ड्यूटीज़ एज पर एक्सपेक्टेशन ऑफ द सोसाइटी एंड टू द सफरिंग ह्यूमैनिटी। मुझे बुलाया, आपने यहाँ मौका दिया, मैं उसका आभारी हूँ। कल एक कार्यक्रम था जिसमें मुझे बुलाया गया था चीफ गेस्ट सेवा भारती का, तो उस सेवा का ही कार्यक्रम था। तो उस कार्यक्रम के लिए मैंने कुछ 2 लाइनें लिखी थी। मुझे बड़ा एप्रोप्रिएट लग रहा है कि मैं 2 लाइनें आज भी बोलूं। मैंने कल बोला था, जीवन का निर्माण यहाँ, जीवन का निर्माण यहाँ नित्य प्रतिदिन चलता है। जीवन का निर्माण यहाँ नित्य प्रतिदिन चलता है। स्वर्ग यहाँ मत खोजो, स्वर्ग यहाँ मत खोजो, यहाँ मानव ढलता है। स्वर्ग यहाँ मत खोजो, यहाँ मानव ढलता है। और एंड वी आर ऑल हियर टू बी ए बेटर ह्यूमन बीइंग, टू बी ह्यूमन बीइंग, दैट इज़ द एम ऑफ सच कॉन्फ्रेंसेस एंड सच सेमिनार्स। मैं हृदय से आपका धन्यवाद करता हूँ कि इस भव्य कार्यक्रम को आयोजन करने के लिए आपने इस शीतला सहाय सभागृह को चुना। और लास्ट में स्वागत के रूप में 2 लाइनें कह के अपनी बात समाप्त करूँगा कि आप इतनी डिग्निटीज, इतनी जगह जगह से यहाँ आए हैं कि स्वागत ही है शब्द यहाँ जो बोला जा सकता है, इसमें छुपा सम्मान भाव नहीं तोला जा सकता है। फूलों जैसे कोमल शब्द नहीं हो सकते, फूलों जैसे कोमल शब्द नहीं हो सकते, किंतु स्वरों का कंपन समझा तो जा सकता है। आप सभी का स्वागत, अभिनंदन। मेरे को बुलाने के लिए बहुत बहुत धन्यवाद।
Thank you, sir, for your inspiring words. With equal pleasure and respect, I invite the guest of honor, Dr. Purendra Basin, sir, Chairman, Ratan Jyoti Charitable Foundation. Please grace us with your kind words.
Thank you. I am really confused and speechless by the words of wisdom and the introductory lecture given by Mrs. Beena Kapoor. And after that, the words of wisdom and by and the grace of this profession and the grace of this holy hall and this place by which we are all here by Dr. B.R. Srivastav. So I am really speechless at the moment. But as has been said to me on the dais, Dr. Khan, Mr. Abhinav, Shri Trustee Shri B.R. Srivastav sir, my teacher, my mentor, my great this thing. I really admire him as a great person because to carry forward the dream of such a innovative and such a visionary person, Shri Shitla Sahai ji, was definitely a very big task. And he has shouldered that very beautifully. And rather, I should say, he has shouldered it and he has taken it further in miles and in long way, and he has grown this whole area and this cancer institute and the allied sciences allied sciences system in a way which matches with the national and international standards. So I really admire him as a great person. Principal Mrs. Dr. Seali, Dr. Manish Kumar, and Dr. The leader of the new generation, Dr. Gunjan Srivastav over here, all the faculties from different places of the country, and dear friends and the students over here. As a doctor, I know the importance and value of the nursing care. We all know that nurses are the key persons to be the key person in passing the message that this patient is not well today. Before the patient comes to the nursing station or the patient goes to the doctor, the nurse will tell this report is not well, this report is not good, sodium is low, potassium is high, whatever it is, or this patient is dipping. Now, immediately the doctor's brain start working what has to be done, how to do, whether she is correct or not. Because nurses and doctor, the relationship of them is like a roli chawal. रोली पहले लगती है, नर्सिंग केयर जो होती है वो दिन भर रहती है पेशेंट के साथ, और चावल जो है वो एक अक्षत जो है वो रहता है, डॉक्टर आता है थोड़ी देर के लिए और उस पीरियड में वो सब कुछ समझ करके और ट्रीटमेंट का गाइडलाइंस, सर्जरी कर रहे हैं तो उस समय तो ये सब करके डॉक्टर विल गो अवे, बट द नर्सेस हैज टू बी देयर throughout the day, throughout 24 hours, and they know each and everything, how much urine has been passed, how many times the stool has gone, how many times there is a fluctuation in the barometry and the thermometer reading, and many other things. And now, as Dr. Beena Kapoor has very nicely said, and I appreciate the theme of this conference of innovations in nursing and key points, because medical field is the only field in the world which is innovating and growing at the most fastest of the pace than any other profession, I should say. And this is the blank or a very important thing. And nursing care along with the medical care is also growing, what Dr. Beena has also said, because now gadgets have come into the play. Lot of new things have come, as Dr. Srivastava was saying. Now, after the laparoscopic surgery, robotic surgery, lot of instrumentations have come in the diagnostic field and other things. So nursing care has changed, and they have to change themselves. They have to learn new things. But the basic care, basic principle of nursing, that is empathy, always will be there and has to be there and will always remain. And without the empathy, without the alertness of the nursing care, in the nursing care, you cannot be successful, you cannot be remembered, you cannot make an imprint on the patient's mind. And I tell you, no big hospital can survive or run without a good nursing care. The hospital runs, the name of the hospital is not because of that machine or that doctor, it is because of the nursing care, good nursing care. And this good nursing care gives the name to the doctor, gives name to the institute and to that hospital. So the importance of, they are the key pillars of this healthcare system, and one of the important role is given to them. And I really do not have any second thought what Dr. B.R. Srivastava was saying. Sir was saying that nursing and medical fraternity, they are equal to God. आज की तारीख में हमारे इंस्टीट्यूट में मैं देखता हूँ जो पेशेंट है वो डॉक्टर का नंबर तो हो ही जाता है, मिल ही जाता है, उस नर्स का नंबर जो उसका जिसने उसकी सबसे ज़्यादा केयर की है उसका लेके जाता है, उस मेल नर्स का, उस फीमेल नर्स का, कि इसने मेरी सेवा की, मेरी ऐसी सेवा की जो मेरे घर वाले भी नहीं कर पाते, तो उनका नंबर लेके जाता है, उनके बर्थडेज पे उनको विश करता है, उनको नए साल में विश करता है, उनका फैमिली इतनी बड़ी हो जाती है जो वो डॉक्टर की नहीं लेता, जो हॉस्पिटल के एडमिनिस्ट्रेटिव स्टाफ का नंबर नहीं लेता, क्योंकि उसको तो वो पैसा दे के जा रहा है, डायरेक्ट वो उसको वो कर रहा है। लेकिन नर्सेस ने उसके लिए गिफ्ट देते हैं। मेरे को याद है 2 दिन पहले माय सीनियर ऑप्टोमेट्रिस्ट and a nursing person, he got on his birthday he received a sweater from a patient, female patient. She came, भैया आपने मेरी बहुत अच्छा ख्याल रखा during my surgery, आपका बर्थडे आया, मैंने फेसबुक पे देखा तो मैं आपको देने आई हूँ. That old lady came and gave sweater to just 2 days back. So all these things I tell you nurses, and believe me, और लाइफ का एक मेरा प्रिंसिपल और फंडामेंट है कि लाइफ इज नॉट ए मैराथन, लाइफ इज ए मैराथन, लाइफ इज नॉट ए 100-मीटर रेस. लाइफ को हमें लंबे समय तक जीना है और हमें हर चीज का ध्यान रखना है, और हमें अपने, जैसे गणेश जी की आज वंदना हुई तो उनके कान क्यों बड़े हैं, उनकी सूंड क्यों बड़ी है, उनका पेट क्यों बड़ा है? कान इसलिए बड़े हैं कि सब कुछ अच्छे से सुन सके, बहुत ध्यान से सुन सके. तो नर्सिंग केयर में भी वो जरूरी है कि हमारे कान, हमारे सारे श्रवण यंत्र, सेंस ऑर्गन्स, हम उनको अलर्ट रखें और उनके द्वारा हम ग्रहण कर सकें और तुरंत हम डॉक्टर को इन्फॉर्म कर सकें कि दिस इज़ द डिटोरेशन, दिस इज़ द इम्प्रूवमेंट विच इज़ हैपनिंग, और उनके अटेंडेंट्स को भी इन्फॉर्म कर सकें. सिमिलरली हम जो है कुछ बातें जो गणेश जी के उसमें है कि उनका पेट इतना बड़ा क्यों होता है कि कुछ बातें वो अंदर रखते हैं, वो बाहर नहीं आती. वो तो ऐसे ही मेडिकल फील्ड के अंदर भी हमारे को कई चीज़ें ऐसी हैं जिनको कि हमें अंदर ही रखना है और हमको अपने रोज़मर्रा के उसमें दिनचर्या में या किसी और को नहीं बताना है. वो अपने अंदर ही ग्रहण करके रखना है, क्योंकि ये चीज़ें सबके लिए भलाई के लिए होती हैं। सो मैं इन्हीं शब्दों के साथ आपसे विराम लेता हूँ, कार्यक्रम बहुत लंबा हो रहा है और साइंटिफिक सेशन हैज़ टू स्टार्ट। आई रियली थैंक यू for giving me this opportunity to be in front of you and to be part of this program. Thank you all. Thank you.
Thank you, sir, for your kind words. And now, the next event in the series is the memento distribution. Prior to it, I would like to recite some lines in honor for our dignitaries. These lines are of Hindi poet Ram Avtar Tyagi. इस सदन में मैं अकेला ही दिया हूँ, मत बुझाओ, जब मिलेगी रोशनी मुझसे मिलेगी। पाँव तो मेरे थकन ने छील डाले, अब विचारों के सहारे चल रहा हूँ। आंसुओं से जन्म दे देकर हंसी को एक मंदिर के दिए सा जल रहा हूँ। मैं जहाँ धर दूँ कदम वह राजपथ है, मत मिटाओ, पाँव मेरे देख कर दुनिया चलेगी। जी रहे हो जिस कला का नाम लेकर, कुछ पता भी है कि वो कैसे बची है। सभ्यता की जिस अटारी पर खड़े हो, वह हम ही बदनाम लोगों ने रची है। मैं बहारों का अकेला वंशधर हूँ, मत सुखाओ, मैं खिलूँगा तब नई बगिया खिलेगी, मैं खिलूँगा तब नई बगिया खिलेगी। नाउ आई मे humbly request Dr. Farooq Khan sir to present our chief guest Dr. B.R. Srivastav sir with a memento as an expression of our gratitude. Please sir. In continuation, I would request Shri Purushottam Kumbhaj sir, State President NTAI Rajasthan, please come on a stage to offer memento to our guest of honor, Dr. Purendra Bhasin sir. Please come on a stage, sir. And now Professor Shivlahari Sharma, Principal Ans College of Nursing, is requested to come on a stage to offer memento to our special guest, Dr. Abhinav Jain sir. Dr. Professor Shivlahari Sharma from KS Nursing College. I request to join us Professor Dr. Madhusudan sir, State President NTAI, to present memento to Dr. Bimla Kapoor ma'am as a symbol of appreciation. Please welcome sir. No ma'am, please come on stage. Thank you all our dignitaries to take part in memento distribution ceremony, and now I would request all the senior dignitaries on the stage to please get refreshment on the mini conference hall of CHRI, please. So we are going ahead towards scientific sessions. You are requested to sit on their seats, my dear participants. We will soon organize the scientific sessions which we had come forward for this international conference to 2023. Please have your seat. Mrs. Jackie L. Michael will be online from Texas, USA for the first scientific session. We request you to don't go anywhere, my dear participants. We will hold the scientific session one after the group photo of the senior dignitaries. Thank you. My dear participants, please hold your presence just only for 5 minutes. We will just going to start the first scientific session. Ladies and gentlemen, this is Jackie L. Michael on your screens. Soon we will start the first scientific session in which Jackie ma'am will introducing herself and giving wonderful presentation. It will now be the term of respected chairperson, Professor Himanshu Trivedi sir, a state president, NTAI Gujarat, principal of Panchamrit Institute of Nursing, Nicole, Ahmedabad, to walk up on the stage for the further proceedings of first scientific session. You are welcome, sir. Put your hands together for Himanshu Trivedi.
Manjay, slide please. Very good morning, everyone presented here. Uh, guest is not here, but I should present respected Dr. Srivastava sir, chief guest, respected Dr. Purendra sir, respected Dr. Farooq Khan, respected Dr. Bimla Kapoor madam, respected Pitikol madam, respected Gopi sir, and all my NTI team, and all my students, all my teachers who are present nationally and internationally this conference. Myself, Himanshu Trivedi, Professor Himanshu Trivedi, Principal, Panchamrit Institute of Nursing, Ahmedabad, Gujarat, and State President, Gujarat President. Here, one of the eminent speaker, Dr. Jacquelina Lal Michel. I'm going to read a biography of her. She has a vast diligence with the many qualifications, many experience over here. So I read currently she is an associate chair advanced practice nursing in clinical assistant professor, the University of Texas Arlington College of Nursing and Health Innovation, Packer Hall. Next. She has a license certifications from psychiatric mental health nurse practitioner, woman health care nurse practitioner, advanced practice register nurse, and also the BLS provider. She has a various educations started from 1987, that has started her career in associate degree in nursing from Etcom College of Nursing, Dallas, Texas. She has in 1987 she has completed the Bachelor of Science in Nursing from Texas Women's University. She has in 1993 Women's Health Care Practitioners from University of Texas she has done. In 99, 2002, in 2005 she has completed the PhD, and currently also she has studying 2021 postmaster certificate and Midwestern State University, Wishart Falls, Texas. Yes. She has lots of academic excellence appointments, that is from 1996 to 2002, Women's Health Nurse Practitioners in UTSWMC GYN department. From 2001 to 2002, she is a nurse specialist, UT Arlington. 2006 present, she is a clinical assistant program, which she is currently also holding. 2021 present associate chair of advanced practice nursing. In 2019 presents clinical placement faculty graduate nursing program. Such a great personalities among us. She will be here to listen all those innovations in the nursing key to progress, universal health coverage. She has a vast clinical experience, professional experience from 1984 to 2003, and also still continue. as we are running out of time. So 2000 currently she is as a woman health nurse practitioner in Methodist Health System, Dallas, Texas. She has a scholarship, honors, and many awards from various dignitaries. And 1986 Pharmacy Tech of the Year, 1987 Employee of the Year, 1990 Nurse of the Year, 1994 Employee of the Year. In 2006, she had an inductee and DFWG 100 Nurse nominated for the Provost Teaching Award. In 2011, nominated for Provost Teaching Awards. 2011 to 23, she was a mentor, and 2014, she was the Nurse of the Year. She had many scholarships and awards for the award. She has many done publications also. In that 2021, she has done the interprofessional education for screening, risk assessment, and safety planning for domestic violence among nursing and social work students. A scrapping review journal for interprofessional education and practice referred poster presentation. 2019, she has done transformational leadership in nursing, nurse leader. And in 2007, does simulation fidelity improve student test scores, clinical simulation and nursing, comparisons of self-directed versus instructor modeled learning during a simulated clinical experience, simulations in healthcare, the Journal of Society for Simulation in Healthcare. She has referred abstract proceedings and many publications has done in 2007, that is modeling versus self-directed simulation. But debriefing, is there a difference? Simulation in healthcare. She has many national and international presentations since 2005, 2006, 2007, 2009. Many is there, which is lakhs and lakhs it is there. In 2016, instructional design considering taking learners lab beyond virtual. Delta Theta builds a consortium to engage the chapter in global health activities. Health assessment, that is implication for clinical and research in nursing. She has published Future of Nursing, Professional Development, Strategic Directions, Future of Nursing, Professional Development, Strategic Direction toward the starting STTI chapters in India. She has instructional design consideration, health assessment and culture, scope of fiduciary responsibility for board of member. NAINA operation, creating effective and efficient process to create dynamic environment for successful operations. She has done the meeting healthcare needs in of women screening and management of cervical health in community-based outpatients clinic, ensuring quality instructional design for online successful advanced assessment and diagnostic reasoning skills beyond the virtual lab. In 2017, 2018, and also in 2019, evaluations of NAINA, that is NAINA, tracing glorious past, innovating the adventurous presence and envisioning the existing future, blueprint for professional development and nursing excellence, developing Indian American nurse leader to transformational leadership training program. In 2020, she has presented the stack for presentation, that is Tips for Success, National Association of Indian Nurses of America Professional Development Series. 2021, collaborating NSU safety and interpersonal education, domestic violence and simulation experience. And online domestic violence presented a interprofessional education activity in healthcare setting has been accepted as a panel, interprofessional education and collaborative practice track of the Council on Social Work Education annual program meeting. In 2021, okay. In 2000, this is yeah. In 2021, collective podcast of Heroes of Faith, and says it was really a great and international critical care nurse structured training education program. Presentation and regional and local. She has 2001 in women's health care. In 2003, TNA districts for annual mock trial, that is Plaintiff Daughters of Disease. 2009 Global Initiative Reasons 6 reports of Delta Theta educational research and other side of the world. In 2010 to 11, the tale of two cities, that is nurse caring today for the health tomorrow. TNA district for annual mock trial. Experts witness in defense motion of H. Honorable Mayor's Son Symphony Center. In 2013, TNA districts for annual mock trial plaintiff. So in 2017 and 20, TNA districts for annual mock trial, that is planting grieving family motions and mission symphony center, lateral violence, invalid and bullying. The future is our San Andreo Indian Nursing Association inaugural Gola Unity of Diversity. Issues of middle and high school youth choice, decision, consequences and the boundaries. Next. She has many professional services and with the professional organization, and present she is as an immediate president in Texas Nurse Association District 4. In 2018 to 21 as a member of Texas Nurses Association's Audit and Finance Committee. 2018 to present she is a chair member in Texas and Association District Mock Trial Committee. In 2018 to 20 as a member of Texas Nurses Association Nursing Professional Development Committee. Currently also she is as a president. 2017 and 19 she had a president as a Texas Nurse Association, as a chair in 2015 to 17 as a chair National Association of Indian Nurses of America, in 2016 to 18 as a past president, that is Sigma Theta 2 Honor Society of Nursing Delta Theta 102, and 2006 to 15 undergraduate RN BSN Pinning Advisor Showers. Next. Services with the university UTA alone, that is from 2019 we can see from 2006 and 2010 2014 15. She was 2006 undergraduate program curricular committee School of Nursing representative. In 2010 Jackie Michelle RN scholarship endowment services was started. 2014-15 Dean of School of Nursing Search Committee. 2016 Annunciator of CONCO Commencement Ceremony. 2017 Organizing Committee of International Nursing Conference, and 2019 Organizing Committee of International Nursing Conference. She has a very big biography, which is really it is a large it is there. We are running out of time. Excuse me, madam, for that reading. It is very large biography. I really invite you on this occasion, and we are horribly waiting for the listening your words towards the innovations in nursing key to progress in universal health coverage. I invite uh, Jackie Michelle Madam to be a part of this conference. Please. So here is Jackie Michelle, madam. We welcome you, madam. We are really eagerly waiting for your words. Thank you, ma'am.
Thank you so much. Can you hear me? Thank you so much. Are you all able to hear me?
Yes, ma'am. We are able to hear you.
Perfect. Will you please start with my slides and I have 30 minutes. And if somebody will just give me a 5-minute warning so I can open up for Q&A. Good morning. My name is Jackie Michael and I am presenting on promoting graduation through innovative strategies to you. Thank you for the lovely introduction. Too much, sir. But let's dive right into it. I am bringing this presentation to you from the perspective of being the graduate chair. And I would like to explain a few things about that. As a graduate chair, all the nurse practitioner programs, we have 7 programs at the University of Texas in Arlington. The structure is that we have College of Nursing Health Innovation that oversees kinesiology. They have several degrees, including kines, bachelor's, master's, doctorate, exercise science, bachelor's, master's, and then we also have public health, all the way up to doctorate. Then we have the other umbrella, which is the College of Nursing Health Innovation over the nursing department or the nursing programs. In the nursing programs, we have an undergraduate program, a graduate program. In the graduate program, we divide it. There are 2 chairs. One oversees all our administration and management courses and nursing education courses, along with our DNP and our PhD programs. Then because our enrollment is so high in our nurse practitioner programs in the graduate department, I am the associate chair over all nurse practitioner programs. Under me are the directors who oversee each of the family nurse practitioner program versus so here, let me just take a minute so it'll set the stage for what I'm about to do. FNP or Family Nurse Practitioner Program is lifespan. That means kids, adults, older adults, and it has a primary focus. Then we have Adult Gero, which have 2 focus. This is for the Adult Gero lifespan only, no PD, and we have a program that awards you a degree in either being a hospitalist internist, which is called acute care, and then we also have a program that is primary care, which is outward facing, and so for that life spectrum. Then we have pediatric program. We have our neonatal program, nurse practitioner program under there. Then we have our pediatric acute care, pediatric primary care. So those 3 degree plans. Then we have our psych mental health program as well, which is lifespan. So we do pediatrics, adults, young adults, adolescents, older adults, and the scope of practice is defined as that being of acute setting. So we can work in a hospital with this credential, as well as our setting for primary care. Having said that, let me dive into our objectives, which is the next slide. So please help me move the slides. I do not have control, though I can see them, if somebody would moderate them for me. Our objectives are 3 today. We are going to be talking about, 1 second, I'll pull up my slides so that I can read them better. So I bring to you 3 objectives. Hopefully by the end of this conversation, by 12:25, 12:30, we should have wrapped up discussion of technological advances, particularly in the graduate education arena. We can evaluate the role of high fidelity. I remember Dr. Kapoor talking about high fidelity and low fidelity simulation in teaching. And the foci of this is going to be twofold. We want to look at the teaching as well as the learning of the clinical content, but focus in the graduate area. And that then we want to compare those two with the traditional instruction and evaluation, for which we use the objective simulated evaluation practicum checkoffs in lab settings. And I want to focus a little bit on how we use it, how it helps us with our instructional design, how it governs our matrices for quality education, and how we link it to our evaluation of the students. So we have come a long ways. Thank you, sir, for reading my favorite poet's lines. क्या थे, क्या हो गए, क्या होंगे अभी, आओ बैठकर विचारें ये सारी समस्याएं सभी. So we have come a long ways. And as I say it, along another poet, favorite poet of mine is Robert Frost. Miles to go before I sleep, and miles to go before I sleep. It's a lovely environment where we are in nursing right now. Great progress has been made, but we are not there yet. We cannot rest on our laurels yet. So let me just do a quick memory lane for you and what all has changed and how. As we were designing this presentation, your presenters and your content designers had asked me to focus a little bit on how the landscape had changed. So I want to talk about that a little bit. Technological advances, as you all know, have happened in many arenas, in not just graduate education, in education generally, then in nursing education, of course, and so poignantly in our graduate education. So LMS is the learning modality system. LMS is the platform on which we want to deliver our education and we want to evaluate our education. So we have come a long ways from PowerPoint, recorded lectures, transparencies, broadcasting our lectures onto our satellite campuses. But now we are in the last, I'll just keep it to the last 20 years. This is 22 years at UTA. And as you know, I'm an old nurse. You can see my gray hair. Left India in 82. I'm a Delhi girl. And no, I was not a nurse in India. All my nursing education is in the US. Believe it or not, I was getting ready to be a IFS person in India. And so was studying in Delhi University, political science at Jesus Mary College. So LMS has changed. WebCT went on then to Blackboard. Blackboard now has become Canvas. In between, we have played a little, flirted a little with things like Moodle, Khan Academy, integration, videos, but those are just technologies. So that is the progression of LMS. Our EMR has come a long ways. We used to do electronic charting. We used to have diagnostic films, files, reports that were electronic that we would save on floppy disk, then on a CD, then now are on a cloud. But we have come a long ways with our integrated EMR that not only does delivery of care, documentation, but our reimbursements, quality matrix tracing of how much time was spent with the client, whether client's consent was received or not, to their verbalizing of understanding, the whole spectrum. Our distance education delivery has changed. When I started teaching in RN to BSN, once a month I would go to each of our satellite sites so that they would know who their faculty is, in addition to the recorded lectures and demos and videos that we would do. That has changed a lot. We have gone to satellite. Then we went to synchronous delivery. So if I'm teaching and speaking to my class that is paying to come to class, the same thing is being sent and simulcasted to my online students who are in the various rural areas of Texas. Texas is a big, big, big state, and we can spend 12 hours and we still don't go from one end of the state to the other end of the state if we were on a highway driving 80 miles an hour. So figure that out. So that distance education delivery has changed. Clinical education, as Dr. Kapoor and other dignitaries have said, has definitely changed. So has our program design. How we define the content, how we deliver the content, and how we measure the effectiveness of student learning and teaching is all a part of this. I'm still on slide 3. Along with that have been some challenges. What are the challenges? Diversity, technology, money, the blessed COVID. Who knew a little bug, a little tiny virus could cause so much havoc, not just in our personal lives, in my state, in my country, but across the globe. So there have been some challenges with technology. Then, as the learner becomes diverse, their learning needs become a challenge. And as our faculty are aging, those challenges with keeping up with technology, social media, newest learning styles, up and coming evidence based best practices, all of those are opportunities and at the same time are challenges. And then all the advances that we are going to talk. Moving on now to our 4th slide, which is talking about the changing landscape. So, with the big focus on technology, is our high fidelity simulation. How has that changed? Well, when I started, and I used to come to India, I've taught in Ritala, in Delhi, and in Bangalore by invitation. So please invite me. I would love to come to my home country and speak in Hindi and be able to teach the students, faculty, wherever God creates an opportunity. When we were coming, and I heard the 1 crore plus price, 1.4 crore, if I understood it right, price of a high fidelity mannequin. But at that time, we were promoting simulation. We had just gone beta testing, and we wanted the world to know what was happening. So I was coming on the cutting edge of that. My doctoral work was 2003 to 2005. And that's the message we were carrying across to the globe way back when. And when I would come, it was a big thing to bring a CPR mannequin that could reciprocate, then a high fidelity simulator that could moan and cry and bleed and urinate and all of those fun stuff, right? Bring a neonate simulator that could show hypoxia, central and peripheral. So a lot of changes have happened in this past time. Clinical advances have changed through simulation. Clinical education has changed through simulation. Impact of the evolving undergraduate education on clinical education within the graduate department changed. So as our undergraduate students were using these simulators, it behooved us not to be stuck in intro to high fidelity. These students already knew high fidelity simulation, so we ran with it into our advanced education, and I'll show you some examples of that. Changing needs of the adult learner were we had students who were coming into school after 15 20 years of nursing experience, so their last education was a computer, but computers had changed, software has changed, our testing has changed. We use a ProctorU method of testing for secure testing, so we can teach our nurses um, how to be successful in a testing environment when they go take their national board exams. So all of those restrictions and guidelines and fitting in a box were all a challenge for our adult learners. Then in graduate education, some of the other things that were happening were because everybody wanted to be a nurse practitioner, and the programs have come up with excellent programs. We could teach in the classroom. Challenge was, where are the clinical sites? My classroom size and enrollment size has gone from a classroom of 50 to 100 to 300 to, as you heard Mr. Trivedi read my intro, I also do the annunciation at the graduation ceremonies. And our graduating class is in thousands per semester, guys. So that means thousands and thousands times two. So that means, where do I place these students? Which hospital will take our students with this large enrollment that we have? So that was placing a challenge, and then requirements and challenges and ensuring high fidelity simulation of quality. So not just creating a scenario, letting students work through it, teaching them in debriefing, telling them what mistakes they made, giving them a chance to remediate, and then have effective objective assessment was the challenge. So I'll start with what we do, and then I'll, in the questions, I'll answer some of the things that we are doing differently. So we use simulation for many things, for OSCEs, which is objective simulated clinical evaluation, to teach clinical reasoning skills, which we call diagnostic skills. And I'll go into my advanced practice role and education and model in a second. And so I'll do a segue to explain that nurse practitioners are that unique, autonomous preparation and role. I have been a nurse practitioner for 31 years, started my career as a women's health NP, a nurse practitioner, back in 1993, so 29 years to be correct, as board certified. And at that time, nurse practitioners had to explain what they are, what the role is. I think that is the developmental stage. If I have spoken to my colleagues correctly, that is the stage India is at. So when I would go in the exam room, I would have to tell my patients, according to ANP, a nurse practitioner is a registered nurse with advanced education who can do all skills that a physician can do if this person, he or she, is trained to do that, has received the education to do it. So my patients would ask me, I shared I'm a women's health NP, and I'm also a nurse colposcopist. So I work Genonc as well. So my patients would say, so can you do my abnormal pap evaluation? Yes, I can. Can you do cervical biopsies? Yes, I can. Can you do the endocervical biopsy? Yes, I can. Can you also do my leap with assistance with the physician in the room? I can. Can you do my cryotherapy sessions and help me get rid of this dysplastic tissue? Yes, I can. So do you see, that is the level of education that a patient needs. And I've done this for about 3 decades, to where I don't have to say all these things. It is implied here with our reimbursement. I'm credentialed on most of the commercial plans and Medicaid and Medicare here in the US as women's health NP, and in psych on about 80% of them that I choose to be credentialed on. So there I am at par with the psychiatrist and a psychologist, if that makes sense. I can do medication management, I can write prescriptions, as well as do counseling and psychotherapy. Cognitive therapy is my specialty. I say all this to tell you that that model is very similar to the medical model. I heard Dr. Kapoor talk about that physicians do receive communication content, but only 30 hours, and nurses receive a whole lot more because that is where we're founded. Well, in our advanced education at the graduate level, a nurse practitioner is taught that art and that skill so she or he can stand out. And in my practice, I also have a private business where I see my own patients in my clinic. And the business is there because somebody's coming to me because I have 30-minute appointments. I am listening to them, and they felt rushed by another provider, by a psychiatrist, by a doctor. So I say all this to tell you that it is very important that we appreciate that advanced practice nursing, particularly nurse practitioner education, is at par with the medical model of education. So I don't call them critical thinking skills. I don't call them clinical reasoning skills. I call them diagnostic reasoning skills. And we use objective simulation, simulated clinical evaluation in settings for, please don't show the slides yet. 1 second, I'm still on 5. Objective simulation is used for practicum checkoffs in lab settings. We use it for instruction. We use it for evaluation because philosophically, I believe, and nursing education here believes, that instruction and education are two sides of the same coin. You cannot evaluate or test something you haven't taught, and whatever you teach, you must teach with the intention of evaluating. So our content is divided in need to know, that needs to be tested. Good to know, you may or may not test. Nice to know, no reason testing. That is the artsy side of nursing. Then we want to go over preparation of lab and instruction and evaluation in the upcoming slides, how we develop scenarios and rubrics, and in the very end, we're going to talk about debriefing. So now can we show the slide, please? And I think you have transitioned before this slide. Can you show slide 6, please? The one before it. Okay, I'll just stick to this slide. And the transition must not be working. But the student would see when they came to station 8, this picture and the model we call it baby hippie. It's an Ortolani Bartlow technique. Thank you. I'll stick to my sequence. So station 4 is just a picture, and they have to name and spell it correctly, what it is, and what is the disorder. So what is in front of you is syndactyly. And a lot of our adult learners have to learn how to pronounce things, call them correctly, because advanced education and nurse practitioner education is based on the foundation that we have to be at par with our medical community. So we have to walk and talk like a doc, if not even better. So I cannot mispronounce things. This is syndactyly. It should be explained as such. A person should look at a person, recognize it, and give it the professional terminology, not a description. The next slide is a test called Barlow-Ortolani. Now, I want you to know that the first thing that they will see is the test. Next to the test is going to be a baby hippie model that is ethnically coded. So we have a yellow-skinned one for Asian. We have a brown-skinned one for our African American or brown or colored population. And then we have a pink model for our Caucasian kid, trying to impress on our students that this condition is across all ethnicities. They manipulate the model. They have to show how to do the internal, external rotations. Then we ask them, hey, what is this test? Name it. Spelling should be correct. What is the purpose of the test? And when should the screening be done? What age? And what is the correct technique? That you have to have fingers bracing the outer hip and the thumbs on the inside of the femur to anchor it correctly. Next slide, please. We ask them, can they tell us? And we give them a scenario. We give them a scenario of a 64-year-old and ask them to tell me what is going on as a differential. And they'll say stroke. Then we give them a scenario of a 24-year-old and ask them to give us a diagnosis and a differential. And we are hoping that they give us Bell's palsy for the young person and they give us stroke as a differential for the young person. And then when I go into debriefing, I'll explain on how we help them tease out the diagnoses on differential, everything you consider, okay? Then the one with the defining characteristic that'll help you rule in the main diagnosis and rule out the other differentials. And we teach them how to present. So they don't present any different than medical students would. So I would teach MS3s, medical student third years. And at that time, they're not even making rounds, right? And then they start making rounds. And our NP students present in grand rounds. So they would have to say, my main diagnosis, this is an X many year old prima gravida who delivered 3 weeks ago, presents with asymmetrical smile. Strength is 5+5+ bilaterally, no difference in strength. Upper extremities, lower extremities, no change in gait. It is just in the face. That is your defining characteristic for Bell's. Moving to the next slide. Then we move on from interview inspection to doing the test and stands the faculty and asks them to do the test correctly. And if they lift up the instrument or the cotton bud applicator, then we tell them that the technique is incorrect. It has to be a continuous infinity or the figure of 8. And what is that test called? How is that different than sterignosis? Okay? Which is identifying an object put in your palm with your eyes closed, like a key or a paper clip. Next slide, please. This testing area will have a prep before they can lift the drape that is over this model. It'll say when the drape is lifted, you have a minute to tell us at the mark that you will see, if there is tenderness, what is that a defining characteristic for? And provide 3 differential diagnoses. This is, one was deductive and the other is inductive. So in the slide before, we said, how is it different, right? Here we're saying, what is this specifically? And now what are your differentials? So we want their gray matter to know how to go from big to small and from one thing to all the other multiples. So they should be able to say differential diagnosis could be media, interna, externa, right? The tragus that is tender to touch is otitis media. And then we can escalate it to additional questions we can ask them about management. Debriefing is the key, guys. It isn't debriefing when a person realizes. So adult learning model says the student will learn what they define their learning need to be. If I don't know how to fix chai correctly, I'll ask 2-3 people, watch a demonstration so I can do it. But अगर मुझे चाय बनानी ही नहीं है, What is the relevance of learning? That is one aspect. Then, in simulated settings, we allow patients to die because we believe students learn vicariously. The patient dies, the student who pushed the wrong medicine, which resulted in death, will never make that mistake again, right? But if we do the debriefing correctly, the other 4 students who were running the scenario have learned vicariously by observation. They didn't push the medicine, but guess what? If you teach it correctly, the other 4 students will never push that medication that fast or without doing the 7 checks either. And that is the vicarious learning and the power of comparing and contrasting merits and areas of improvement in traditional and newer technologies, which are rapidly advancing innovation. Somebody said a lot of changes in medicine in the US, thanks to our Silicon Valley, a lot of changes in our technology, right? I barely got used to iPhone 13, and 14 was introduced in this last October. As we learn 14, I know my phone plan will allow me to advance to the next one, and the next model is there. So when technology is moving so fast, I now need an adapter for my iPhone 5 technology. So through my otoscope, I can put my phone camera I put my phone camera on my otoscope so my student can see the tympanic membrane all enlarged, all on an iPhone. That means I have to know the technology, the cutting edges, and of the technology so I can advance my nursing education accordingly. I am here actually by introduction to the TNI group from Dr. Gopi, actually. He came and presented in the US, and we were talking. And he was talking about this technology, and I thought, wow, India has come a long ways in nursing education, in technology, in the use of technology. So we need to be not just consumers, but we need to be the ones directing what this technology needs to be. If you don't have that software from Welch Allen, where you can show your class the entire otoscope. So I'm blessed with very good ears. I put the otoscope in my ear and it projects out on the huge wall screen. And I show them the bony landmarks and I show them those things. So if it's not there, or if it's only limited to the medical students, nursing faculty, as you prepare your advanced practice nurses and nurse practitioners, please ask for that technology. The next thing we need to do and what's next is keep an open mind. If your mind is not open, you will not be able to discern what else can be incorporated. So I learned I'm the only nurse in a family of engineers and computer geeks. In my generation, my brother is an engineer, my sister is a programmer, she's married to another engineer. So, and all of his families in technology. So I like to sit and listen to the conversations and I'll ask, but how does that work? And what is that OS doing? What is that operating system doing? And what is the implication? So, and now I'm listening to my nephew too, who is in cybersecurity, on how they protect. What is the testing parameters? How do I ensure a secure test? We must. It's the next slide. Sorry, I went on. We must. So I completed the first blue one, comparing and contrasting and keeping our radar, and then keeping an open mind. And then we must continue having a curious mind, inquisitive mind, a mind that wants to inquire and learn so that we can continue contributing to the body of knowledge. That is through our PhD programs where we're doing new knowledge, right? That's the kind of dissertation I did back in 2005 of comparing traditional labs, high fidelity labs, right? And saying, is it comparable? Is it at par? So now we have another program called the DNP, Doctorate of Nursing Practice. You don't have to do a dissertation as in a new scientific research to develop new knowledge. You can take the knowledge our doctoral PhD peers do, and the DNP students can do the application of knowledge. So that is the bringing in the practices from our new information or evidence base to improve the quality of care, to improve the quality of instruction, to improve quality of evaluation by putting that evidence into practice. And last but not least is opportunities for scholarship in graduate education. I made the big mistake of not publishing my dissertation, though my colleagues are very professional and generous and include me, always giving me first credit for the initial work I did for developing the tool to measure confidence related to competence with regular education where the lecturer instructs, then comparing it by adding another layer where partner A does traditional lab with partner B, and partner B does assessment with partner A, and then layering yet another third layer of high fidelity simulation with debriefing to see if it increases competence, learning, education, content in itself, and confidence. If I feel I can do it, I go out and do it. I may have all the knowledge, but if I feel I cannot do it, if I don't have the confidence, I may have passed 100 on 100. I may be competent, but if I don't have confidence, I don't do it. I'll give you an example. I do ECCs all day long. They don't bother me. I do ECCs as endocervical biopsies, right? Curettage to collect sample. I read histologies all day long. It doesn't bother me because I am not only I'm confident. So I should have published that, but I didn't. But the thing that I tell all my mentees is I'll be a silent person with you. Take it the next step, publish it. My time is coming to an end, so I will bring it to my last slide, please, which is opening for questions. And I'll take questions for anywhere from 3 to 5 minutes or whatever our lovely TNI folks will allow me to have.
Excuse me, delegates, if anyone has any questions, those who are listening globally from online and offline.
There's a very little time. I'm sorry. I wish I could
Yes,
have
yes,
shared
ma'am.
more.
We
My
have
heart
one
is so
questions
full.
here. Bimla Kapoor, madam.
Hi, Jackie.
Gee,
Uh,
hi.
sorry, it's too late for you to wake up. We will not hold you for long.
I love it. I wanted to be
I'm
here.
Professor Dr. Bimla Kapoor. I
Hi.
sort of, empathize with you because I developed in the country first time a PhD development of a model for evaluating distance education program, first of its kind, and I did not publish it. But then I think these are the things which others can pick up well. My question only is my concern. It's not my question, it is my concern. You sit in a country where there is a freedom of applying certain things. How do you manage? Suppose one of your student has done a study, the outcome is very good in the clinical area. Like we have enough number of studies in the clinical area, but we do not have as nursing professionals to apply that knowledge in the clinical area to improve the patient care. No doctors will permit, nobody permits that. It is on your own if you do something, but that doesn't bring the results. So what are the difficulties you encounter, because you also have same kind of difficulties, but only thing, if you have a research cell in your hospital, nursing research cell in your hospital, that probably helps. So just wanted to know if it is there. Thank you.
Question, Dr. Kapoor. And by all means, if you want me to come out there, I would love to. I'm actually quite intrigued by your credentials. So you're kind of like my hero, I think, and I would love to do collaborative work. This is what I think. This is going to be the key, right? And I say this as a woman more than a man, is जब सीधी उंगली से घी नहीं निकलता है तो उंगली टेढ़ी करनी पड़ती है. So the one of the workarounds of this is, let's start conversations, collaborative projects, and let's get the IRB done in the US. If there is not a model in India, if there is not a scientific research support, it could be resources, it could be leadership that doesn't allow you to do, it could be a setup of a smaller institution, whatever it is. Let's handpick, find these candidates, Dr. Kapoor, and tell them, why don't you do a collaborative project? This is a colleague, Dr. Michael, and I see you're a part of Sigma Theta Tau too. So, let's find those opportunities and pair them up. आपका कोई अच्छा idea है, innovative. You have a hypothesis, and you're like, it's so hard in my medical center to set the study up thusly. No worries. I have a doctoral student here. Let's do a collaborative process with one of your doctoral students. You become a faculty mentor and advisor there. I become one here. Let's just create hangama with this thing. What is that thing, na? Dhoom machani hai. So we can do it. And then once it gets published, somebody has to start it, right? Who does that first thing? Let's do it. Up till now, India has made great advances with scholars like you, because you have stepped out to share the expertise. How you said, your British colleague said, we didn't know this was there. Some of the things that I use, that people say, how do you blend pedagogy and andragogy so well that you use methods of repetitive? I do the 10 lymph nodes. I say it's like your phone number. Let's start preauricular, postauricular, occipital. Let's keep going, guys. And I teach it to them. They know it. They're like, how do you do it? I said, I grew up in a school in India. And in my convent school, I had to stand in, and not just convent school, in any school. All my friends did it. We had to recite tables. I know the value of memorization. आप मुझे अभी भी पूछ लीजिए 12 times 12, 144. It just comes out, right? So what I'm saying is, people are impressed in the West with what we know, how we do differently, because we have amalgamated all of those. Let's then say, part A of the world, part B of the world are going to collaborate, and something will come out in a journal because of this international collaboration. I did a project in India with the Indian nurses and presented it in Edinburgh. We did the second one with the nurses in the US. We are presenting it in Qatar, I think, is the next INRC, International Nursing Research Congress. And then we are presenting it also with International Nursing Council, because both places, podium presentation was accepted for this work. So what I'm saying is, the world is looking for collaboration and global collaboration. I want to join hands with you. इसलिए मैं रात के 12 बजे 1 बजे बैठी हूँ आपके साथ बात करने को, because
Thank you,
I
ma'am.
want to have this relationship. If there are others in TNI and forward thinkers like you, Dr. Kapoor, then please reach out. My email is michaels@uta.edu, and I'm very easily found on the UTA website. I oversee doctoral students doing their DNP. Every so often, doctoral students doing their PhD also. But let's get this work done. Let's get projects done on quality, on safety, on education, on instruction, on testing. These are low-hanging fruits. What are we doing? What are you doing? Can we come up with some hypothetical questions presented to our advanced students to find a theoretical framework? Guys, you do the work. We'll help you with the research design. I'll work on the IRB on this end. You work on your publication on the other end. We will work together synergistically. get the word out. क्या सोचती हैं आप?
I quite agree to what you are saying. Uh, the teacher association may take the leadership because you know that all the MSc nursing students in India do the research work. PhD, they do the research work. Excellent research work is there, but it is all getting dusted in the libraries. My concern only is that I had suggested also, and we have put in we have made an academic board in the new nursing and midwifery commission bill, academic board, where we thought that research body will have its say in terms of implementation. That of course regulations will be worked out once the bill is passed, the new bill is passed. But till then, there is so much work done by the nurses. Excellent work, good outcomes, but my constraints are how do we start implementing? The NTI may suggest that maybe in this institute I found the administration is very, very proactive. They are very helpful. The founder and the other members are very helpful. Maybe you have a nursing cell over here, and I suggested also that whatever research is done, if you implement that in my keynote address, that will reduce the cost of the patient care. Hospital cost will get reduced. So we are not able to break through this through the government. See, collaborative studies excellent, no problem about it, but who is in India going to listen is big issue. So that's Indian Nursing Council is our like we thought National Nursing and Commission bill will come. Indian Nursing Council is our statutory body.
Yeah.
This can implement, if they come up, we can suggest them out of this workshop, maybe conference. A concept paper can be sent to, I'm just thinking aloud with you and with the members, that we can
Yeah.
send a concept paper or a few lines paper recommendation that the Indian Nursing Council may suggest the implementation of the studies done in a particular institute to be done in their hospital, so that we can find the result and make a theories out of that or models out of that. We are working on those old models of Oram and Betty Newman and all that. But there are so many models which can come out because of the studies being done. We have Dr. Gopi here. I think you know Dr. Gopi. He is
Yes,
here
I
with
do.
us. I will request him because he is now officiating principal and is senior faculty. Maybe through this forum, we request Gopi that whatever studies are being done by masters of nursing students, if they can implement it in their clinical area and taken for a year or two, and then we can collaborate with her and then find out that what the result has been brought. See, those of you
Yeah,
who are in a position,
one more thing, I don't mean to interrupt you, but
no
as
problem.
you're talking, I'm thinking one baby step we can do
Yes.
is if TNAI has a cloud space on their website, maybe we can start putting abstracts with keywords of the work that people would like to submit as a repository.
I'll tell you,
That may be step one, so we can start building and collating and archiving and collecting the work done. You're absolutely right. The trend now here, we're never going to let go of the grand theorists, right? Like the orums we studied in nursing school back in the 80s and 70s, right? We're not going to let Watson go. But at the same time, this new work that is happening in the context of today, challenges of today, problem of today, safety concern of today, access to care or barrier to care today. So would behoove us, I think sometimes people think, and I'm going to make a broad statement. I know there might be some physicians, तो प्लीज मुझे माफ कीजिएगा, मैं हाथ जोड़ के पहले ही माफी मांग लेती हूँ. It is not to alienate or increase the gap between the medical model and nurses, but sometimes our colleagues on the medical column don't even realize of the amount of work nurses have done scholarly and scholarship wise, or the quality of the work nurses are capable of doing. I think the first thing is, इससे पहले कोई मुझसे पूछे कहाँ है ये, किसने किया, आप क्या बात कर रही हैं डॉक्टर माइकल? Because when I come to India, people will say this. I have visited the sitting health minister back in 1991 in that trip. You know, when I met, and he goes, ये अमेरिका की बातें हैं, आप नहीं समझती हैं. यहाँ किसने किया, कहाँ है, आपके जर्नल्स में है, तो वो फिर वहाँ का काम हो गया. So I'm thinking, where can we archive it to give it some validity so people can be resource that work could be looked upon, and we can start building the volume of work that's happening. Because when I speak to my Indian colleagues, they are brilliant. They are brilliant, and the work that's happening is fantastic. I'm waiting for Gopi to come to UTA, come to Arlington, come to Texas, so we can share what I heard briefly in a 7-minute conversation about his app that is improving health in rural areas. Well, Texas is rural. People think it's like New York, but it's not. It's not all huge buildings. I'd love for him to get in my car. We go 5 hours west so he can see where Midland is and how we don't have providers. तो मैं ये सब इसलिए बोल रही हूँ कि first step is we have to think globally, yes. But when I do any social service or philanthropy, my rule of thumb is think globally, serve locally. Your work will have to start locally. If anybody is here, go back to your institutions and say, guys, how many of you guys have published? Where are those? Let me at least have a list of those repository. Just give me an abstract and your keywords and your author profile with your contact. And then let's get this information together. Let's overwhelm Gopi and say, Gopi, look, here are 700 citations. Here are 2,000 citations. Can we figure out how we can secure a cloud space so we can put these there for access to our members? Then people want to be members. That is how Sigma does it. That is the buy-in. So, we have to think outside the box, because what we did and how we did is not as effective in today's context. So हमें भी वक्त के साथ थोड़ा सा बदलना पड़ेगा, और we cannot just throw in the towel. We can't give up so easy. आपने अपनी lifetime निकाल दिया है इस काम में. I was listening to your bio. Rich work, progression, publications. Let's do some white papers. Let's do it together. Please invite me. I don't care if you're the primary author. I would just love to be able to collaborate. Likewise to the other folks that I haven't even met. I come to MP, that's my Nanihal. I go to Jabalpur, I go to Jhansi, I go to Chhatarpur. I would love to do a stop and meet people. I would love to come and energize future leaders who are sitting on the sidelines thinking, am I this material? MS to kar li, doctorate to kar li, ab kya? There is a lot to be done. So I would just want to empower and challenge to find solutions. And they may look very simple right now, but everybody started simply. I started simply. The nurse practitioner role started simply. So that is my short response. बहुत ज़्यादा बोल गई, sorry.
Anybody is there? No. Delegates, if anyone is having any questions regarding this session, please let us know.
Jackie,
Yeah, thank you, sir.
Gopi here. Thank you very much for hi. Thank you very much for your wonderful presentations. Really, it's made the day very very informative. Madam already highlighted that whatever we expected, that same thing. We need kind of collaborations. We understood, we realized when during my last, I think 2 months before I visited, we had the interactions with you that where we were backward. Even I have projected my work to them. They said that we are really infant compared with what the Indian nurses are in some areas. Then we really proud that actually we said that also same thing I mentioned. All Indians is only doing well at countries where we are produced from here. So we understood that our weakness, and especially in the policy, in the structures where we have to break through, but they really need kind of a energization, that we self motivation and motivation, people like you, and taking initiation from NTA, what they are doing. That's our concept. Our vision is very clear: strengthening, our standard. That should be at national level, at international level, because the topic is very ideal: universal health coverage. That means the patient is not only one at one state; it's a subject of everyone that need to be taken care. And that way, nurses are really proving. But this time, we need kind of learning and implementations, that what exactly I am going to again to her after 2 3 months. We are going to work together for the informatics. She already got fellowship over with her from the support by AIMS. So that way we are expecting everyone, not only me, everybody. That time she told not only Gopi Chandran, everyone want to be there to learn, and she want to be here. And same time, I expecting you to be support NTA, and on behalf of NTA, I'm be the also part of the MBA and NTA. So you please support, advise them, mentor them to be do and futuristic work what we expected. Thank you, Jackie, for your
My
presence.
pleasure, Dr. Gopi.
Yeah.
One more thing I want to say is, as you do advising for your master's and for your doctorate program, if we can find some travel monies for them, even if it is to meet one outcome of the entire study. So you do your study in India, you take care of it in your institution, but enrich the thing by saying additional immersion experience of 6 weeks in the US. If we can just help people find scholarship and money there to come and do the first step of learning, then we will prepare this person. My goal is, when Gopi gets here to UTA, he will do what he will do for his technology and for his outcome. My goal is to mentor him, wind him up, and then send him back to India, so he keeps going and multiplying that. Next, then comes another candidate. Maybe we can do something inside collaboratively, Dr. Kapoor, and you come here for an immersive 6 week stay. Not zada nahi, just so you can say it. You earn a certificate that validates you. You go back. We wind you up with the projects you will be championing, and we get you some credentials and certificate and things that highlight you as additionally differently trained at par. Like a physician who learns cardiac surgery in Britain or at John Hopkins and goes back to India, creates a different environment, whether it was available or not, acceptable or not. And then the standard changes. So maybe what needs to happen is, we need to build a critical mass of a few of y'all in a connection, come, go, create a collaborative pathway, and then change will start happening. Hopefully, we will see it in our nursing careers, but at least we can be pioneers in contributing of making that way, right?
Yeah. Thank you.
Yes, ma'am.
Actually, one more thing I just want to mention to everyone. She was telling that we want all the TNI, paper published should be in cloud. We already started to work, and our already national EC committee already approved that everything go into the online mode. So whatever you already published, that again it be going to the cloud, and it can be cited out, because that was the issue we faced. Actually, it's not cited. Now it is going to be cited. All your work, even 10, 20 years before you, whenever you publish this work, will be go back to your cloud, and you will be, you get into messages in your email, that with your approval also. Thank you very much. Madam, want to say something? Then
No, I was just saying, if there's opportunity for me to collaborate with you guys there, on any of these efforts, whether it's creating themes or sections within the cloud, folders and subfolders, so that nurses are able to categorize their work as we put them out. Any way you can use me, I am here, would love to help you all. I don't know how, but however you invite me, please know I'm at that stage. I am retirement ready. My heart is to do something for the nurses in my hometown, my people, as well as where I am. I love nursing. I love being a nurse practitioner. I love graduate education, love India, and still love Texas. So let me know if I can do anything here.
I just good afternoon, madam. I've just
Hi.
heard. I'm Professor Pitikol. I retired as a director from School of Health Sciences, IGNU, and in fact, I was instrumental in starting the distance education in IGNU in 1991. That time, I migrated from Jammu and Kashmir, and I got the opportunity to work as a beginner there, as a pioneer, to start that department, start that school, in fact, School of Health Sciences, and worked over a period of 30 years there. But recently, I retired as a director of health sciences, having 2 terms of directorship there. I joined an institution which I never heard about, that is SGT University, Shri Guru Govind Taichantri University. And when I joined there as a dean, after such a long negotiations, I was not interested in taking a full-time job. But when I took the job, I started it a very, very challenging one. And I saw that nursing doing a lot of things. The young generation which is there, just between 35 to 40, doing lot of research, doing lot of patents, and developing lot of devices from the nursing department. And the focus of that institution is on research by young minds. They keep the faculty behind, but they make the students to do the research. And recently we had a very research meet, that was Synergy 2022, where our student nurses showcased around 9 projects which had all devices prepared, how to get alarm for bed sores, developing a advanced mattress for them, how to help the ladies to get pain relief, developing a device with all sensors with them, how to develop a bag which can give the massage, because their nurses are working long this thing, and then how to create a device for the Parkinson's and the patients. This was all devised by our nurses. And also a fibro optic baby, where you can give, by fibro optics, you can give the phototherapy to the baby. A very advanced. I was really amazed to see, and I wanted to facilitate them, that how they can progress. And I saw that what you were talking, that I think I may talk to you later, and discuss in length how you can help us in. But what I have suggested to the institution is that, because we need the practice, they all have got the patents. We have almost all 6-7 patents at present, and more 4-5 patents are going to be published. And I think they will go to the entrepreneurship market also. There will be that also, will be those things will be there. The bag has already gone, and they have prepared a ergometric chair, and also the bag where when the baby, with a device they have prepared where you can shift the patient very easily, because the nurses are not able to shift the heavy patients. So they have prepared a device which you just picking the belt, you can turn the patient in any way with by the single hand. So many things have been done by them, because there is an institutional will to go do the research. But what I have suggested, that if we need to practice them and then make them operational, I have suggested that we can give these projects to our MSc and PhD students, so that they can make it practice on a large scale. So that is, but how much I am successful in that, doing that. But I want to uplift these young nurses and young students, and I would need your suggestion also. The OSCE and OSPI, we have a very national resource simulation lab, national level resource lab, which has been developed by the LORDA and the UK, and the INC and JAPAGO and the SGT University. It is the all high fidelity simulators are there, and that is a national resource simulation lab, and where all these students get the exposure to all those things. So we want to know that how we can go about to make this more public internationally. they are doing a wonderful job, and we are trying to help them if we can do, because we did not do that to that level. We have not done that, but I could see there the young minds, the students doing. Students are, because when the student becomes first, second, third, they are being given a BSc student, a GNM student, and MSc student. If he stands first in the class, is given a research project, and then they do the research, the outcome based research they do, and then they get awards, they get rewards. So we want to strengthen this, and the management is very, very optimistic about the collaboration, because our national education policy 2020 focuses more on collaborations, national and international, because now the international universities are also coming, opening the campus in India. So that will pose a more challenge to all of us to meet the competition. So I would be further requesting you to give us some more suggestions, so that we can build the morale, because we cannot do, we have done our innings as you were talking, but we have to, if we can do to some extent to motivate the young brains who are the
Gee,
future of the country in nursing.
yeah, I would say that when the infrastructure is not there, the littlest thing that we can start with is creating those things. Like Gopi said, hey, already the cloud is in the way, then let's create some recognitions and awards. Then let's find these people in Britain, Texas, etc., carve out some recognitions that could be awarded there. थोड़ी सी धूम मचानी है. We have to toot our own horns. As nurses, we have always learned servant leadership. A servant leadership is not bad, but if I don't tell people what all I am doing, it is quite possible people may never realize it. I know I've taken too much of the time, but I have asked the organizers to share my email, which is michaels@uta.edu, with everybody who's attending, and my WhatsApp number, which is 214-707-0092. Gopi has all this, TNI leadership has all this. It would make me so happy.
Sure, ma'am.
I will pay my own ticket, come out. If you could organize 2, 3, 4, 5, 6, 7, how many ever spots that we could move, have these conversations, which are going to be rich, and let's look at things. Maybe the publications coming out of your institution, ma'am, need to be on how to be a nurse entrepreneur, how to get patent. These are things we are not even thinking as nurses. Well, let's think about it. Let's put it out there. A nurse is never a nurse. We say a nurse is just a nurse. Nope, a nurse is not just a nurse. And one nurse is not same as the other. Some may be very good at advanced practice, other may be doing great work in research, another may be great at publishing a book and being content expert, while other could be figuring out devices. Everybody's brain is working differently. God has made us all unique in his own way. So I'm just saying, let's think outside the box. If you organize some meetings, I'll continue to put this on my agenda with Gopi while he's here. I will come out there and let's get some conversations so I can come back to the drawing board with the needs and start carving out some things organizationally, operationally, to reach that part of the globe. But I would need, the conversations need to be relevant, right? तो आप मुझे सिखाइए और मैं आपसे सीखती हूँ, and then maybe we together can bless nursing not only in India but nursing period.
Sure. So here, anyone have any doubts? Then, okay. Thank you so much, ma'am, for being present here at this late night. I think it is going to be 1 midnight, 1 o'clock midnight it is. And thank you for being a part of this session. And we are really proud of you that from NTI, we have organized international conference and you have been be there with us. Thank you for us. Thank you, ma'am. Thank you so much.
Thank you. Good night.
So next session, I think we are going to be publish a calendar, that is Vimochan of calendar. So I request all the resource persons, all delegates from NTI team and presidents from various state of NTI, please become on the stage and we can publish our calendar.
I welcome all the dignitaries and resource person. Please come on a stage for the publication of our calendars. All the participants are requested to be on your seats. They will get their calendars on their seat only. Thank you for the wonderful presentation. Now I would request Professor Nimmi Alpana Gopali ma'am, Principal Ratan Jyoti Institute of Nursing Sciences, to honor the chairperson Professor Himanshu Trivedi sir with a memento and with a welcome garland. Please welcome ma'am. We will have Professor Himanshu Trivedi on the stage to receive the memento. Professor Himanshu Trivedi sir. Please welcome Professor Himanshu Trivedi sir to receive a memento from Professor Nimmi Alpana Gopali ma'am, Principal Ratan Jyoti Institute of Nursing Sciences. After that, we will have Professor Umesh Parasar sir from SMS College Jaipur, State President NTAI Rajasthan. Please come on stage, sir, with regards. Followed by, I will welcome Professor Purushottam Kumbhat sir, State President NTAI, and Om Prakash Lodhi sir, please come on the stage.
Seven nursing books, and he was to unfolding these books from these dignitaries. Please come, ma'am. Dr. Bimla, ma'am. Dr. Preeti, ma'am. Dr. Gopchandran, sir. Farooq, sir. Biren, sir. Principal Shri, ma'am. Pronounce कहाँ है? शेली सरकार. मैं प्रोफेसर उमेश पाराशर जी से रिक्वेस्ट करूंगा कि वो आए अपने बुक्स के विषय में दो शब्द कहें. उमेश पाराशर जी.
All nursing dignitaries. I am also from Government SMS Nursing College Jaipur. Previous 10 years, 10 years से जो हमने SMS हॉस्पिटल के पेशेंट केयर देखा, क्लासरूम टीचिंग देखा, तो मैं केवल सिंपल वे में बात करना चाहूँगा हेल्थ के बारे में. हम सारे लोग यहाँ केवल हेल्थ के लिए बैठे हैं. फर्स्ट ऑफ ऑल, हेल्थ मीन्स फिजिकल, मेंटल, सोशल, स्पिरिचुअल. It's not for define here, but also एक टीचर का अपने आप में फिजिकल, मेंटल, सोशल, स्पिरिचुअल 4 कंपोनेंट्स का फुलफिल करना बहुत एसेंशियल है, तभी वो प्रॉपर क्लास डिलीवर कर सकता है. नेक्स्ट, एजुकेशन क्या है? एजुकेशन का मेरा मानना ये है, जो जितना हम देख पाते हैं कि चाहे हम BSc, MSc, PhD, जो भी ट्रेंड्स वर्ल्ड वाइड चल रहे हैं, इन सारा सीनिरियो देखने के बाद कि जो व्यक्ति को, स्टूडेंट्स को, वी ऑल आर थ्रू आउट स्कॉलर्स इन लाइफ, बट मीन्स जो व्यक्ति को फियरलेस बना दे. फियरलेस मीन्स हम ये भी कह सकते हैं कि पावर ऑफ नॉलेज. यदि आपके पास नॉलेज का पावर है तो डेफिनेटली आपको वो चीज़ फियरलेस बनाएगी. आप दुनिया में कहीं पे भी वर्ल्ड वाइड, नॉट ओनली फॉर लाइक दैट नर्सिंग ऑफिसर्स, ऐसा नहीं केवल हमारा नॉलेज आपको लाख रुपए की सैलरी का नर्सिंग ऑफिसर बनाएगा फ्यूचर के अंदर. उससे डायरेक्टली एक पेशेंट की केयर इंपैक्ट होती है. मीन्स यदि हमारे पास एक बहुत अच्छा नॉलेज है, इन दिस केस वो डायरेक्टली एक पेशेंट की लाइफ को इंपैक्ट करेगा. तो मेरा मानना ये है कि हम लोग जो जिस पर्पज से आज जो सेशन चल रहा है, हमको टीचर्स को भी और स्टूडेंट्स को भी, बोथ ऑफ दोनों को ही जब प्रॉपर हेल्दी रहेंगे तभी सारा एजुकेशन का सिस्टम प्रॉपर हो पाएगा। बाकी बहुत बहुत धन्यवाद मुझे यहाँ पे आने के लिए मौका दिया। थैंक्स।
Ladies and gentlemen, and my dear participants, I know you have been eagerly waiting for the tea break. Your wait is now over, but please join us within 5 minutes. Take your respiration. Please join us within 10 minutes. The next scientific session will start, and please have your coupon with you. Please get refreshed and be with us. Thank you. जिन लोगों ने चाय नहीं पी है वो अपने पार्टिसिपेंट से रिक्वेस्ट है कूपन के ही साथ जाएं, कूपन के साथ जाएं। अगला साइंटिफिक सेशन हम लोग 10 मिनट में स्टार्ट करेंगे। धन्यवाद।
तनु।
Sorry to interrupt you, but I request to all participants to take their seat. It's needed because we will start the next scientific sessions. I again announce to all participants take their respected seat. Welcome back to all conference. Welcome back to the conference. I hope you all are take refreshments. It's ready for our part of next scientific session. I will now invite to Dr. Viren Singh Chaudhary sir, Vice President NTI Rajasthan, Dean of Nimans College of Nursing, NIMS University, Jaipur, to grace the stage and initiate the second scientific session. I will now invite Dr. Virendra S. Chaudhary, Vice President, NTI Rajasthan, Dean of Nimans College of Nursing, NIMS University, Jaipur, to grace the stage and initiate the second scientific session. Please, sir, come on the stage. We all are ready for next sessions, next scientific sessions. Thank you, sir.
No issue. Yeah. It can. Very good afternoon to one and all. It's highly privileged and honored for me to share the podium with the dignitaries of our nursing professions from their books, actually where we are today. When we have started the BSc nursing third year, I remember that, and my teacher say कि go and purchase the psychiatric book. मैंने कहा कि psychiatric book पढ़ेंगे. So when we say कि which book is the available in the market, they say only one, that is the Madam Vimla Kapoor book was there. And when we are coming in the teaching profession, our student asking, sir, which book we will purchase for psychiatric? Because there is so many books are available. In these days you have seen that small books, big books, 2 sets, 3 sets. Then we will say ki we don't have too much about that, but we know one book and we have studied and today we are here because of that. Thank you, ma'am. So on the session of that, again it's a big honor for me to introduce today's session and speaker Dr. L. Gopi Chandran sir. And it's really a honor for us that Dr. Gopi Chandran is with us today in this conference, because the theme of today's conference, that is the innovation, and he is the man behind the digitalization of AIMS. I think everybody is knowing about the AIMS, but anybody know when the digitalization process was started in the AIMS? Very late. That is 2013. As the Dr. Gopi Chandran is joined as a associate professor in the Department of College of Nursing. Dr. I don't have a words, and even though I am not on that level that I will be introduced that Dr. Gopi Chandran, because my teachers, my mentors are there in front of me, and it is a big privilege that I am sharing the podium with them. Dr. Gopi Chandran presently working as a principal in charge in the AIMS, Delhi, and he is a president of Delhi TNI branch. Dr. Chandran has started a digitalization of the AIMS in 2013, and he have developed 2 apps, and that app was really highly appreciated not only in India, all over the world. Even though before this session you have seen that from the USA Texas he was discussing about that same app, and that is the Dhadkan 2. May I write, sir? Dhadkan 2. The word itself indicate actually in the collaboration with the AIMS cardiology department, they have started that, and all the data is digitalized on that. Every patient from that, they will get the complete treatment modalities, they will get their history, and after that again another innovation was given in the digitalization process by Dr. Chandran. That was with the help of palliative care department, onco, anesthesia, and that was a special innovation again. And for that, Government of India is also recognized his innovations, and he is awarded with the National E-Governance Award by the Department of the Administrative Reform and Public Grievance by the Government of India. And as a nurse, I am really proud on that. This award that is completely out of our field, if we will go there, but he is given or taken by a nursing profession, and the day sir was taking that award, it was a live telecast on YouTube also, sir, and we were watching that, and proudly we have that, yes, Dr. Gopi Chandran is from our profession. So it is a proud moment for all of us as a nurse, and sir is having a lot of innovations, lot of awards. Sir was awarded with the best teacher by the Kingdom of Saudi Arabia in the year of I think it is, sir, 2010. मैं राइट सर? यस सर, मैंने देखा नहीं है, मैं रिव्यू कर रहा था तो मुझे लगा कि मैं क्या देखूं और क्या ना देखूं इसमें से, क्योंकि वो लिस्ट इतनी लंबी थी कि अगर मैं पढ़ने लगूंगा तो मुझे लगता है सेशन का टाइम भी ओवर हो जाएगा सर. तो सॉरी मैं सभी अवार्ड, लेकिन कुछ अवार्ड्स हैं जो मुझे अंदर तक छुए कि एज ए टीचर कि यस, ए बेस्ट फैकल्टी अवार्ड फॉर ए इंडियंस by a foreign country, so it is really again proud moment for us, sir. And after that, sir was given the Dhadkan to this AIMS, and after that, even though best faculty by the TF universities, sir was also facilitated by the Texas Nurses of Indians. And sir, it's really again, I don't have word that I am introducing you. Thank you very much, sir. And without wasting of the time, I will request to the Dr. L. Gopi Chandran, please. Thank you, sir.
think almost very good afternoon to everyone. And first of all, I would like congratulate the NTI for organizing the 5th international conference very successfully, and it's like proud moment for all nursing teacher across the India. We know that Kapoor madam was mentioned that we are TNI and we have different societies, but the first society founded for the nursing teacher were not only improvising our our educational system in nursing, and we have to to explore and also to overcome the issues related to the nursing teacher. That is the vision which was started. And again, it's my always my privilege and also my my vision. Being a madam was the very very pioneer in TNI, and after I took the responsibility with the guidance and support from her, TNI is collaborating with all the societies, because TNI is not meant for only nurses working in the clinicals, and everybody who are the become member of the TNI always have different way they are working, is the clinical side and teaching side. Still that society, like clinical society, even I founded cardiac nurses society, and the NTA is for teacher society, or another scholar society. All society also coming up for their issues, for their improvisations. The TNI will support. TNI work together collaboratively, because it is not for every nurses need to come up and with their issues to taken up, and that issue should be line up with the TNI, line up, go together to go to the and to represent to the government. That is what our objective. That's why we are working together all the time. When I got come to know about Dr. Farooq, I am not know about what is NTA. I know only Dr. Farooq, the person who is behind this NTA. I understood that NTA may be the best. That what we learned from whatever I have background today, whatever I am working, whatever we are, he told we are the super nurses today, innovator, clinical nurses, educator, whatever Indian nurses doing India other. But during the morning session, which I heard from Madam Pimla madam and the chief guest, that is the only truth, because these all come after 20 years, 30 years, maybe added. All young people are very energetic. But today I can see Madam Pimla madam and another senior persons, Pity madam, they are what they are carrying the values which is given to us. It is not from the books. Even I write book, another person can write books. We may be knowledge, resource from, we got it from the teacher, which you learned, we facilitated. We may be inspired with your knowledge, that values which we are getting from family. Today I go to my village, they say that this is from, my family name, they say this is from, because that value with our personality and our projection, which we more important being a nursing person, which we learn from our teacher. When I talk about nursing teacher, India, whatever the India, what they are going to give information, what they are going to teach everybody, that is different. What you are going to take it. But I wanted to carry what Farooq, you have the values. What every teacher, what we learned from, Bimla madam, or maybe the Pity madam, or like very senior most person, and which we are able to see them, they are the student of Bimla madam. That is what we wanted tomorrow, because nursing is the profession never replaced with that values. Even we talked about knowledge, what we talked about, everything we may be super master, super, today India is progressing, same like our diverse, every country is progressing, India progressing, we also become progress, no doubt about it. But we never missed out a value, that is a core, which is for our nurses, what we talk about, empathy, compassion, that is our core. But we learn, maybe we from parents, sometimes some children missed out from parents, they can be corrected by teacher, with their projection, with their perception, which he wanted. So that's why I learned from my teacher. Even my birthday I celebrate with my teacher. I was shared in that in social media. I went to my teacher, she called me, I shared. Same time I given same sweet to my student. That was the moment I felt very good, this birthday, the 47th birthday, what I felt it. Because how the parents are, how much happy, same time my teacher was very happy. Same time, it is today I have seen many teachers, all are my senior people are like our teacher or mentor, which we want to carry it. We are in the middle generation. We are in the middle generation. Me or Farooq and all middle generation. There is younger generation. We have so much responsible today to carry on our shoulder. What we learned, that's why till we are celebrating Nurses Day. Because of our senior. What we are struggling a lot in the nursing profession. Even yesterday, I think Mr. Vikas was with me. I keep on talking with the Bimla madam. Madam, how it was happened, council, how it was. She was very enthusiastically, she was talking, because what she wanted to say, convey, Gopi, what we struggled, we given to you. She didn't understand why he is asking. And that way she is telling that carrying, carrying. She is given shoulder to me that Gopi, you should carry. So that way we are very, very, like you ask some story from your grandchildren, the grandchildren ask story from their grandmothers. Maybe the grandmother gives story that give the values. They give the not story. Story have lot of values they give. How to be ethic. Same like she was telling me. I was very much, even I told madam, within 20 minutes, 30 minutes, whatever the time available, I'm spending with you because it is not, cannot see or talk by telephonically. Even that I thanks to NTA, given me opportunity to see all our, to do that. Because I know this work is already published, work is already copyrighted. Everybody know today can do, but something I want to feel, to express, it is never come in that anywhere. That's why it is a grateful time for me to express what I felt it. So anyway, I'm again, the topic is well, coined, and even when they are making this theme, I was also interacted with Dr. Farooq about the team. Initially, we didn't think about that universal health coverage. Then we talked, then we come to narrate down that universal, because that way we are become international conference. And today you see Dr. Jackie, we are working together, and we have so many work, we are going to work together through TNI, and also I am also visiting there through AIMS. UTA now collaborated for the digitalizations. So that way we are working today for, not for the, even Indian nurses working in other country, think about welfare of the Indian nurses, welfare of the patient. That is universal health coverage. Which means we are all nurses, exactly we looking forward to move, narrow down what we exactly to outcome to improve. That improvement of outcome, whatever mortality, morbidity, quality of life, so many outcome we think. One outcome is very, very difficult to achieve, that already highlighted by our chief guest and also madam, that is patient satisfaction. Satisfaction of anyone, it is not at all possible unless to understand personalized, customized care. We say customized care. Even the home also we think about customized. So customizing personalized care, you have to do care. Personalized care only can improve or can be achieved, that what I mentioned, that is the satisfaction of the patient and family. How to do that personalized care? You understand the patient. Without talking, you cannot understand the patient. Without, interact with the patient, you cannot understand. Without your assessment, you cannot understand the patient. That's why today nurses are expected to, be strongly, in terms of the, in terms of the knowledge and also the skills, especially communication skills. That is the only one, is a tool or instrument can able to understand the patient. Even though whatever yesterday, some interaction with the madam also, we should not miss out anything because of using the technology. Sometimes we may be so much busy with entering the data, all the things. Really, it's a need of the hour to think every time, whenever we are making, do kind of work, informatic work, we want to improvise the care. Overall objective of my, presentation is, which already proved that reducing the workload of the nurses, reduce the clinical load of the nurse, because, today nurses coming to the ward, they are so much busy, taking some of the hospital, I don't want to say the name, start vital signs, finish the vital signs, the work is over. They don't have time to talk with the patient. And so much time they spend for writing the paper, they are finishing the work. So we expected everyone always to close the theory and practice the gap. But we teach, we student all the time ask, even after complete also, sir, We thought that, the advanced nursing care, whatever you teach us, but we are not able to do practice, especially talking with the patient. We are not able to, even not able to spend time with the patient to understand the problem and never educate the patient. These problems all due to the workload of the nurses, because of shortage of nurses and workload which is given to the nurses in different way made them to be, reduced. So for that, we thought that we go into the informatics system. That was 2014, because I am going to talk about only the aims. Why reason is, this model already established in all the corporate system, definitely different than aims like institution, government institution, referral hospitals. What is the reason is, the corporate, they invest the money, they get the patient feedback. Every time patient feedback is very, very important for them to improvise. Even they identify the nurse who motivate also. And they have the teamwork like quality nurse, infection control nurse, so many positions they create, including the nurse manager at different level to monitor them. They can able to capture the data. They can able to, interpret the data as the information. They can able to implement or to improvise the care as a evidence-based nursing. This is what the corporate doing. They are doing good. But still, they are working for the people economically strong or the patient who can pay by the insurance. But think about the patients who are coming from 3,000, 2,000 or maybe 1,000 kilometers, or sometime, they are coming from nearby also. They are with poor, sometimes poorest patients who are waiting in the, for the appointment of the doctor at the aims. And sometimes they're reaching at 4 o'clock. Even my heart failure patient or cancer patient, for taking appointment, they used to come by early morning, 3 o'clock, 4 o'clock. They are in the queue. I can able to show you some of the data also very quickly. That patients have pain, not only cancer pain, the pain of other pain which we talked about, psychosocial. And they are also don't know about, they are, who is poor patient, poorest. We know all the research already prove that is socio-economically weakest people, their education is also very, background also low. They may not understand the patient, their conditions, the treatment, which respond to the treatment also. They are not able to cope up the disease. They are not able to cope up the treatment because of their all the impact, including the family values. So family values is very, 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 most important in Indian context with anywhere I cannot compare. Either you are north or south, we are very strong today, India, even we are diverse with only one aspect is the family values. It is everywhere. I am very happy. That's why I told, sir, there is lot of difference between education south, north. I told whatever it is, we need standard, we need that, the basics fulfilled for every nurses. But same time, very, very happy to see every state when I am visiting, including that state MP, that values are very high. That is our strength. All will come with by a different manner. So they same way that values for the patient is very high, because the patient never give up. Family never give up for their anything, whatever the challenge face. Even they don't have 1 rupee, 10 rupee, 100 rupee in their packet, they want to do best for their family member. Husband want wife to overcome from the free from disease. Wife will fight for the husband, even though they are recognized. So these patients are very, very important, very sensitive. They come to the aims. Why I am telling this? Because that is the biggest question in our mind when you move into the digitalizations. The government is investing more for the digitalization. What is the need of the hour is patients should not wait for anything, and especially in the winter season. In Delhi, they were heart failure patient. They have the core dyspnea and fatigue. This is a very commonest problem. You cannot walk even. They are with pulmonary edema sometime. I still remember the 2013, they are in the queue. 4 o'clock, even they don't have that any kind of, to product the clothes for their, there is no clothes for them to product, because sometimes volunteers will give. Volunteer give food, but how many will get? So these patients wait for to get that, see the doctor by 2 o'clock in the afternoon. That much load of the patient, 10,000 patients visiting every day. Because why I am thinking about this, these whatever I am going to show you the module, all are existing in corporate. When these modules are come to government, This is our hospital. AIMS is our hospital, not my hospital, not the employer. All are our tax which you are paying, that for the treatment of the patients who are getting the same treatment what they are getting treatment Apollo, including our Prime Minister getting the treatment. We are giving assurance. We are assuring our treatment we are getting the best. So that type of treatment every citizen is getting today because of that, which we made it the system. And sitting at home, they give follow-up. And especially they mention about my app, which I worked for chronic disease patients who wanted, even in the remote, during the time of COVID, these patients are highly benefited. When I hear from him, sir, we are Tatkan app, one of the family member is using, he was very happy to say that today our app is, after the recognition of work, it is went to across the India. The government of India already taken up my work into implement all the government hospital today. Very proud to say that, because it's a nurse-led work. Everywhere I used to say nurse-led work, because Pibla madam yesterday told me why again bringing, because she is the one most of the time to think me to do so many things, and she always criticized that in the very positive manner. That's why I'm mentioning her name more time, because he told in earlier we do lot of work, but they will not allow us to work. They always make us to never accept, never promote. That I also faced the same situation from the medical community, or we can say from administration. Wherever you are there at AIMS, the culture is the same. Nurses never encourage, never motivated. I have the only energy, self-motivated. I have some of the inspiration, people like senior people like madam or like Manju or some madam, many good people who made some kind of, already reached some milestone. We take it as a positive. Then when I asked for money, they never give. Then I used to start to, ask the, people who are well, understand the nursing, like how that today chief guest speaking about nursing, same people. I approach the doctor. There is a 10 doctor will be there. 2 doctor are very nurses friendly. They always respect the nurses. I identify these people, collaborated with them, because sometimes you finish the work, they put their names. They are the one invented. They are the one innovated. That is the biggest problem in that everywhere in the culture and institutions. Then these people are very much patient-centric. Whoever patient-centric, they are professional-centric. This is what I understood from my experience. Whoever wanted the patient to improve, they are the professional-centric. That people definitely recognize you. They will always acknowledge you. So with that only, I made this first step without support from AIMS, but still they given me fund for some of the marker. But second fund, I got huge fund, 25 lakhs. Now I got more than 70-80 lakhs fund I'm getting for this different work, because that work, why I'm telling you, now they are telling that we are trust on nursing professions, which now many of my faculty is doing, because this is what my overall objective of my session. My session want to convey to everyone that please start to work, which you are already have very good forum today. I even during my period when I was student, I never went to this type of session, never heard in, even though very good institution I studied in Ramachandra, many people, but the inspiration, motivation, these all very lack, because no social media, no, kind of group which you want to positively look. But today, even madam, you had missed that time of period. But today we have very good people like associations, which is motivating you and bringing kind of support. But you know what you are going to do tomorrow, you are able to do that. That's why I'm just given this message for you. I quickly show you my, the work at AIMS, just for 15 minutes, 20 minutes. I know the listening capacity only 40 minutes. If after more than talk, even the madam spoke just for 15, 20 minutes, everybody attractive. So, because 45 minutes it's talk, then you feel that he came for, you started to talk. Quickly, I'll just show you what are the work at AIMS and just wind up, and you can ask the questions. That will be better, because that also we learned being a teacher now. Don't, put you in trouble. We will just make you to understand. Can you go the next slide? Can you have the slide moment? Yeah, this is the first slide. I already told you healthcare is the process, because whatever I want to speak already they expressed by the seniors. They told now medical profession is forward. We are moving from non-invasive, understand, very minimal invasive. That progress happening in nursing also. Overall, this progression is to improvise our system. System is improved, outcome is improved. So system is improving, need to innovate more. That innovation only technology. Today, India is strongest country, we say, because of technology. Everybody, Indians are, innated with that intelligence with the technology. No one can compete, So same way, very proud to say, India again have the quality of nurses, which was every time. Only thing is, I don't want to export them. We don't want to export our, nurses to other country. We want to retain our nurses. We can export the engineer, but we don't want to export our Indian nurses. That is what our worry, our seniors worry, our worry, at least young generation, we want you be there in India to do best that. But still, they are happy when they are going outside for their life, but we want to keep it you. So that innovation, healthcare is the process. It's a continuous process. We are traveling. What I have seen, you are going to see different. So in that way, technology is the most important today to integrate, because we know technology, we know healthcare, how we integrate both to improvise our system, which the student, student also in education, or maybe in terms of the, for the patient, how they feel should be comfortable. Today I can say everyone Google Pay, yes or no? Everyone is buying food, this you are happy. You are happy, why? Because the system is helping you to reach everything at the time. Same application, either mobile application or informatic which you are using, it is helping the patient. From the home they are taking appointment. From the home they are getting their prescription. From the home they are taking the medicines. No need to go in the queue. The queue is, we are waiting in the queue in the bank before. Today you are doing internet banking. We are happy. We don't want to go there. So especially in the COVID era, we don't want to go any crowd places. That much technology is helping. That's why this is continuous. Next one. So whatever I told you, I can say 20 years we are backward in terms of that, your nursing profession compared to other country. I think people who are visited other country don't know very well about it. But still, we are the best one. But still, our system is lacking. But when you see the healthcare perspective, still we are backward, especially in the government services. Especially the services which is happening in government sector, including AIMS, I can say, because 2012, when I entered into AIMS from abroad to here, I felt very much, bad, especially nursing system. There we are lacking. Nurses are best in doing, why lacking? But corporate, maybe they are good, but again there is a problem. They are not paid very well. See that everywhere there is a difference. System is good in corporate, nurses are not paid well. Here nurses are paid, but they are paid, but not respected and valued and utilized in the proper manner where they are supposed to do, or their career development should be there. You see the differentiation. It is not only the service side, in the education side also. Everywhere nurses are same, like in the facility, in the hospital also, lot of stagnation, because when you go to the doctor, 150 patients around one doctor. Even my heart failure patients, before my app was developed, my system is developed, that time, the doctor never interact with the patient, only see and sign. SR will see. And now after the development of nurse-led heart failure management, I think everybody know across India that nurses is only one evaluating the patient. Nurses only to see the interpreting the ECG and all the things. That much of system is developed. Again, the support of the doctors. Without their support, we cannot implement anything. And same way, these all this type of lacunae. And again, we started the informatic. Senior most nurses give lot of resistance because they don't know how to operate the system. They don't know how to on the system and system computer. And they don't know how to have the email ID. They are not able to fill the form, what to create the login ID. Why I am telling this? Because there is a nurses working at 25 years is very smart. Nurse working it because they are very much good as a nurse technically. Technically they are a very sounded nurses, but literate in computer is very, very, very low. But one of the very happy to see today is a smartphone. Yes or no? Everybody, including the 80 years, my father also 87 years, he is working very, very good. And 7 years infant, child. They are, small child also know everything. They are teaching us, because you go to home, you work, then come back, they will find something new for you. Okay, that much very, very, very in the way, the moving of that digitalization, that is also helping today nurses very quickly to understand. Next one. And health informatic, I think this is a very common terminology. Integration of information, IT, computer, it's a kind of programming. Informatic, again, IT technology, it is a hardware which use the system, and both are integrating into nursing and nursing services. That is called health informatic and nursing informatic. And again, if apply into the whole system of the process, health informatic, apply only to the nursing perspective, it is called nursing informatic. Again, nurses are the only one as the facilitator or catalyst can lead the informatic. The reason everybody know, because I told you, in and out, patient get into the ward and the OPD or maybe in the emergency, till discharge, only one person is carry out completely and know the process, know the status of the patient, and again the patient is even discharge, educate and do that, the what to be follow up. All are only one person, one professional is the nurses. That's why this informatic more relevant, more lead by the nurses. That's why it's called nurse informatic. And in 2013, with the leadership of Dr. Mishra and colleges side from my side and Dr. Deepak from neurologist, we all had the concept to bring it, because this is the very oldest concept in other country. You can see 1960 they started in other country, but India everything is 3 decades, 4 decades come to our, especially in the government sector. The private they already started in the even 1994 and all, but we started this module at our AIMS Delhi in 2013. That way we started our journey in the AIMS. Can you go to the next one? So we understood that the HIS health informatics system is the need for the hour. We need to implement, patient need to be benefited with various reasons. One of the most important reason is we need to improvise the care need to be quality care. How do you make sure that quality? Every time talk about quality. How do you make sure the quality? The quality you have to ensure through your data. The data means, madam, or somebody talked about the bed sore. You talk about the patient is fallen history, the patient have infection, whatever, that all the data need to be reported in the accurate manner. That data is the one give you that, that information. Patient are under risk or your care is not provided as per the standard. That standard only need to be captured. How you capture? That capture is the informatics system. That system will help you. You need to improvise. And other than that, in the health administration also, you want to shortage, you want to place your bed occupancy, depending upon that use, the patient will be transferred, and nurses duty today, duty roster for the OT, we want, or maybe some suddenly multiple casualty come to emergency, nurses immediately to, transfer to the other ward. Everything is made today by system. I can quickly show you what are the informatics system we have that help you to understand how we are going to do. Next one. So we have so many system we build up, because I told you from patient admission, discharge, the patient again for the OPD, again for the ward itself. Again, there is a different procedure, most important for the lab investigation and radiology, discharge, again for the scheduling of the OT and dispensing of the drugs and for intending medicine, procurement, all store management, everything is taken care by app. So that way we are very much happy to say that, including dietary module, what type of patient getting, like renal patient, it's getting different diabetic patient, hypertensive patient, all modules we have that can be taken care of this app, which can be delivered by, prescribed by everyone, but can be implemented by only nurses. Next one. Yeah, we want paperless work, because what is the advantage of paperless? Now all are in cloud. You take today morning you took some photograph in cloud. Nobody can erase it. And I is very happy to see that today I opened one message coming. Last year what you have done it. So your memories are coming. That is what, because paper we don't know when it be saved. Even today, whatever office paper I am receiving, immediately I take photograph and put it in cloud. Because never erased, only you have to go with the search with the name and the date. That much facility we have today, we are able to save your time, save your data. That same way we are also able to manage in the healthcare informatics. Next one. So these all the requirement today we need it. We need software, we need hardware, we need LAN support. That what the very important, because network is very difficult for Wi-Fi network. We need LAN. That LAN is centralized and centralized server, And also we have different program we are using. Next one. And again, I told you, it's all customized. Every modules are CCU, ICU, dietary, everything I told you, depending upon that modules are developed. An in-house module. For AIMS, we made our own module. We never copy or anything taken from any other corporate or any other company, because we configured our own module depending upon our patient, because every patient diverse, institution is diverse. You have different department, we made it. Next one. Next one. I already told about this system, hardware, software, all are today. I am very happy to say today different program I am learning. I learning many codes because to build up my app and all. Really today nurses are very good. I can see they are working in different area which need to be. Next one. And you see the Python is one of the latest program language. Even you people tomorrow you want to become nurse informatic. I can see so many roles. Even I went to US. I met one of the informatic entrepreneur. He is earning in a crore million. He is learning because he's CEO of the company. So many nurses today are Indian nurse only. Indian nurse who graduated I think from RIK only. I think RIK or AIMS. They were now settled in their 10 to become nurse informatic. They become CEO of the company. Under them many doctors are working because they learn the technology. They learn the technology. It's I think only for 53 years old. They're doing very good work there, because I am telling lot of scope. Young people are who are sitting there, because I told already nurses, as being a nurse, being Indian nurse, you are already well qualified in terms of again values. Again for the intelligence wise, all Indians are very innate in nature of that in the term of IT skills. That is, I myself realized I am also very zero about computer, because we were not taken that much serious when you are studying. But when you start to learn, we are very much interested to learn. That is our innate nature. We learn into IT very quickly. That's why I'm telling young nurses today, lot of scope being informatic session, career. Please seriously who are thinking or sitting over here, you are maybe very good. It is not required in language. You don't require language English. You require only your patience, how you are interested to work into the next one. Because I'll show you the nurses today how informatics works. Next one. And this is what implementation we started. Next one. We built it our IT implementations. Next one. We have different program. We made it program depending upon how to capture, how to process, what output to give. Output is our the data, which we able to give the information from our data. Next one. And I already told these are the modules, customized module at AIMS Delhi. Next one. These are very specific, especially national level data like birth, e-birth certificate, death certificate. Today, without birth certificate, you cannot do anything. There is example, one patient may be delivered at AIMS Delhi. He went to maybe to another state. No need to come back and get the certificate from AIMS Delhi. I know earlier they used to come, even especially lot of challenging for them, especially in the COVID. They cannot come and take it, but they can just log in and username. They can print out, print out. The same data will be lying to the different department. Example, they go to the some of the department, revenue department, banking department. They can show that they can able to take download from their from the web page where it is synced with this. All are synced because government portal, NIC, National Informatics Sector, synced with all the government sector. Whatever you are getting certificate authenticated, it is not required any signature. You just print out, you give the numbers. And if they want to validate your certificate, they can go and see their web page. That type of system really helping today for not only for the PMW, for physically handicapped certificate, any certificate today you wanted, that can be digitally can be done. And ED module in emergency and quality assurance, many quality assurance model today we are working. Quality assurance nurses working at AIMS Delhi, infection control nurses working at AIMS Delhi. Earlier we never think about this type of nurses, specialized people working at AIMS Delhi. Today many heart failure nurses, organ donation nurses, palliative care nurses, many different, even diabetic nurses now we are developing. And very happy to say I already developed module for MI nurse-led MI clinic. Very, after maybe 1 month it is going to be implemented with the support of HOD, because we proved as a heart failure nurse. Now they are happy to be to be taken as a MI nurse, because MI nurse is a very, very huge demand today for follow up the patient. That is a very, very demanded today, because MI is a killing more, than anyone. That's why we want to initiate this. See, all other modules, e-learning also know that we developed so many modules. I developed my Dr. Poonam Joshi developed for organization model. They learn, nurses learn at anywhere during the weekend. They do pre-test and post-test. They can get complete the certificate. It is mainly for, we started for AIMS nurses. Now it's open to other nurses also. They can able to get it. This all DNC credited, certificate will be provided. So next one, quickly we'll move. I have shortage of time. So we already understood what is informatic, and this is a history. Can you go next one? Next one, we have different position. This is 1965. You see that very, very old concept. Today we talk about informatic, but today we are at AIMS, we are and other institutions, we are providing the best. Next one. Next one. Next one. Now I think can you go back one thing? Today ANA and also for the American nurses licensor, they are credited credential for their examination. Before informatic, anyone can become informatic. Today they have to clear the exams with relevant to the IT informatic. Then only they become full-fledged informatic system. Before 1990, everyone become informatic. Now they made standardization. They should fulfill the quality. They fulfill the credentials by examination. And examination also every 2 to 3 years they can be update their knowledge and clear the exams. Why I am telling you now, all system standardization coming in other country. Same India also. Now we are informatic nurses. Maybe future they may also undergo some experience and some kind of credentialing for that. So overall, right information and the right for the service to the patient. You can see different role. I told you, entrepreneur, license, project manager, educator. You see today COVID, everybody succeed in the education by online. That also majorly contributed by nurses. We are working in the e-learning, many aspects that can be taken. Next one, and decision support, consultant and system analyst. I think one of the huge wanted. Recently, Triple IT, they invited me to talk on my product. I think the very, very prestigious for me that time. We myself and even I called ministry also for that, attending this. ADGN also came. Many people are come from IT background, engineers. Then we also presented, and no doctors are there for innovation side. So that was a very proud moment. That time we told the system analysis, most of the people they told nurses is the very appropriate person. They come into the health system analysis. This is one of the very good scope, because today highest scope, highest paid for system analyst. I think everybody know that. Now they're moving into they have that kind of configuration developed by analysts. That's why I'm very much stated so many healthcare product, healthcare IT, improvisation, all are today depend on nurses. Nurses with the IT skills, they can prove, they can do many things, because I know everyone want to get into invest their knowledge for get some good money, because your parents are so much suffered. You become from very poor family. Tomorrow you become the best in terms of economically good with your knowledge. That this is one of the area. Nurses not necessary. Maybe you work as a clinical nurse for some time to learn the system. Later on, you extend your career in this area. It will be very good scope. Even also you travel to other country very easily than any other nurses. Next one. Very quickly we'll move. I'll show only the next one. So you see the data, the huge data. This is I think I 3 year, 4 year before the data, still I'm keeping it. I didn't update it. This is for patient coming to age 10,000. You see the new patient every day. This all every day. 7,000. Revisit patient 10,000. See so much crowd every time you see the patient. With informatic, cyber attack came in last month. I think everybody know that. Whole AIMS is paralyzed because we customized to work with the system. Because of the IT, patient is waiting for same like you, appointment, everything. That time we felt it, how the IT made the institution very comfortable. That much, very, very good. Today the system is improvised, but still AIMS have challenges like this cyber attack we have to face. Next one, we'll go quickly. And the next one, this is what already spoke about. I just show you you go to web page, AIMS web page, you will learn yourself. I don't want to give you all the information, but just highlighting you what are the system we have. You see that the first page, you will see the all module we have, pathology report. You can see the duty roster, nurses. Even I am working now after I become appointed. I think everybody know that I appointed as a e-governance unit. at the first time nursing person getting into the post by the director after my award. They told me to improvise. We have developed 70%. Even yesterday I told madam, 30% of the work is nursing care perspective. I want to bring Nanda module into that to configure. Nurses enter into the clinical science, they come to know what is the diagnosis, because every time our nursing students see my faces when you're doing nursing process, we do only at the college level. When you go back, we are not able to do that. Now we visit even Texas University. I'm going up, the AIMS is sending me for 1 month training there to integrate this, how they made Nanda integrate into the practice. That's why she was telling Gopi will be excused and he will go to AIMS, he will develop. That way really I am proud, because that opportunity, because I'm working at AIMS, whole fund is by AIMS. I know that you people also getting into opportunity, and NTA, TNA, even last meeting I told TNA should fund the nurses for this type of fellowship. I already proposed, because I don't want get only like me to benefit. Everybody need to get benefited. That's why TNA already proposal submitted, madam. We requested the good professional to fund it. We will send to the different institution by regional wise. We have enough fund, TNA have enough fund only to do better for our profession. And same like in future, NTA is growing more good. Please, the same way you also support and do that. So I just quickly show you later thing you can see in your web page, because it's all self-explanatory. Next quickly. Yeah, you see this our PDS system. When you go to enter, you know your patient. You no need to go to check. Example, one trauma patient you are received. You know that patient is phone is off. We don't know where the patient inside. You go on reception area. You enter, self-enter. You no need to go to any receptionist. You write the name, Aadhaar number. You will get the detail. That much very, 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 it's all, it's like, whatever we imagine that all happened today at the AIMS delivery system. That is one of this called PDS, patient display system. And we know what are the patients, how the patient, every detail will become in the display. Same like when you go to railway station, you know whether train is late or not. Same way this happened. And all I told you, pathology report, radiology, take the X-ray, and wherever you are taking X-ray, you go and receive the report from that. Radiologist sitting in one room, technician sitting in one room, you go on that. You want that X-ray image you wanted, that also can be do that. Easily to come to your, your login. And one more very good system is Abaha. I think you heard about national, number for the patients. The patient getting treatment at AIMS, they go to Chandigarh. So no need to carry any of their document. They can go the only login name and your user mobile, because OTP come in your mobile. But it's only applicable to the hospitals where they are already by NIC format, because this is also most important. Some of the patient, chronic patient, heart failure, they have 400, 500, seats which are treating for 10 years, 20 years. They no need to carry anything. Everything in your cloud, they can open and see that current treatment. So that much facility today, especially the Prime Minister, they taken Yojana, they taken a lot of initiative. Their act, digital act is bringing to the reality today, that the system is so improvised and bring the outcome. Next one, I quickly move because it's a very big and very different forms for the employment, even for the job who are working. Anything, even the casual leave they want, they can write it. No need to give the paper. Only sanction. Even today I come to conference Gwalior. I applied the conference. I just went to that only digital. They have taken permission. It came message to me, you are permitted, approved. That much facility provided. Earlier, very, very different processes. We have to say, we have to call the, officers, whether I permitted or not. They will tell, sir, see your list. That much we are facilitated. Next one. An e-hospital creation form. It is be centralized in a form. No need to open every time. And you need only your Aadhaar card, your national identity, whichever the number you have that. Next one. This is a form. Anyway, it's all available in the website. You can go through. Next one. And you have lab. I told you the different lab. You have the module. Quickly we can go. Next one. Next one. Yeah. Next one. So this is for the blood transfusion and for the organ donation. It's the most important. Even yesterday also I got one call. Even some of my group, group, and Empower group, sometimes they ask, please donate the blood we wanted. So nowadays we are making it centralized. Anybody want to, for their particular blood group, they can immediately, they can log in, they put it, that go to the server and go to the person who will, any nearby hospitals, wherever they are, all blood banking is now integrated. They can get the blood. Again, organ donation. Somebody want to donate, one brain death patient is at, in here, in your Gwalior. You want to donate your organ, you go into centralized registration. Your organ can be procured by different institute. This all be central. All are transparent. One of the very, very good thing I can see, which is the advantage of this transparent. No one can, to hide anything. Everything is transparent from person who involved and public involved. Public also know that what they are getting. Nobody can hide anything. This is one of the very good advantage in informatics system is because in paper only within me. I am the only to close and I can, damage it or whatever. But in the we come to digital, everyone can see, anyone can be document, anyone can be utilized. Same like what you are using as RTA. Next one. So these all module, you go and see all modules are there. Your storage, procurement. It was very, very good, especially in the COVID. Suddenly we are, our mask is, less. Especially one of the very good things, some injection like in one ward available, not available, like morphine. You want morphine. So earlier what we do, you ask the store. Now what you can do, you procure from other ward. Example, you can check in your system, next ward having this morphine or not in the stock, you can able to see. Then you can call them, they will give immediately the transfer your drug. Then later on you can able to replace it. But before we don't know where is the drugs, because emergency the drug need to be taken. That also be today taken by care of this. Next one. And pathology report, I told you, sometime biopsy, so many things can be. Patient no need to come back. Any report, even they train to the another hospital, no need to come back. They can print out from their own and your from place where you are. And even lab, today you give your lab report, you take it by evening. 3-4 hours in your lab, only you need your login, your password, which will be get your mobile phone. Next one. Next one. Next one. So all blood request already told you. Next one. Next one. These all the so many future you go inside, how you request, how you get the order, everything is documented in the proper manner. Next one. Next one. This also for death registry, national death registry. Next one. Next one. Next one. This for daycare, especially for chemotherapy patients. Very, very huge demand. Very costly medicine patient come for only chemotherapy. They can get the appointment through online. No need to come and wait whether I can get today or not. That also can be facilitated. Next one. Next one. Yeah, and anesthesia also. Okay, fine. Next one. Next one. And lab module. We have lab module already explained to you. Next one. Next one. Next one. This is for the radiology system. I told you radiology also easily can interpret by radiology wherever they are sitting. Earlier we used to carry the X-ray, you have to wait. They give the report. Everything can be interpreted. We see that this workflow of the radiology. Okay, next one. Next one. Next one. This for the office module. What we are employee we are using. Next one. Next one. Next one. Next one. Yeah, next one, including your performance. APAR also we are using by online. We never give by paper. So where I still then all are centralized work, which is be developed. We get my input. I have worked in different organ donation. I worked in blood transfusion. I supported informatics center. So many classes. Even my first session in TNA was the informatics, which I given 2013, where I introduced myself to the TNA. This is Mark. I started myself. I understood that there is no continuous care in the government hospital. See that government patient come, discharge. After discharge, we don't know whether what the patient is alive or not, and patient is getting treatment, whether they cope up the treatment, are they following, who will take care. But private hospital not like this, and home care available. They are, because they are rich people, they come themselves when they are trouble. So I realized myself, the poor become poorest, and poorest people are dying because of no motivation and no proper education provided to that. That's why I myself and Dr. Sandeep Seth, cardiology, who we sit together, we develop the system is nurse-led heart failure management. In part of the management, yearly we start with WhatsApp. We started with so many things which is not worked out. When we started with the mobile, patients start to close the mobile because they are depressed. All heart failure patients are become depressed. They don't want to continue because they think that if I leave, my family is suffering, all money should go to the money, to the family. I don't want to wait. They never follow up the medication. We decided that need to be connected. Patient need to be connected. Patient need to be follow up. That's why this app was developed. This is the first app I can say, in related to the heart failure, which he developed with support of the IIT Roorkee. I'll just show you the futures because of time limit. So I'll just quickly show you. Next one, but I involved all the nurses working in the area because that's the most important. Integration is more important. Educator will lead, no doubt about it, but we need support from the nurses. Then only the implementation can happen. Otherwise, educator do and go, it will not reach. So we have need always team nurses. I never don't want to use the word clinical nurse, teaching nurse. I want to use the word nurses working in clinical, because today nurses with the PhD also working in the clinical. Nurses working in clinical, nurses working in teaching side. But all of the nurses need to be integrated. So again, we need multidisciplinary team. We doctors are there. So go next one. This is a model. This is a model where I found some patients are need to be taken care. Patient need to be monitored. There is a gap. If I found everywhere in all the government sector, everywhere in AIMS also, patient never followed up. Especially poorest patient, because AIMS coming, patient come from Jaipur, come from Gwalior, come from Bihar, come from Chennai also, the patient coming for referral, which is not to be taken treatment, never followed up. Then I understood. Next one, we have developed the app, same login, very, very, very important, because data is very much, sensitive. No one should take any your data, patient data. That's why we used all government portal. See, in IIT is the government. So never use any company, because sometimes they may sell out, and ethically you will not permitted do this type of work. If you are working in private university, or your ethical permits may be happen, but AIMS never permit anything work with the use privatization or private partner, because data cannot be authenticated. That's why I took the help of the IIT rookie, Dr. Deepak. He's the professor who helped me. Next one. See all the data. I usually collect the data from everyday patient. They measure the weight, they measure the BP and the heart rate. All will bring the data. It is two-way communication. Nurse will send the data, doctor will also reply according to any changes, including if they have chest pain, they are dyspneic, they take the X-ray and ECG. That also they can upload and they can send it. That also future will be there. One of the added advantage today, recently what I did, I wanted to capture the ECG to interpret, because sometimes doctors are not able to interpret the ECG, even MBBS doctor, especially LBB, atrial fibrillation, very common. Today our app is able to interpret ECG, LBB. It gives 300 ECG we tested. That is one of the best feature I can say in this app, which is able to do that. We move to the next app. This is what the first app, which was successfully implemented now. Today 200 patients in a heart failure clinic are connected with this app. They are continuously follow up. We have 7 nurses, heart failure nurses, dedicatedly working and connecting. And still I'm very proud to say that we are the team, we created this and do that. Next one, we go to the next tab, and also it will give automatic, madam told automation. Automation means the mobile, the app itself give that alarm to the patient, to the physicians. This variation in the BP, more than 10%, variation in the weight. Within week, the patient improve by 2 kg, because weight is the most important for heart failure, because of fluid is increasing. You give message to that patient, message to the doctor also, this patient under risk, immediately need to be follow up. Patient will be called telephonically, come to the emergency, we treated wherever, or we'll tell them please go to the doctor immediately, because otherwise they ignore. Next day they have pulmonary edema, they die, cardiac arrest. So these all management we taken from this heart failure app, which will be successfully. And again I'm telling very important, she told, this work is published. This work is published in the PubMed and Scopus Index journal. It's across the world now come to know our work was recognized. This is the first one, and also it was showed to the other country also we are working. The next one is cancer patient, and we understood this problem, and we realized that we want to improvise the same system in another area. I worked in cancer patients. The cancer patient, very difficult, they ignore the pain, they never take the pain medication. The pain, not taking pain medication, the quality of life become poor. And also because of chemotherapy, other radiation, they have complained like nausea, vomiting, these problems also need to be reported, need to follow up. What is the advantage of this app? The app will give alarm. The app will give alarm. What I learned from first app, I understood that need some kind of motivation for the patient. The app will give, for example, 8 o'clock alarm will come, you have to take medicine. Alarm will give for the patient will take. But the heart failure app, we don't have the futures. That's what the app was differentiated. Next one. This is the app. I think this is what I received recognized by the government of India for this, for the award, because we give SOS. We have medication also they can report. They can also report nausea, vomiting with the scale. Whatever the scale you are using, all scales are there which they can able to report. When they come to the patient, next one, when the patient, we have web page also created. Earlier I don't have web page, now web page created. Web page is handled by the palliative nurse and doctors. They can open, they can do inpatient. Just 2 minutes, finish. So this is what the happening in this. Next one. And you see the graph. I told you all data we are entering, it should come as information. It should come as information because the physician will take decision according to that data. So here you see that graph. When patient come for follow-up, they open this, the app, this web page. The patient became the history. Yesterday, last 10 days, how the pain was the patient. What last 10 days, how the vomiting was there. Because when the patient we ask, no, sometimes they will not tell. They cannot able to remember because of mostly cancer, heart failure patient or old age patients. This data not only enter by patient, family members also. So sometimes family member not able to accompany with the patient during the same number, whoever done it. So these all help us to doctor to decide how they were able to. One of the very good advantage this app is, app doesn't require any network. First app need network. This app you can sit at home, you do. For sending the information, like whatever they enter, it come to us, that need only zinking. That zinc need network. And even remote village also they use this app. That's why the app was very much succeeded than for the other app. So this is my overall my journey, my work which you wanted to empower the patient. So you want to empower the patient, you want to empower the nurse. Why you always think in mind why nurses need to be empowered. It's all from our topmost leaders. They know that all the time the question come from the government perspective. Why we have to invest in nursing? Why we have to empower the nurse? We understood everyone, you want to achieve the universal health coverage. You wanted to empower the nurse. Empower the nurse, only empower the patient. So empower the patient only what we expected our family member. That's why the empowerment, the patient is by self-care. Self-care of the patient. The self-care is the most important. I know everyone today think about my father took medicine, my mother, madam think about Mr. Kabur has taken the food or not. This is every time we preoccupied with others. That is our values. That is our values. We proud that. But because of that we feel stress ourselves. We are not able to perform. Same thing happening with the family, patient. Patient all the time not taken care properly. We need to empower the family. Again, empower the patient by your education. That's why all the time student, they are educating the patient for the requirement. Yes or no? To complete the requirement. But nurses need to educate the patient that for empowering them. With that, I conclude my talk. I know I took a very, very elaborate manner, which I expected something, but I cannot cut down anything. Still, I was modified. Thank you once again very much for NTA, share my thought. This is our informatic nurses, 50 nurses working.
Thank you, sir. And we can now open the window for question answer session. Have your questions.
Yes, madam.
You very rightly said that is, we are not talking of the private corporate because they are already practicing. Because they have to have their money invested.
But these app and all, they are not following.
No, my only request to you would be, if there is a time, if they can sort of practice that app once. If you have time, sometimes today, let them try it out.
Because these are all in my official mobile. Because my
okay.
So no problem. I can during the time of some of the programs.
Okay.
I can whenever there is an online program, I can able to.
Because I would like
demonstrate.
I would like to try out the app. Because
no, that I can send to you.
Okay.
But we have unique ID which will be patient only for patient creating.
Okay.
Otherwise, it become dummy for you dummy.
It will be dummy only. Okay. Thank you so much.
You can use it, madam. It's see, this all work are copyrighted. Again, what madam was telling, because that was our mistake earlier. We do some work, we just think that we finished our work. Please do copyright of your work. Then only it is authenticated that nurse, innovated by nurse. It is not Gopi Chandran alone time. Any nurse you do, same like your book you are writing, same like copyright your work, that become more good for the add-on.
Now, though Dr. Sandeep has told you that it is a nurse-led,
Yeah.
what a nurse-led?
Nurse-led clinic, madam. Nurse-led clinic, nurse-led heart failure management.
Nurse-led heart failure clinic. But it is not being mentioned anywhere on the...
No, this is not the talk. This talk is different. Nurse-led admin. I'm talking about only informative.
Acha, that is different.
That is different.
Okay. But
we have different
written,
program.
Is it written nurse-led
Nurse-led heart failure management. We have developed all module.
Thank you so much.
This forum is, I'm talking about only informative. Nurse-led heart failure, we have different module. I think now they arranged some session here for 1 hour for me to, to disseminate. So this is different program. That is, we will talk about whole module for inpatient. Even SGT, I have done it 2-3 years before. For across the India, I have done it. Almost 38 institutions I have sensitized the nurses. Almost 5,000 nurses, student nurses, I sensitized. And some of them, they started clinic already. In Ramachandra started. AIMS, Bhopal, they started. It is also the work is initiated. Okay, anything?
Anybody else want to ask the question? You may ask. No one? Any staffs, all the participants, I request you to ask the question. If you have any questions, please ask. Please provide the mic.
Very good. From last row.
Actually, sir, I am listening very attentively your deliberation. I have a question that you mentioned that the app you developed is working without network. Can you explain how it works?
Yeah, actually see, every app need network. Okay.
Yeah.
So without network, you cannot do open and you not enter.
Yeah.
Because even we worked for now booking our railway booking, we did it without network you cannot book. But our app we configured, with the language, with the Python, that we have that coding. We have to put on coding. That code will help you to make it to work in offline for entering the data. For online, you have to send the data. Understand, member? That is a coding. That you learn it being a coder.
Okay.
Okay. So we are that is the most important language. C++, C, Python. The Java. That is a script you are writing.
Actually, you mentioned that we are very much illiterate in that field.
Yeah.
That is why my question.
Yeah, good, very good. Because I told I am also very much illiterate before entering this, work. Actually. But we are learning. We are continuous learner. Even I am also every time thinking, I'm going to US also learn many things where we can able to put our integrations. Because we have to learn from the technologists, not by nurses, but we apply into our profession, then you become nurse informatic. So that way you will learn very quickly. Now online courses, many courses are there for IT skills that you will complete very easily and you will understand. Only configuration is matter.
Okay, sir.
And
actually,
you become architect.
I'm really very want to thank you, sir. Actually, from core of my heart, because you have done very good work for our inspiration. Actually, for our motivation. Thank you very much, sir.
Thank you. Actually, the overall forum is that is inspiration, like what when we inspired from our seniors when they talk. Same like what I am doing today, carry out. You will carry out. Yes or no?
Yes.
That is what the forum is objective. That NTA is doing. Okay, you should thanks to NTA only.
Very enlightenment session, sir. Thank you very much.
Gopi, madam. Hi. No.
Are they being paid better?
That was a very important question. See, I am very.
I'm always concerned about that.
I am very much delighted to say that, madam, everybody know that these people are invited. Lot of abroad. I think both, madam, I can say they would have went to abroad. They would have get 10 lakh rupees. Would have maybe during your service side. I know that your value. I know your CV, but they serviced. They are we can say many models they created at IGNO. I know that whole India know that. But same way, I am getting not very good salary, but getting what I am satisfied. But something cannot replace by anyone our satisfaction. That's why these nurses, these nurses, nursing officer getting same salary, but highly satisfied, highly motivated. Only one of the very bad thing I can see, these nurses not staying at the AIMS. After 2 years, they are traveling to other country because
then it is all right. Then I am happy.
That is only the outcome they are getting, but the system need to be developed. This is what, since union, nurses union or TNI, keep on respecting, again it's the hand of the chairperson of the NMC bill, who already made that kind of specialized nurses to come, the solution will come very near.
Okay. So there is a hope.
But again telling you, one thing, please don't work for the money currently. I'm telling at my experience, especially working in the government, work for your recognition. Recognition not by doctor, not by the administrator, recognized by the people, from the patient and the society. That is the permanent and valuable recognition that we make us proud, all the nurses across India. Because sometimes doctors say you are the best. Oh, excellent.
Question is, I think we need to stop for the next session. The question is, because this I can argue with him when we are traveling in train. See, I talked this 30-40 years back when any of the nurses will go abroad and I'll grumble, But now I say, no, it is good they go.
No.
Because, one minute. But see, I agree with you that we should work for recognition. But there is doles of money in the country. The AIMS has got a lot of money, So they can always, yes, I agree, it is initial phase, but gradually we should work for it, Because if these resources go abroad, then you will have to prepare more resources. Okay, we'll continue doing that. But then where are we, The experienced people will go. So what my request would be, that it is a high time now that you tell Dr. Sandeep, that let us see that some motivation we give them, and whether you agree or not, whether anybody agrees or not, money makes the status. See, money makes the status, whether one agrees or not. But I will stand with you. Initially, we have to work towards it, but we should gradually keep on fighting for it, Gradual should not be 10 years. Gradual should be 10 weeks or 10 months. Thank you.
Only I want to answer to Madam. I know when I was abroad 10 years before, I have the same statement what Madam is having, that, I want to go to abroad. I was getting my salary 2,50,000 in 2012. I was the principal and I was the very big positions in government of Saudi Arabia. I left the job. I joined for 55,000 at AIMS Delhi as the position. Please understand. I was only for family I came. I thought that I enough money earned. I want to back only to my family. I have to come to India because everybody interest. But after I come to India, this is only 2 minutes. When I came to India, I realized that time I felt, why I took wrong or right. But after 1 or 2 years, I started to work. I understood that definitely the God pushed me the right directions, because money will not give you everything for every person. It is individualized everything. Understand? Again, I am telling you, people really wanted to go to abroad. It's according to your background. You want to have some commitment. You are not utilized very well, go to abroad. No doubt. But when I went to outside country, they have 3 cars. They have very big bungalow. But what you are smiling face, no, they don't have. They don't have. Including Jackie. What I have the face, they don't have. She don't have. They expressed myself. We are the best one here. We are the independent practitioner. What is the reason is, again, your family value. Who have the family value in India, they never go abroad. Even they go, they come back. Second one is, who are the people working at private sector? They are not lining with me what I am doing. They are already underpaid. They are not valued. I told you, take your own step. Yesterday I encouraged with Iman to, please do. Because their energy need to be taken. They need to be utilized if you are not utilized. But I am in the government. I am taking the tax paid by the family, even the poorest person who is also paying money for me. I have to do my best, which when I feel I'll stop it. Today I get offer in 4 to 5 lakh in other countries. Same university invite me to job. I can get the highly paid as per my work. But my father told, he is also from government side. I have 3 sons. 2 sons are industrialists. but my youngest one, you are the best for me. Because the way you work, you are giving me the proud moment for me. That's why I am saying thank you. Thank you very much.
हेलो सर, excuse me सर, excuse me सर, एक रिक्वेस्ट है, कोई डाउट नहीं है मेरा, इसमें हमको खाली एक नर्स देखनी है, इस ऐप के अंदर हमको नर्स देखना है, नर्स का रजिस्ट्रेशन भी होना चाहिए एज अ एजुकेशन पर्पस.
Exactly. I told me that the nurse and doctor both are using.
Okay.
And
But,
doctors, giving the treatment. That's why we
yes.
used it. But
Okay.
very good. We already, I pointed out.
We
this
are
one.
talking regarding the independent practicing. So for that only, I just would like to motivate all the nurses to be a use this Dadkan
No,
app.
definitely. We already, I pointed out, because some kind of empowerment still missing.
Yes,
We are not overcome immediately.
That is what
overnight.
we are requesting, that
Yeah.
please do
Definitely.
something for this.
Definitely.
Yes, sir. Thank you, sir. Thank you, sir.
Yeah.
Sir, the app which you are showing, is there any plan to means like use it in other government hospitals other than
we
AIIMS?
already, I told you, this work I put it in the forum of the e-governance grievance area. It is competitive with across the India with many IIT, many people, many of the app, and including the COVID app. Our app come to the best one, which you are proved that we got recognized by award. Now, after the award, we got the letter that this app will be implemented across the India with all the government, district government hospital where the palliative clinic is working. Okay. Hope, yes, madam, you want? Okay, thank you, and wish you all the best. Yes.
Good afternoon, sir.
Yeah.
So my name is Sushma Tomar from RGNS College. Okay. Sorry, sir. So my question, so my question is कि how, so can I speaking in Hindi?
No problem, but
We
if
all
English
know-
more better, otherwise I can understand, no problem.
Cause we all know Hindi is our
You
mother
know, no
mother
issue.
language, so we can
Both
we-
you can speak.
Yes, we can more comfortable in Hindi.
Yeah,
So
yeah.
thank you, sir.
If I am interpreted wrongly, please tell me.
Yes, sir.
No issue.
So my question is कि जैसे हम एक नर्स से लेके एक नर्सिंग ऑफिसर तक का सफ़र कैसे तय करें, क्योंकि हमें उतना नहीं पता होता कि अभी तो मैं सब फर्स्ट ईयर स्टूडेंट हूँ फ्रॉम RGNS कॉलेज ग्वालियर. तो सर वो जो पेशेंट्स है सर, जो पेशेंट सर आप में है, जैसे आपके बोलने का तरीका, सिंप्लिसिटी, वो सर हम अपने अंदर कैसे डेवलप करें, और सर एज एक स्टूडेंट से एक सक्सेसफुल नर्सिंग ऑफिसर तक का सफर सर हम कैसे तय करें.
Very good, very good. Actually, this itself you are developed. How to prepare yourself, your intention is itself your first step you moved, because you are the first year.
Yes,
yes or no? Please try to understand one area very clearly, because still I am telling first year student when they join, they are not satisfied with nursing. Understand?
Yes, sir.
I missed out medicine, I missed out this, I come to know that. Please define, even I am the first male nursing in Tamil Nadu, first male graduate in Tamil Nadu, 30 years before 2000. I am telling you, I was thinking that to go out of the profession, because my family is very reputed, they put me this program, why I want to do. Because when I realized myself nursing is something different, I start to enjoy. What is the difference is, even you teach you fundamental everything, the realization is missing. What morning also they discussed, why you came to nursing. It's definitely you have very good scope, very good job, everything. But you should differentiate between care and the cure. Because everything we are doctor assistant, we are going to assist the doctor. But the care is the perspective that it is not from your program you are learning. You already learn from the family. But you are scientifically you are going to give as a care. Scientifically, with your skill, your knowledge, you are going to give the trust to the patient other than therapeutic. That what you have to prepare is one thing very, very important, your communication skills. The way you are talking with me, no, that is the most important, because I can able to see today all people who are really, wherever I'm seeing the way they're projecting. Yesterday I start from Vikas, how he came to me, the way he projected to me. This is most important. It is not language, nature, your personality, how you perceive other, how you communicate, how you accept everybody. That is the most important, that make you the better nurse. But learning will come continuously. Till death you have to learn, yes or no? Nothing can be stopped. Learning will be continuously. Please start with your communication. and learn very specific manner, very accurate manner. Don't like learn like whichever.
Sir,
Yes.
I think we all I would like to learn to you the way of speaking.
Yeah.
And sir, how much patience you have. Thank you, sir.
Thank you. All the best. I think a lot of questions. The question is there is a good something. Thank you.
Good afternoon, sir.
Yeah.
Myself Preeti from Birla Nursing College, Gwalior.
Very good.
Sir, my question is, if in future I want to be, I want to work as a nurse informatics, then is any additional qualification is needed for that apart from BSc Nursing or MSc Nursing?
Very good. See, when you are complete your BSc Nursing, you choose in the clinical area. First, I am telling you, don't go to teaching side. You work any hospital, either corporate, either any private, or maybe any government, wherever you are getting opportunity. Work for 2 years as a independent practice. Independent. You are have your own, stand, decisions, and provide your care, not depend on another nurse, not depend on anybody. Because you are student nurse, you depend. Something supervised by somebody. You will not get autonomy. When you become nurse, you learn. And learn all process in the hospital. Then 2 years, you decide what you want to work. You want in area and you want to role. You have maybe good communication skill. You are teaching skills. You next year you become MSc and do well. You are learning informatics. You are good. You learn as informatics. Today in government, all the corporate hospital, they have informatics system. You learn it. You can become good. And during the 2 year, you can add on. Somebody wanted to go to abroad. You can complete your all the language, all the licensure exam complete. That also huge wanted. I did not stop anybody going to outside country. Please understand. You decide as per your demand. Your future decided by you, not by anybody. But my thinking is, you are after some time, you learned, you do service, please come back to India and try to make the change. That's what I did. Today, I am economically very strong. See, I joined in AIMS Delhi. My first day I brought 6 lakhs rupees with without loan I took the car. Understand not? Even doctor joined with me, 90 people didn't take the car. I'm the first one who took the car. Because economically we sounded when you go other country. Empowered. No doubt about it. Your whole family is financially sounded. But after some time, please come back to India. Whatever you didn't get it, you try to get for your younger generation. Try to do for the, your nurses. That what I wanted to do, that I am doing. Till I am there, I will do. I will never stop it. Whatever manage, either I will teach, I will come and forum, I speak, I motivate, or something I do, I want to. Because we close the eye. Yes or no? We close the eye, nothing will happen. We have to open the eye, only then we can remove the eye. But you understand everyone? We open the eye, only then we can remove the eye. We become we. Because we have to grow.
So one more question, sir. Sir, do we need to have any technological qualification to work as a nurse?
See, now I am working online. I learned so many code, Python, so many today, IIT, IAM, so many, institute, national level institute. They are conducting 3 weeks, 2 weeks, 1 month courses, but not necessary now. I am telling about because you have lot of time to do that. Because now if you concentrate that one, you lose your academic. After you complete your BSc, you do that. And you also become manager, healthcare system manager. So many things future for if you learn this all, that will be good. Okay, all the best.
Thank you, sir.
Yeah.
लेकिन प्रॉब्लम ये है कि जब हम जैसे आपने दिखाया एम्स का सेटअप दिखाया 1800 बेड पे 4000 नर्सेस हैं. हमारा जो हॉस्पिटल है 1200 बेड का है जिस पे ओनली अभी 600 हुई हैं नर्सेस, लेकिन 200 नर्सेस ने काम किया है 1200 बेड पे. तो अगर ये तो हमारे लिए एक्स्ट्रा बर्डन हो गया. हम पेशेंट को जो हमारा वो प्रॉब्लम है कि हम साइकोलॉजिकल सपोर्ट नहीं दे पाते. जो प्राइमरी सेटअप है हमारा कि हम साइकोलॉजिकल सपोर्ट दें, मेडिसिन दें, इंडिविजुअल केयर करें, उसमें भी हमें प्रायोरिटी तय करनी पड़ती है. ऐसे में तो ये एक बर्डन आ जाएगा तो हम कैसे करेंगे. और सेकेंड भी एक और प्रॉब्लम थी, जैसे ये कोविड टाइम पर हमने 100 पेशेंट पे 2 नर्सेस, वर्क कर रही हैं। अब ऐसे में अगर और हम पर ये फिर ये क्या है, टेक्निकल वर्क आ जाता है, रिकॉर्ड रखना, और उस पर ये बात आ जाती है हम पेशेंट को देखें या ना देखें, रिकॉर्ड रखें, तो ये तो पेशेंट के लिए नाइंसाफी हो गई सर। तो बस यही बोलना था।
Okay, very good. It's actually, see, we, two things I told. First, challenges. We face everybody. Yes or no? Today I am standing is against the gravity. Yes or no? Against that itself challenge. So whatever we are lifing, standing itself challenge, we are against challenging. So life every time we are moving, we are doing everything, we are in the, we are doing best. 1 minute. So nurses are suffering, in future also will suffer. Okay? It is, please, it is why you and me suffer. We are not policy maker, please understand. Somebody writing our, decision. Somebody making policy for us. When nurses become policy maker, then you can ask me, I am the one responsible to do that. Either staff nurse ratio or cadre or whatever I am telling you, whatever nurses suffering, it is not today. 5 decades, 10 decades we are suffering. So this all not come by 1 minute by word, but I can only say, I am moving. Understand not? I am visualized. After COVID, I can say many people died in the war, same like died. But one thing what they did, all are given visible to the community. Many people died, but we don't want to somebody die for us, but still we are visible. Sometimes after COVID era, it is not only Gopichandran, not only you all, we are able to do better. Understand not? We are able to get. That's why motivation from community is the best one I can say. Don't get motivation from institution. Try to get motivation from community, society. That is the permanent, that is the one going to help you. Same like tomorrow they will tell nurses need to be policy maker. Okay, not with anybody. Second one, you are telling that what you are telling about ratio, no, your workload. See, we already proved. I told you, after cyber attack, nurses itself stumped. You don't know what to do. You understand not? This itself one of the example I am telling. The informatic will help more. Still there is a disadvantage. Still there is a lot of lacune, resistance. But whenever you see the best, the best which already we felt that is doing well. Understand? No. Please understand. Both are together. See, whatever you are doing only are data entering. You may not understand that. This we have all nurse informatic only making troubleshooting. Understand not? All nurses working in the ward, all nurses working patient care, all nurses without stopping any care. But instead of writing paper, like example, I have nurses wrote 5 line, I have to write daily same. Understand not? But no need to write, only you have to tick. So when I handover takeover, I am telling before, take 1 hour for handover takeover. You know that. Nurses sometimes night duty they take, now we are taking only 10-15 minutes. Because already they are added, they'll hand over to the iPad. Now I am working on iPad, which you hand over to the nurse. Even after go and sleep, they will call you. Now no need to call, because all are under E. No clarification for that anything they hand over to you. So advantage. Without advantage, and again patient satisfied, that's why we adapt this. Otherwise, we will not adapt. We will not invest money on the NIC. I think she didn't understand. See, informatic is not the prime, not the priority. Please understand. Your care is the priority. Informatic is the tool. No, I think she understood that. Huh? Oh, I have to talk in Hindi. No. If somebody want, you can translate. We used to call turn around time. You know, turn around time. Turn around time. You know, turn around time. I think she may not know the turn around time.
I understood your concern. What is your name? आपका नाम क्या है बेटा? Himanshu. What are you? You are a student or a staff? Actually, you are a student of BSc Nursing. Acha. Post basic BSc Nursing. Okay. You know what sir was trying to explain was that the ways to make the patient care efficient. The informatics is one of the ways, and this informatics can help you to save time, save cost, economy, patient care, and provide the patient care effectively. These are the ways and means. This is the innovation, using innovative techniques either for teaching or for administration or for direct patient care. These are the ways and approaches. But when you adopt, when you are talking about a resource, because we, as he said, we all have been working in resource constraints. I everywhere talk that whatever the nurses are doing, we all have the habit of working in resource constraint. जहाँ पे 10 nurses चाहिए, वहाँ पे हम एक nurse काम करते हैं, and we keep our mouth shut. Silently we are doing, we are dying and doing. That is the commitment and compassion and passion of the nurses. But ये system जब create आपके hospital में होगा, nobody will force you to do that, because this is a system. He has made a system, and he has made the system to accept what he has developed. You cannot develop anything on your own and then implement, and nobody will allow you to do that. He has done it, he has conceptualized, and he has conceptualized with the team, he has conceptualized with the management, the policy, who are the implementators. ये उन्होंने अकेले में तो innovation कर ली, बट आपने देखा नहीं सारी टीम दिखाई है उन्होंने. सो आपको कोई भी ये चीज़ें थ्रस्ट नहीं की जाती है. इट इज़ द सिस्टम. एम्स तो हमारा बहुत प्रीमियर इंस्टीट्यूशन है, पूरा कंट्री में है, पूरा इंटरनेशनली है. बट ये जब सिस्टम उसकी तरफ ट्यून्ड होगा, इंफॉर्मेटिक्स की तरफ होना भी चाहिए. ये सारी मैनेजमेंट करेगी. And we know that it cannot be done by ordinary people. It cannot be done by anybody who is taking care of one nurse taking care of 100 patients. ये मतलब ये enforcement नहीं है. He has taken the all people who are in charge of it, all people who supported implementation, but he has done the innovation, and he has taken the challenge, and he saw that it can be done in AIMS. If it cannot be done in other institution, but there is no way which is going to prevent you for doing any innovation. Suppose you have any innovation in mind, it is not that you can implement in your hospital. You can make it public if you have that much of interest. It is on the interest and motivation and patience. The implementation is only when the system allows you to do that. But independently and individually you can do anything, because आपके पास तो 24 घंटे मोबाइल होता है. You can see, if you can see the app, it can give you the idea कि कैसे किया जाता है. That can be there. But implementation is something different. It cannot be done in all the ordinary situations. For that, we have to create a system. Thank you.
हमने जैसे कि आज सर जो
But I
बताए,
am very happy. It is I never have this much interaction anywhere, because usually they are. That's a good.
जैसे हमने सुना कि कम्युनिकेशन एक
No,
माध्यम
I
है.
explained.
हाँ. तो मेरा क्वेश्चन ये था सर कि जैसे एक नर्स होती है जो कम्युनिकेशन, प्रैक्टिस और इक्विपमेंट के बीच में काम करती है. मुझे 14 साल हो गए हैं यहाँ पर काम करते, पर मैंने एक चीज़ को बहुत पर्सनली सोचा है ये चीज़ को, कि जब एक नर्स अलग अलग फील्ड में जब काम करती है तो अलग अलग इंस्ट्रूमेंट होते हैं. कई बार हमें नॉलेज नहीं होता उसे चलाने का, या हमें कोई कैटलॉग नहीं रहता है कि हम उसे पढ़ के हम समझ सकें या सीख सकें. और ऐसा कभी इमरजेंसी आ जाता है, जैसे कि आईसीयू हो गया, एक्सीडेंटल केसेस आ गए, इमरजेंसी कैजुअलिटी हो गई, तो कई इंस्ट्रूमेंट वहाँ पर होते हैं. ईसीजी मशीन हो गई, वेंटिलेटर हो गया, बहुत सारे इक्विपमेंट्स होते हैं जिसका हमें नॉलेज नहीं रहता, पर एट द टाइम हमें उसको यूज़ करना होता है पेशेंट सेफ्टी के लिए, है ना. तो मेरा ऐसा क्वेश्चन था कि हमें या तो उस चीज़ का नॉलेज या हमें ट्रेनिंग दिया जाए, ताकि जो इक्विपमेंट हम यूज़ कर रहे हैं पेशेंट के ऊपर, उसका प्रॉपर हमें एडवांटेज, डिसएडवांटेज और उसको प्रॉपर चलाना हमें आना चाहिए. क्योंकि जब इमरजेंसी आती है ना, तो हमें डॉक्टर का भी वेट नहीं करना पड़ता है. अगर जैसे एक इमरजेंसी कोई आई और रिससिटेशन करना है उस पेशेंट को, तो या तो एज़ पर डॉक्टर ऑर्डर के हिसाब से एक नर्स चलती है, पर प्राइमरी प्रायोरिटी वहाँ पर वो है कि हमें पेशेंट को सेव करना है, बचाना है उसको पेशेंट को, तो हम तो डॉक्टर का वेट नहीं करेंगे। तो हमें भी एक ऐसा गाइडलाइन होना चाहिए कि एट द टाइम हम CPR दे सकें, डिफैब्रिलेटर यूज़ कर सकें, ऐसी ड्रग्स यूज़ कर सकें उसके ऊपर जो उसकी लाइफ को सेव कर सके। तो मेरा क्वेश्चन ये था कि हमें इक्विपमेंट नॉलेज के लिए प्रॉपर जो भी हम यूज़ करते हैं सामान, उसका हमें या तो नॉलेज या हमें ट्रेनिंग दे, ताकि हम टाइम बिना वेस्ट किए पेशेंट का प्रायोरिटी लाइफ सेव करें। ये मेरा क्वेश्चन है
So
सर।
your question already answer also. You know, okay, your question itself answer, but that is our vision. See, we nurses have KSA, knowledge, attitude and
नहीं,
practice.
क्योंकि सर मैं ICU में रहती हूँ,
नहीं,
मैं
I-
7 साल से वहाँ काम करती, जब इमरजेंसी आता है ना तो वहाँ पर डिफैब्रिलेटर भी चलाना
No,
नहीं
no,
आता,
no,
डॉक्टर्स
no.
को भी, हमें भी नहीं
No, no,
आता।
please understand.
हाँ, हाँ।
If you are trained in very good institution, from the student period, like you know, you come to AIMS, you come to some of the institution, because I never go other institution, I don't know how the training happening. If you trained very well, you become very, you know, very experts in the student itself. Some of the student not exposing the patient, not exposing, then they go, they find difficult. So that training in INC, you go and see the practical more hour than theory.
क्योंकि सर अभी तो टेक्निकल नॉलेज और डेवलप
No,
होगा।
no, that's what I'm telling you. You need
हाँ।
training. You need training more.
ओके सर, ओके, थैंक यू सर।
देखिए आपका जो क्वेश्चन था, ये जो प्रॉब्लम है वो क्यों आ रही है कि कई इंस्टीट्यूशन से जो निकलते हैं स्टूडेंट्स, उनको वो चीज़ें नहीं दिखाई जाती, जैसे इंस्ट्रूमेंट्स, वो चीज़ें, तो उसकी वजह से ये डिफिशेंसी आती है। और अचानक से उनको ऐसा हॉस्पिटल मिल जाए जहाँ पर वो चीज़ अवेलेबल है जो उन्होंने स्टूडेंट लाइफ में नहीं देखी, तो इसके लिए मैं आपको खुशी होगी कि NTI इस पे वर्क कर रहा है। वी आर स्टार्टिंग ए ओरिएंटेशन प्रोग्राम ऑफ इंस्ट्रूमेंटल एंड टूल्स, हाउ टू यूज द ऐप एंड ऑल द थिंग्स, जो आपको सभी स्टूडेंट्स को काम आएगा। शॉर्टली वी विल स्टार्ट दिस थिंग बाय थ्रू NTI। थैंक यू।
Good afternoon, sir.
Okay, one
Sir-
more questions to come. Okay.
Sir, good afternoon. Myself, Ronak Kumar. I from Auditorium Nursing College, Gwalior. Sir, nowadays
I would
am
request the
very
participants
confused,
and
sir.
faculty members to please silent so that he could ask the
Sir,
question.
Really,
Please.
nowadays I am very confused in this profession, sir, because that I want to choose best professions in teaching and clinical practice, sir. Sir, because so many persons told me that clinicals are very good, ठीक है, और मतलब जो ये टीचिंग प्रोफेशंस है ना, उतना कहीं ना कहीं उससे ज़्यादा अच्छा ये क्लिनिकल्स है। बट हम सर ये टीचिंग फील्ड में जाना चाह रहा है, तो खुद को कैसे इम्प्रूव करें सर उस लाइक के लिए, और खुद में अपने आप में पैसेंस कैसे मतलब बना के रखें, ठीक
See,
है,
these
आगे
all,
तक।
see, your teaching, your clinical, all are role only. Your profession will be
जी
same.
सर,
Your profession will be same, you are nurse.
जी सर, जी
But you, role is different. You are teacher, you are, you know, only you have to develop your skills. Even you are want to become teacher, you should
Yes,
be expert as a nurse in the clinical area. Understand? That only you will able to teach.
Yes, sir, yes, sir.
Nobody will teach you only the subject content. Okay, exactly what she was asking. Sir, don't know
Yes,
the
sir.
instrument how to use, then you know, they have no knowledge. Nowadays, we expecting, even madam is dean of the SGT University. She want recruit you, she will see your background, how she can able to demonstrate.
Yes,
So
sir.
need today, don't take the wrong, you know, career
Yes, sir, yes, sir.
and decide wrongly. Please, after your RN, RM, work in the clinical 2 years. One reputed institution where you get good exposure, even you missed out your training in the school, college, not well. Go to the institution, work. After that, your skill is good in teaching, good
Yes,
in
sir.
leadership quality, your career good in that. Otherwise, we expected ANP will come soon, advanced nurse practitioner. That for me, I wanted to expect that our vision, advanced nurse practitioner is the best one as compared to anyone, because you independently practice at your own place and you get very good money, very good respect everywhere. That's what our vision. That what
Okay,
we
thank
want
you,
actually.
sir.
Okay,
Now
thank
the
you so much,
question
sir.
answer session is over. No more supplementary questions,
But
please.
without your clinical knowledge, you cannot become improvised.
Thank you, sir, for the energetic and motivational address and very informative session. What a wonderful scientific session it was. And now, I kindly request Dr. Biren Singh Chaudhary sir to applaud Dr. L. Gopi Chandran sir by presenting him with a memento and the welcome garland. Please come on the stage, Dr. Biren Singh Chaudhary sir and Dr. L. Gopi Chandran sir. Please keep the memento ready. Yes. Thank you, sir. I would also call Professor Gaurav Kumar Tamoli, sir, a State Treasurer, MP, NTAI, to present a memento to the Chairperson, Dr. Biren Singh Chaudhary, sir. I welcome Professor Gaurav Kumar Tamoli, sir, to present a welcome garland and memento to Biren Singh Chaudhary, sir. And hereby we complete the second scientific session.
Cake cutting ceremony, an event which is successfully is celebrated. Every individual present here has contributed in making this conference successful and memorable. We salute your energy and patience. Now it gives me immense pleasure to request all the dignitaries and delegates to preside their presence in the cake cutting ceremony. On the 5th Foundation Day of Nursing Teachers Association of India.
Now we will have the cake cutting ceremony. After that we will have the lunch. You have been waiting for the lunch. After the cake ceremony there will be lunch. I request all the dignitaries to come on the stage to participate in the cake ceremony. It will take 5 minutes. I request all the dignitaries to grace the stage with their presence for the cake cutting ceremony. Please prepare the cake on the table, my dear friends. I would like to have all the dignitaries and special guests to have on stage for the cake cutting ceremony. We are celebrating the 5th Foundation Day of Nursing Teachers Association of India to the International Conference 2023, which is being introduced by the NTAI in collaboration of PG College of Nursing and Cancer Hospital Research Institute. Now we have all the guests on the stage to take part in cake cutting ceremony. Yes, please don't hesitate to share the cakes as we have celebrating the successful International Conference 2023. We are having the photo session of the cake cutting ceremony. After that, we will have the lunch break. Now I request all of you to have their lunch. After the lunch break, we will have the third scientific session. We will be glad to have your presence. Don't go anywhere. Meet me soon. Be with us. Thank you. After the lunch break, there will be third scientific session.
दी दीदी? हैं?
Hope you have a wonderful lunch. We are starting the third scientific session in a very short while. Please take your respected seats, all the participants, faculties members, principals of different colleges. I request to have your seats, all the participants, faculties, and the principals and the dignitaries. We will start the third scientific session in a very short while. Thank you. Welcome back, ladies and gentlemen, and my dear friends. This conference is gaining new heights through one after one excellent scientific sessions by our delegates, and we can't wait to start the next session with the same excitement, with the same energy. Please take your seats, ladies and gentlemen, my dear participants. Now let me delightfully invite on the podium Professor Poonam Thakur ma'am, National Treasurer of NTAI, to proceed the third scientific session. Please come on the stage, ma'am. Professor Poonam Thakur, ma'am. Put your hands together for Professor Poonam Thakur.
A very good afternoon to one and all. Those who are presented over here in this auditorium, hope you have enjoyed your lunch. And how's the Josh? Khana khaya sabne? So how the Josh? High. It should be high. है ना? So put your hands together for this wonderful conference you are just witnessing today. Thank you so much. Myself, Poonam Thakur, National Treasurer from the Nursing Teachers Association of India, working as Associate Professor at the Academy of Nursing Sciences and Hospital Gwalior. And today I'm very much privileged to propose the introduction of one of the legendary in nursing fraternity, and that is none other than Dr. Professor Pitikol Madam. And I hope all of you know about Madam. And it will be like Gagar mein Sagar Bharna. Madam is having lot of achievements, lot of credits, lot of awards. But I hope it cannot be possible within 5 minutes or done. But then also I would like to discuss a brief intro regarding Pitikol ma'am. So starting with the qualification, Madam has done her PhD from Jamia Millia Islamia University, New Delhi in 2004. Postgraduate diploma in distance education, IGNOU. And I must say, for distance education, she is known for that. If we talk about IGNOU, then Pitikol Madam is always there. So she is the leader in the distance education. I can say the pioneer in India. MSc Nursing Madam has done from RAK College of Nursing, one of the famous and first college in the India as well, in 1988. MA in Public Administration from Punjab University, Chandigarh in 1984. And Bachelor's of Nursing from PGI Chandigarh, Punjab University in 1982. Madam is having more than 40 years of experience, in which she include the distance learning experience from the IGNOU University, that is approximately 30 years Madam has worked over there, and Madam have been the former director in IGNOU University for all the distance courses, distance modules. Currently Madam is working as the Dean of SGT University, Gurugram. I hope those who have attended the simulation modules in SGT University, they have known very well. If we talk about the awards, Madam has received National Presidential Award, that is National Florence Nightingale Award in 2017 by the Honorable President of India. Award of Appreciation by AICTE, Lifetime Achievement Award by Nursing Scholars Society of India, and number of awards has been appreciated to ma'am for her dedicated work towards the nursing profession. Madam has taken various of the research projects on her own, as I told. Moreover, the 15 nursing research scholars, Madam has been guided them successfully. Madam is having the variety of nature of experience, like planning, development, implementation of the various programs in distance education, especially. Madam has the membership in various professional bodies, like that lifetime member of Nursing Teachers Association of India. Madam is the president from Delhi State Branch for NTI, life member of Nursing Scholar Society, life member of Trained Nursing Association, and life member of Nursing Research Society of India, life member of National Neonatology Forum, and many more as well. Madam has represented many of the professional bodies. I would like to mention Madam has been the honorary president for Pediatric and Neonatal Nurses Forum from 2018 till date. Madam has been the Secretary General for Nursing Research Society from 2014 until date. Madam has been the resource person for various eminent conferences, webinars, seminars, has chaired many of the panel discussions as well. Madam has encountered various publications. One of the publication I would like to mention because I personally liked a lot. Madam is having textbook of nursing research and stat for BSc nursing students, and in 2021 it was published under JP Publications. She has released information handbook on Nursing Society of Indian Nursing Research in 2012 as well. Lot of chapter publications are there, contributions are there, lot of journal contributions are there. Next slide. So with this wholeheartedly, I would like to welcome Professor Dr. Pitikol ma'am on the stage to continue with her presentation. Please put your hand together for Pitikol ma'am.
This one laptop है ना
I will create the slides for you. You can say just
I cannot
you can also do it. You want to do it?
हाँ
It will be in short, no? Within 5 minutes I will arrange.
नहीं वो नहीं मेरे को लैपटॉप चाहिए हाँ अच्छा चलो नहीं नहीं मुझे देखने से होगा ना नहीं चलो फिर रहने दो कोई नहीं ओके लेट इट नो प्रॉब्लम हाँ कोई बात नहीं A very good afternoon to all of you. At the outset, let me express my immense gratitude to the organizers of this conference, the President, Secretary and Treasurer and whole team of NTAI who gave me the opportunity to interact with you. I'm sure that you all will be having the effect of your lunch and you will be wanting to go back. So I will not focus on innovations and innovations. You have lot of innovations in the morning session. I will just take you to the classroom. So having said that, I want you to be I want you to be open to discuss anything in between or after. No problem, we can have an interactive session, because the session which has been allotted to me is a very general session, but I would try to correlate it with what innovations we can have. So the theme of this conference is innovation in nursing, key to progress in universal health coverage. So the main focus is health, universal health coverage. So how this health coverage word has come into existence? Universal health coverage. Where from does it came? Where from it has come? Anybody can tell me? ये कहाँ से आया? Universal health coverage कहाँ से आया? Anybody can tell? ये क्यों रखा गया? Why innovations to achieve the universal health coverage? ये कहाँ से आ गया? Can anybody tell? What is SDG? SDG क्या होता है? SDG means Sustainable Development Goals. So we all know that the government of India from time to time has done lot of efforts to make the healthy society. For so many programs have been developed. If we talk from ages, there was family planning program, there was safe motherhood, child survival and safe motherhood programs. There were programs of nutrition. So many programs were there, which were also followed by reproductive and child health. In 2005, that was followed by reproductive and child health 2, and then RMNCH-A, which included reproductive, maternal, newborn, child health, and also the adolescent health. And later on we had, we had health for all by 2000 AD. That also the targets were filled, but unfortunately we could not fill up the targets. Then came the MDG, Millennium Development Goals, where also the targets are fulfilled. But during all these programs, there had been the various targets and objectives have been placed, and the progress had been monitored from time to time. So what happened? This the MDG goal, there was a great, in all these programs, there a lot of success has been achieved by the efforts of the government of India from time to time by implementing these schemes, by implementing the national health programs, maybe the programs for communicable disease, maybe the programs from non-communicable disease, which are on rise. But recently in 2015, after the MDG, Millennium Development Goals, were the time period was over, than the government, the UN, this is the UN declaration, United Nations declaration, SDG goals were developed. Out of that SDG goals, the health goal, goal 3, there are 17 SDG goals, sustainable development goals, and goal 3 relates to health and well-being. So how to achieve this health and well-being? Therefore, the aim of these goal 3 SDG, that was the aim of health is the universal health coverage. So how can we universally, unless and until we reach each and every human being? We may develop so many programs, we may implement so many schemes, unless and until we reach to the grassroots level, we will not be able to implement all the plans and programs of government. So we have to reach. And how did this come into being? That is how the focus was on community health officers, as was told in the morning. That is why under the Ayushman Bharat scheme, there were 2 parts of the Ayushman Bharat scheme. One was upgrading of all existing sub-centers to the health and wellness centers all over the country. And initially, the target was upgrading 150,000 sub-centers into health and wellness centers. Then the second part of it was that create a human workforce, mainly the nurses, create a manpower there at health and wellness centers, which are the upgraded sub-centers at the grassroots level, and give this person a training of 6 months, so that empower that person who is mainly the nursing person. Initially it was thought of only BSc nurses, but later on it became to the GNM nurses also, and later on the Ayurveda practitioners were also included in this training. And we had been training, and we developed a project based model where we trained all over the country, and later on the government of India also gave the responsibility of the training to the health universities also, in order to fulfill the targets, because by the last 2012 year and they had to complete 1,50,000. So they additionally, the IGNU took a major challenge in beginning and creating achieving the target of government of India, but then the government also had to supplement it with the programs, and some face-to-face program is also going on. So this worker is expected to have the lot of autonomy, have to not to prescribe, but she has to dispense the drugs. The follow-up, the management of the non-communicable disease is the major focus, because the non-communicable disease has been now a threat more than the communicable disease. And these SDG goals, the focus we said has the universal health coverage. In addition, the focus is also on to end the tuberculosis, AIDS, malaria, and other health problems. That is the goal, and this is going, there are various targets, maybe infant mortality rate, maternal mortality rate, all those targets have been fixed. By 2030 the government of India has to fulfill those targets what have been put on the national health indicators. So this is the background how universal health coverage is very important, and how can we achieve that? That has to, because unless and until we work at grassroots level, because 80% of our population, more than 80% of the population is at rural area, which can be managed. Many of these 80% diseases, 80% of the health problems can be managed at that level, and the nurses have a great potential to fulfill that requirement, to fulfill the objective of government of India. Because all those things, if these people who are at the grassroots level, if they go to the secondary health facilities, there is overcrowding, and then the health care which is provided to at that secondary level does not reach to the needy people. The primary level conditions are to be treated at that level. Therefore this was thought that these improved health and wellness centers, the upgraded sub-centers, these nurses or community health officers will be posted, and they can be the facility for the referral and the follow-up. The major function was the dispensing, drug dispensing, assessment, management, and mainly the follow-up and the referral, so that the secondary health facilities will be relieved of the burden of seeing the patients, because only 10 to 15% of the patients will require secondary and tertiary health care. So that is how we can have the out-of-pocket expenditure. Then Ayushman Bharat, under Ayushman Bharat, the health insurance of 5 lakh is also given. So these are basically given in order to have the health coverage. So if we go to the topic of today, that is, what is that? The topic is facing challenges in nursing and arising new era in nursing. The facing challenge in nursing, all of you know, all of us who are sitting here, I think most of the students, when they were talking in the previous Dr. Gopi Chandran's session, when they were talking about many things which were related to my topic. So this is a very simple topic, that what are the challenges. But when I was seeing towards this topic, I was taking a perspective that why these challenges is going to help into the, why the Nurse Teachers Association has taken this topic. The thing is that we need to sensitize teachers that when they are teaching to the students, so they should have they should have these things in their mind so that they can sensitize that even if we talk many things in the classroom, but when they were saying that when we go to the actual field working, there's a wide gap between what we learn in the classroom and what we actually do in the practical. So they have to be sensitized, they have to be informed properly that these are the challenges which could be faced by you when you go to the clinical area. So because the nurses have the potential of revolutionizing the healthcare, I say that because nurses are a huge workforce all over the country and also globally. We have around 27 million nurses globally, and around 34 million nurses are there in India only. So you can imagine how huge workforce of nursing is there in India. And this workforce is day in and day out understanding what is the delivery system, what are the lacuna in the delivery system, healthcare delivery system of the country, and how the patients and the nurses and everybody have to face the good healthcare or the not a good healthcare. So they are thinking aloud that how can we meet these criteria where we can have the quality care, that what is that which will help us to take the quality care. So we say that nurses is the WHO also has estimated that there is a need of 9 million more nurses by 2030. Since we are talking about the SDG goals, so I am talking that by 2030 we will need more 9 million of nurse and midwives globally. And in India alone we will require 4.3 million nurses by 2024 only. This is also a norm by the WHO. Nurses are facing many challenges in this complex healthcare environment, and you also perform variety of roles. So what are these roles? I think this is a different slide. This is not the one which I had prepared. मैंने दूसरा वाला दिया था. हाँ? आपके पास ये आया? तो आप लगा सकते हो दूसरा वाला. मेरा वो है उधर. This one is there. You can put, I can say this also. I'll take that one only. First I will take this one, third slide. I had sent the revised slide also. So if we talk of the general roles which are care provider, we nurses are care providers. We all know that we are educators, we are advocates, we are managers, we are collaborators, we are leaders, and we are researchers. So these are the common roles of the nurses. These are the general roles of nurses which we have to perform in any healthcare setting. But it's not only that. You have to also, in the current scenario, in the current healthcare delivery system, and in the modern times, you have to also provide or perform extended roles. And what are those extended roles? In addition to clubbed with those general roles, you have to provide preventive care, you have to provide rehabilitative care, has been already discussed, curative care, it was discussed in the first session, and then health promotion. Then the most important is the expanded role. You are going to play, the young generation is now going to play an extended role. And what is that extended role you are going to play? Now we are talking about the genetics, genomics, all those things are coming in the nursing also. That's very, very important. The nurse informatics has already been discussed in a great detail by Dr. Gopi Chandran. And you have also surgery nurses are separate, navigator nurses are there, entrepreneur nurses are there, nurse clinicians are there, nurse specialists are there, there are nurse practitioners which have come up in India. In India also the nurse practitioner has come, the clinical nurse practitioner is there, and the critical care nurse and the midwifery nurse practitioner have already been launched in India also. And similarly you have the nurse practitioners, nurse clinicians, and nurse specialists in all the areas. But few is advanced nurse. These are the advanced nursing programs. In addition to that, genetics and so on. If we go to the challenges, I think I had a different slide. Okay, I'll read. If we go to the challenges you will have, all of you know, the challenges are in the workplace challenge, and there could be mental violence, there could be lack of synchronicity, there could be non-nursing roles, there could be shortage of staff, there could be workplace health hazards, there could be long working hours, lack of recognition. And how can you meet these challenges? You have to have positive practice environment, you will have to have developed the teamwork, you will have to develop workload balance among yourselves as the leaders, and you will have to focus on evidence-based practice, you will have to close the gap between service and education, and you have to have the policy on recruitment and retention policy. If we talk about the working conditions, what are the factors which will affect the working conditions? You know, all of us are aware, as the student of post-basic BSc nursing was already telling, madam, there is so much of inadequacy of the staff. So you have to face this challenge when you are going to the workplace. The nurse-patient ratios are really very low in all the hospitals all over the country. Even if we talk about the AIIMS, such a premier institutions, now many AIIMS have come into existence. Everywhere there is a shortage of staff. Everywhere the nurse-patient ratio, in general, you must say that as per WHO, we have only 1.9 per 1,000 population as the nurse-patient ratio. It is very, very low, and we are required 1.3 to 1.4 is required. Then, as you were already telling that you have to do right intake, output chart, nurses history, audit, many things. So a lot of documentation is there. That is a challenge which our nurses are going to face. And then what can we do for it? What does it result? These type of the working conditions, what that is result in? It results in burnout and fatigue. You are the dilemma. You know what to do and what not to do. Because there are resources are restricted, you have a ethical dilemma to face, that under what restricted resources what I have to do. And then automatically the quality of nursing care will go down. The shortage of staff has been a very, very long lasting problem, even though many posts in the government sector itself are lying vacant for many 20, 30, 40 years now, and till now they are not being filled, and not to talk of private institutions who just make up the shortest and less paid nurses and give them more responsibility. Why there is a shortage? Because most of the nurses are retiring, and then because of COVID effect, many of the people have left the job. The educators, there is scarcity of educators also. Sometimes bright nurses, when they enter into the nursing, they leave this, and then when the population, you know, we are highest populous country, and the population is again growing, and then when the population is growing, naturally the nurse population ratio increases, and because of growing population there is shortage of staff, and mostly now the good nurses, talented nurses are migrating from the India. And what is the impact of this migration? You know, it's not that the nurses are going to abroad. The impact is very, 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 very prominent, but it affects the whole healthcare system. If from one place, or if from one institution, or if from one state, or if from one country the nurses migrate, so you can see what is the impact of that migration, because our skilled manpower, the cream of the country, leaves the institution, and then when the skilled staff leaves the institution, there is a decline. And then what happens then? When there is a decline of the skilled staff, the manpower, in terms of the nursing manpower, what happens? There is a migration from rural to urban area, and from urban area the nurses go to the specialized units, and then what happens? The rural area becomes the staff becomes less in the rural areas, and then it affects the quality of nursing as a whole. So where can we talk about the quality improvement? We cannot talk about the quality improvement under these situations, but we have to be good managers to manage within the limited resources. Then the nurses have to face the workplace health hazards. You all know that there could be the skin infections, there could be needle stick injury, there could be exposure to blood-borne pathogens, there could be musculoskeletal pain, there could be work-related illnesses, because when you are stressed, you will have more problems. Then there could be also the occupational hazards, respiratory problems, and stress and overwork, you already know. The workplace violence has been one of the important and one of the very serious impact on nursing itself, because the workplace violence has been found in many studies abroad and in India also, that there is workplace violence not only from the patients, but from the patient's relatives, patients' caregivers, and also the healthcare providers also. There is a violence, and not only that, there is also the physical, mental, and social violence, verbal violence with the nurses day in and day out. You are seeing, for women in general and nurses in particular, lot of workplace violence is there. And then if we go to the data, we say that around 42.30% are the violence is from the patient's relatives, 5% is from patients, and 21% is from healthcare providers. What are the challenges in the hospital when you get trained in the educational institution and you go to the hospital? You feel that if you are a head nurse, or you are a sister in charge, or if you are a ANS, you will feel that a lot of staff, they remain absent from the duties. That is absenteeism, too many responsibilities, and you don't get the recognition. Then the most important challenge in the current times is disconnect between the clinical nurses and teachers. So college faculty also trains, and when the students are posted into the clinical area, what happens? They also train. So there is no collaboration and communication between the teaching faculty and between the hospital staff, because in hospital you have to learn clinical area, and in the classroom you have to learn from the teachers the theory. So there is wide gap between, and the disconnect between the teachers and the hospital staff, and that for this effect is the comprehensive clinical training, when there is disconnect between the teachers and the hospital staff. You also have, when we work in the clinical areas, you have a lack of autonomy, because you are expected to do, as in the morning Dr. Gopi was saying, you have to do this, you have to do that, you have to do that. At certain point of time, when this is not possible, you lack autonomy, because unless and until you have autonomy, the responsibility will not have any meaning, because when you will not be responsible for the patient care, or when you will not be responsible for the patient's problems, you will not be able to decide, then the quality is a big question. So what autonomy, how does it affect? What autonomy you should have towards the patient? It should have, you need to respect the person's right to autonomy. You have to avoid the prejudging. The communication ability, whatever you have to communicate, you should have the autonomy to communicate with the patients regarding his treatment, regarding his care, and regarding his prognosis. But that also you do not have total autonomy unless and until you work with the physician, or you work with the sister in charge there. Then you also should have balance between the rights and also the risks of the patient's responsibility. So once there is autonomy, you have to have the responsibility, but this autonomy is not there. So you will have to take the patients as the patients are, and you have to support the patients. Not only your autonomy, but the patients should also the autonomy to speak. That you have to facilitate, that you have to support. The electronic, as you were talking, you were frightened when Dr. Gopi Chandran was presenting. You were so much frightened that what will happen, how can we do, we have a lot of work to do. So that is really challenge, and that is why I was so happy to see the questioning of that particular student of post basic BSc nursing, that I was thinking that she's this my whole thing she is saying, whatever I was expected to present during this presentation, she was telling, and she had the concern, and that is really a big challenge. Electronic health records is a big challenge for all of us. So electronic health record related challenges are very important. But if you follow the electronic health record system, you will have technical problems, you will have patients poor understanding, you will have uncomfortable feeling when you use a device. Whenever you are using a device, everybody is not technically savvy. All of us are not. Even he was saying that older people are not a technical saving. But we have, if we want to work with the youngsters, we also have to learn, or otherwise we have to quit the job. But among you also, even if you have the mobile savies, you are the technical savies, but still there is a problem. There is always a technical problem, and then many of us are feeling uncomfortable by using the device. But there is a strategy which can help you, that if you face such a type of challenge, you can just keep aside the documenting side by side. You may put it on a paper, and then later on, when you have some time, you can do it. Then you can also explain the patients what do you expect from them, how should they speak, how can you collect the data from them, and then you can document the later time. Then what are the work related challenges you have? You hectic, you see she says that we have only 100 patients and 2 nurses were there. So that is the hectic conditions of the work, as well as you have the problems at home. The patients have so many problems at the homes. There is time pressure, there is emergency situations, and these things you can manage. Suppose you are asked to do the electronic health records, so you can manage to keep aside, and then when you have free time, you can do it, because you may not be able to provide care and do recording and do everything together. That is not possible for anybody, but then you have to manage the time. Then another is the patient related challenge, that you have patients has such a medical condition that you have to attend to him. Even if you have no time, but you have to attend to him. Despite every busy schedule you have in the hospital, in the ward, but you have to attend the patient's condition. That is a big challenge you have to attend, because the patient does not know. Even if the patient has simple things, he will have so much of confusion, and he will have so much of questions in his mind that about his health condition, because he doesn't have the literacy of that. So he has. And the other important challenge is that there is a information explosion. The patients are more informative than all of us, so we have to also address. So that becomes a challenge. So what we can do, and in such situation, that's why we are saying that participatory management is a very important thing. So you can involve the family members, you can involve the caregivers, and you can communicate patients. If you communicate, behavior change communication comes, because we all communicate, but communication has to be behavior change communication. Because if you just say a word to the patient, half of his agony, half of his pain is over. Then electronic medical records, doctor will say you, अभी तो sister का हम कहते हैं कि they should not use the word sister. Why should they? You are a nursing officer, they can call you by name. But if they say, somebody will tell you, आपको तो billing करना है, आपको scanned copy of report उसको देना है, you have to fill up the digital templates, you have to do something, you have to write with the hand, something you have to do networking, send this patient to that place, but that has to be sent through all electronically. So electronic everything, you have to be very well versed with the technology, because in today's world, in today's situation, in today's environment, in today's technological environment, you have to learn this. But this creates a tension in you, because at the same time you fill your own records, and at the same time you have to fill the medical records, you have to take the discussions, you have to take progress notes, and you have to also respond to the external. Suppose some referral comes, you have to respond to that also. Suppose x-rays are done, suppose reports are coming, everything you have to do, you have to fill and scan the copies, and you have to use the technology, because most of the hospitals are having this type of technology in this thing. Also, that becomes the biggest challenge mainly for the novice people who come from one place to another place. They become novice to that situation, so that becomes a great challenge. And doing all those things, even if you try to manage all these things, even then you are not appreciated. The recognition is not there. Fault finding is there. You know how much the world came to know that mainly the Indian nurses, in India, the people came to know that what is the importance of nurses. Really, the COVID was a very drastic, which really threatened the lives of so many people. But it was the impact of it was that they could realize that nursing are the important workforce. Without the nursing, the healthcare system cannot progress. And it is because of when we see the small case studies, or when we see the small stories of foreign nurses and also Indian nurses, that you can yourself imagine that nobody taught nurses. They used themselves the innovative techniques. They created the work environment for the patients in such a way that they became the leaders of the management of the care. So even though they had no authority, but the COVID taught them the management of the patients. The COVID taught them the innovation, because they use their mental faculties. How can we address the needs of this patient? Because in resource constraints, you had so much ethical dilemma there, because there were very, very low PPEs, masks were not there, and then you had an ethical dilemma, whether I should take care of this patient or that patient, whether I should give mask to this patient or that patient, whether I should give head shield to this patient. So that was a lot of ethical dilemma, but you managed. And based on those case studies, when I saw the ICN stories, when during the Nurses' Day they had released those case studies, and many of the countries have invested in nursing. That is how the ICN had put the theme during this 2022 Nurses' Day, that they must invest in nursing. And many of the countries invested in nursing. They increased the budgets of nursing based on that. But mostly, even the lesson was given to them, but still they are lacking behind. There is lack of recognition and appreciation for nurses. What are the perceptions of the working environment from the different sources? They say that there is this is the perception of the people. This has been, but this perception may not be correct. There is a poor skill mix. There are low patient staff ratio, that is correct. The reduced physical resources are there. These are general. Lack of environment, lack of involvement in decision. This is an important issue, because you are not even in the morning session also they were saying that whenever till the time we are not involved in policy making decisions, we are not going to make any dent in nursing. Even though the healthcare system will not progress without the nursing, but unless and until we are involved in policy making. But you people, you are youngsters, you have more information than all of us. When I go to the classes of the teachers, to the students now, I tell them that you are at advantage, because you can just click the mobile and find whole information before us. And teacher has to think twice before going to your class, because she may be flooded with so many questions, because you will have more knowledge than the teacher when the teacher goes to the class. So make the teacher make the teacher to work so hard, so that she can face you, because today's teachers will not be able to face the students, because students have more information. They have a more information exposure, and they can just click the key, and then they find everything what is not known to the teacher even. So lack of involvement in decision making. Constant change is there in healthcare system, the healthcare technology, the equipments, everything is changing, the disease pattern, the treatment technologies are changing. And then there is also the patients have more expectations from you. So you have to address to the expectations of the patient. So there are issues of shifts, leave, and so on. And this leads to the heavy workload, stress, feeling undervalued, low morale, disempowerment, dissatisfaction, burnout, poor quality, and all these are the results. And then nurses also feel that why should they work? They have the limited career options. They have poor staff support. The recognition is not there, and the attitude of the staff is not there. When you are overburdened, naturally the attitude is likely to change. Then this is the biggest challenge. the government has there has been a change in the government system. There is always change. There is a pay commission, but this does not happen in the private institutions. The private institutions expect big of nurses, but they give very little. So the payment scale is still very low as compared to the other professions. Maybe it is in the government in its own way and in the private sector in its own way. These housing facilities, the transportation are still not being given for the nurses. They give 10,000, pay 20,000, 25,000, 30,000, out of which 5,000, 6,000, 10,000 they have to pay for the accommodation, and rest on the transportation. And what is the balance? What will they eat? That nobody realizes. That the time has come that one has to realize, and that is why we are not able to retain. There is a lot of immigration is there. The most important stress, that is moral distress. You know, when you are working in the ward, there is a moral dilemma, there is a moral uncertainty, moral residue, emotional distress. Why? Because why these nurses are feeling emotional distress, or they are feeling moral injury? You know, this has come into existence during the COVID times. As I was already speaking, that due to lack of resources, we were not able to meet the needs, because oxygen cylinders were very less. The all the instruments which were to be used in the patient care, they were very limited. Even sanitizers were not there, the PPEs were not there, masks were not there. So we had to decide where to give. So that created a moral and mental imbalance in all the nurses, that how to do it, but they came out of it. They came because of their the analytical thinking. Then the other biggest challenge is teaching strategies. You know, the classroom teacher comes in the classroom and she may use variety of teaching techniques. There are many teaching technologies, and you've become at loss to realize that which is the one which I should use. So that becomes the biggest challenge, to identify which of the technology is feasible to be used in what situation. So there could be Facebook, there could be Google, there could be YouTube, and there could be all other different types of teaching technologies which poses a great challenge to the teachers and as well as to the students also. So what is the need of the hour? Need of the hour is to bridge the gap between the education and technology. So when we are using the technology in the classroom, we have to make the assessment, we have to analyze the situation, that what is the feasible technology we can use, we can handle, which topic can be handled with what technology. So student teacher interaction and quality learning environment, there's a need of bridging the gap between these two. So what are the education innovations? You know, in the earlier times, the teacher would come and I would take a class and then go back, and the student would think that whatever the teacher has said, it is all okay. But as I told you in my earlier words, that today's student is a great challenge for the teachers. The students think big. They don't have to be in the four walls of the classroom. They have to be, as they were in the morning, we are saying that you have to be navigating nurses, you have to be nurse specialist, you have to be entrepreneurial nurses, you have to be nurse practitioners, nurse clinicians, nurse specialists, so on and so forth. How can you have to go out of the four walls? You don't have to do only go to the hospital and give the medicine, give the injection. You have to fly very high. So that is the innovation which is required. So that will demand the concentration on the teacher's skills, how you can mobilize the potentials of the students, which are not the doers. They will, today's teacher does not have to say ye karo, wo karo, wo karo. Student will ask 10 questions. He will say, why should I do this? Tell me. First question the student will ask the teacher, why should I do this? What I am going to learn from this if I do this? Please tell me. So you justify. Today's student will justify. Make the teacher to justify the word. Whatever word she speaks, she will justify. The students will make her to justify that why she is telling me to do. You are not a passive listeners now. You are active listeners and active responders. So you have to move out of the four walls. So the change in the classroom technology is, and today teacher shows you something else. Today she gives the PPT presentation, next day she puts a CD on, and third day she tells you to read this book, fourth day she goes to the smart classroom and then teaches you from there. So there is a change, there is a shift, and that shift is also going to be a challenge for all of us, for the students, the teachers, and also in the clinical area. You have the e-books, MOOCs, e-books, e-learning. That has become the order of the day. Smart boards, virtual learning, that has become the order of the day, which is a great challenge for all of us, because we have to face this challenge and we have to get acquainted to this challenge. That's very important. The evidence-based practice, all of us have been talking. I think in 1997 I went to UK to present a paper on evidence-based practice and Indian perspective. Since then, that was the first or second conference there which they were which they were organizing on evidence-based practice, nursing practice. I mean to say, evidence-based practice has been there from ages, but for the nursing practice, it was very new at that time in 90s. So we have been talking, but have we ever been teaching the students from that point of view, that what do we exactly mean by the evidence-based practice? We should not think that it is a big thing. When you talk of evidence-based practice, I think it must emerge from the bottom. It must not come from the high heights like PhDs or MScs or BScs or post. It should come from the bottom. That means it should come from a staff nurse in the hospital who is a great example of evidence-based practice. But it can only come when she works with open eyes, because day in and day out she is an nth number of patients, and she observes a large number of different types of diseases, patients coming with different types of disease, different type of symptoms, different time of response to the symptoms. And if you as a nurse, without being a PhD, MSc or anything, you open your eyes and see, oh, why is this patient responding in a different way, and why is another patient responding to the treatment in a different way, and why the patient, if I gave this treatment to this patient, why did he die, and if I gave same treatment to other patient, why did he survive? So these becomes the question, and these become the evidences. And when you try to find out answer to that your own question, it becomes the evidence. It was because of this he had some socio-economic problem, maybe some maybe some other health factors might have affected. So you try to analyze from the records of the patient, what was the problem, why did same patients with same symptoms, with same disease, they respond differently to the treatment. So you give an answer. That is, so then the second time you will do in that way. You will treat that patient in a different way. You will treat another patient in a different. That becomes an evidence-based practice, evidence-based research. But it is becoming a challenge, because we all do not know what exactly is the evidence-based practice. Similarly, if you admit many patients, suppose sometimes a patient with heart failure or heart disease or pre-diabetes or so many other disease condition and admits into the ward. So you can have a look last month's data, how many times this patient has been admitted in again and again. Why? What is the number of days he stayed in the hospital, when he was discharged, when he came back, what was the disease then, what type of different patients are admitted, how many patients are coming from this day. So that gives you an incidence and epidemiology of everything, whatever is going into the hospital. So that becomes an evidence in you. So you can then say that in this area, this is the thing what is happening. So if you are, because that time we say you should sit on the right side of the patient and then give him care, you should sit on the left side of the patient, then give this care, you should do that. Those things have gone now. You have to rationalize why I am doing this. Why should I do this? If I do in a better way, if I sit on the side of the patient instead of sitting on the back of the patient, if that type of treatment will help me, that type of nursing care will help me, I'll do that. I will not do that. So that becomes the evidence which you are looking for, and that is to be done for everything. But we should not think when we go to the hospital, you say that you are giving medicine, हमें तो medicine देना है. But if you just take a simple example of giving the medicine, if you do not watch what is the prognosis of that medicine, because the nurse, you as a nurse has to tell to the doctor that, look, you have given this antibiotic for 7 days, 10 days, you have to change now the antibiotic. Sometimes the doctors forget, and you see, observe the patient, what was the impact, what was the side effect of that patient, whether the patient got side effect or whether the patient had the progressed, patient had good prognosis. So you have to see these simple things become the evidences. See, there is always, in nursing, there is always lack of synchronicity. You know, why we are not at the policy making level? Because we are responsible for it. We are responsible. We think that if P.T. Cole has become the director of the School of Health Sciences, where she was heading medical, paramedical and nursing, the other person should not be like that. I am a nurse. Everybody, we have to work in a team. You know, if somebody does the good work, his legs are pulled. You know, teamwork has never, we have not been able to work in a team. I think these associations which are now more and more, earlier we had only one association, now more and more association. If all the association work in collaboration, I think something can happen, there can be, because, and we have to show, as this person was saying, that madam who took from the USA, who took the class from London or UK, Dr. Jenny or somebody, when she was saying you show, why they will say, you aapne ye kaam kiya to mujhe kyun nahi dikhta hai. So you try to, the recording is very, very important. Documenting is very, very important. If you document the good things, what you have done, because you do everything in the hospital, and whatever you do in the hospital, that whole is a research. And the credit of that is taken by the other professionals. Whatever, any activity you are doing in the hospital or classroom or teaching or anything is a research. And if you document and organize it in a particular way, it becomes a big research. But we are not taught to do that. We do things, we have done this, we have done that, we have done this, we have done this, but nobody knows you have done this. Who will believe on your this thing? Because they will not give you recognition. You are a nurse, they will consider whatever fault comes, they will give you, when some fault is there, they will allege you that you have done this. They will not appreciate you for your good work. But when you do one single mistake, they will punish you. So that should not be there. So because the disharmony among the nurses and the teamwork is very, very important. You are doing every day lot of evidence-based research, but you are not documenting it, so it becomes a waste. You are also performing very non-nursing roles. You know, that is a big challenge on you, because आपको भी इंडेंट करने को अभी तो कम हो गया, अभी the technology से कम हो गया, but आपको billing भी करना है, आपको record keeping भी करना है, you have to make inventory also, laundry को भी देखना है, diet को भी patient का देखना है, physiotherapy देखना है, so on and so forth, you have to see. Hospital information system is another challenge, because abhi to hum kar rahe the HIMS, hospital info. HIMS is a very important this thing, because agar aap technology lete, if you are using because HIMS now in most of the hospitals is technology based, but वहाँ पे technological failures होते हैं. आपको बोलते हैं sister वो दे दो, ये दे दो, because जब आपका net ही काम नहीं कर रहा, आप क्या करोगे? There is a low speed of the net, there is lack of confidentiality, because everybody can, अगर आपने password ठीक से नहीं रखा है तो confident, तो आपका open करके सारे देख लेंगे. There is lack of time under clinical work pressure. Can I have water? Technical problems, and she was saying एक बच्चा कह रहा था या स्टाफ कह रही थी कि हमें करना चाहिए. You know, that is the good thing. She was saying that हमें equipments का पता ही नहीं होता है, उनको खुद पता नहीं होता है. The training is very important. वो हमारी national education policy में भी सब में लिखा है. Faculty development programs, student involvement, lot of impetus is given on the faculty. Even teachers को भी तो कुछ नहीं आता है, मुझे भी तो कुछ नहीं आता है. जब मैं आज, मुझे तो पुराना पता है, आज का नहीं पता है. आज का नहीं, क्यों नहीं पता है? जब तक मैं खुद ट्रेनिंग नहीं पढ़ूंगी या खुद किसी से ट्रेनिंग नहीं ले लूँगी, मुझे तो नहीं पता है. मुझे तो ऐप बनाना नहीं आएगा. आई एम नॉट ए कंप्यूटर सेवी. Therefore, training is very, whether you utilize that, but only thing is that you can facilitate, whether you are allowed to do as per your nursing protocols, you are allowed to do something, but you must know how you can operate a particular equipment. And if you really know it properly, you can do in emergency, you can do it. Because nurses have saved many lives like this. Even nurses have done the cesarean section in absence of the doctor, because nurses have done so many stitching, so much, they have saved many lives without this thing. But if something goes wrong, they will punish you. But something goes well, they will not recognize you. That is the problem. So lack of training in our country, the thing is that in even 90s, when I used to go to the ministries, I used to tell them, "Aap to continuing education program aapka department hai." But wherever I go, I feel same faces coming again and again. Why not? Why you are not coordinating, keeping the coordinated effect? I think now the training, because the training department, I used to tell them, training department, I see wherever I go for continuing education program for training, I see same faces. Why should it be there? You have to create some mechanism where each one have the exposure to go for training. But abhi to hospital or colleges mein hi in service education programs ho rahe, and there should be, because the nursing heads, they are also constrained not to send you because they don't have staff. What can they do? But even all those constraints they have to forego, and they have to make it a point that they should ensure that quality patient care and quality training is only possible if we keep updated, because medical knowledge is changing so much fast. You cannot even wait for a year. You cannot wait, even every hour it is changing. You can say robotic, everything is telemedicine, telenursing, robotic surgery, so much is coming. Drone technology is coming. So if you have to work, you have to keep pace, you have to keep updated in that thing. Then what is this new era about? अगर आपके पास इतने challenges हैं, नए में क्या करोगे? What are you going to do? नए में तो आपको, you have to adapt yourself to the new environment. These are the first nurses and the new era of nurses arising here. She is showing the finger that, look, if you do this, I am equally empowered. So don't show me the thing. Then case management, she becomes the coordinator, manager, and everything. A simple, if we see what is the context. Context is that there has been a change in the, we were talking about the pay structure is a challenge, but in foreign countries there has been some change in the salary structure. And if we talk about the satisfaction point of view, even you can say more than 50%, 51% say that nobody bothers for our concern. Only 39% they say they are reluctant for the concerns of the nurses, and 23% said that their concerns were listened to and acted upon. Only 23% felt that something can be done when our concerns, or when we talk about our challenges, then the administration looks after it. But see, rest of these 80%, they are not bothered. But even if whether they like it or not, like the demand, as I earlier said, that lot of demand, 9 million nurses are required globally for up to 2030, and in India only we need 4 lakh of nurses up to 2024. This number is growing very fast. The hospitals, they will dominate the security and safety. And these are the places where they are taking, and these are the places, the jobs they will be taking in various places. Nursing already has varied roles. I had in that new presentation, I had also, I don't remember, I don't know whether it is in this paper is there or not. Let me see. In other presentation, I had talked about the India also. No, it is that one. I don't have that. We had taken the excerpts from the 5th, 6th Pay Commission and 7th Pay Commission, where where the nursing salaries have improved in the government sector, but not the private sector. And we also had taken a data. I think it was in my new presentation, which I shared day before yesterday, which was not recorded here, but that is in my mobile. So I had taken the Indian data. This was the foreign data which I presented. I had taken the Indian data, where I had taken that how many nurses are getting less than 20,000 25% are getting less than 20,000, 35% are getting 20,000 and above, and 50% are getting. But I had taken that data, but still we are lagging behind as compared to the foreign countries as per the Indian scenario. So the registered nurses are taking already the varied roles. They have occupational nurses, they are case management nurses, and they are the managed head nurses, where non-clinical, where they compile the data, they do not play the clinical roles. Quality assurance and process improvement, and there are in-service nursing educators. We have already talked about that in hospital as well as in the collegiate settings, they are there. And for these, the vital nursing skills are required to grow a healthy career. This is the new era of nursing. You need vital nursing skills. And what are those qualities you are looking for? You have to display strong teamwork and project management. That is that will affect the quality of the care. Project management abilities you should have. The collaborative care is very, very important. The collaborative care, unless and until you focus on the collaborative care, you cannot solve the complex problems of the patient and or anywhere in the practical, in any situation that you can confront. So the technology, the community care, focus on the community care is more important. Use of technology is more important. Health manager role is more important, and you become because now you are not going to be an injection nurse or a medical nurse or medicine nurse or bed making nurse. You have to have the technology. You have to utilize the devices, because technology will be used to monitor everything of the patient's vitals, everything. So you have to be well versed with that technology so that you can monitor the patients. You also have to have the health manager. You have to play the managerial role, not only manage the nurses but also tell about what next for this patient from the nursing point of view, because you are going to have the task shifts. You are also have the patient care specialists, and you also have the educational, you have to work in the educational facilities, corporate settings, and the government funding initiatives you have to take. You have to develop the projects where you can initiate taking the fundings. The important thing is that what exactly you want to do is that what do the youth want to see in future health governance? A human rights based approach, fostering digital skills, education and innovation, strong and inclusive health governance. So what is because what is that Gopi, he was talking about all this. His whole session was on all this slide. Digital transformation in health care, grounded in a human rights based approach to health, aimed at supporting universal health coverage and health for all. This is the main crux of this theme today. Then all youth have the digital access, capacities and skills to benefit from and contribute to the future health ecosystem. This is the health coverage, innovations in health coverage. Youth are key agents of change, driving digital transformation in health, from research and learning to digital innovations and policy making. So this whole slide is the crux of whole आपका सारा जो theme है ये इसी this slide fulfills the need of whole theme of today's conference. So there should be virtual touch, virtual, now virtual reality has come. बिकॉज आपको तो वो नहीं कहना कि मेरे यहाँ पे 200 पेशेंट्स है और नर्सेज 10 है, वो नहीं चलेगा काम, because then you will be lagged behind. So you have all teaching, training, learning, patient management will be done virtually, virtual touch. Simulations are going to play a very, very important role in though it is not the only thing, but the studies have shown that around 50% of the skills can be learned, because you have high fidelity simulators. They, with the help of artificial intelligence, the the settings are done, and the high fidelity simulators behave like patients. If you want to show the patient in pain, the artificial intelligence, by using the computer, this thing, they will click that area, and then the high fidelity simulators will depict the same voice as the patient in pain, or patient in any problem, patient in coughing, pain, temperature, all those things that will be depicted. So 50% of the skills can be shown in the high fidelity simulators, and the low fidelity mannequins can be used for these procedures, for showing some small procedures, and then role plays also can be shown. Then the other important thing is blended learning, as the boy who's standing there is hardly bothered to listen to what the session is going on, and he's clicking the photographs. You know, this is what is when there is a large gathering, and when they are not interested in listening what a person is saying. So this happens. You will click the photographs, you will see the mobile. So this means that you are not here, you are somewhere else. So the technology will not allow you to feel that. So blended learning is a very, very important area which is coming up, because only classroom teaching will not help you. You have to have blended learning, where there is a mix of face-to-face learning, there is a mix of online learning, there is a mix of coaching, there is a mix of collaborating, and also the community touch, community interaction, and then community connect. We say that community multimedia, web-based learning, performance support, knowledge management, workflow automation. All these things are new technology which is coming out of your challenges, even if you face the challenges, but you have to adjust to this era, which is new. This has to be the order of the day, and this is happening in India. This is happening. Digital India is focusing on this, and the COVID-19 has given all of us the experiences. Thousands and crores of videos have been prepared during the COVID by small children also. So that is already is there. The physical classroom, field trips, webinars, virtual rooms, all these are happening. You all know that this. You also have been doing, preparing and making so many videos, audios during the COVID-19. So this has already come. It is just, we are just formalizing in the talk. The virtual intelligence is the other important thing which has come into. So we said that virtual intelligence, you know, wherever you are sitting, in whichever area, it will give you the teaching. There are two devices which is put, one on this front and one on this side, and then you can show everything, every procedure you will be able to see, and you have to sit on the remote locations wherever you are there. And if you have those devices, I don't know how much expense is that. If you have those devices, you don't have to go to any patient. Everything will be taught through that one, due to this virtual intelligence. This was a video of, I think, can we play this video? Video play कर सकते हैं. Artificial intelligence in healthcare, as I was talking to you, that we can use artificial intelligence, because you make all these simulators to behave like patients by using them.
In the future, what will nursing tools look like? They certainly won't be as inconsistent and hard to use as what most medical professionals are using today. No, they'll probably be designed for the way nurses and physicians actually work. So they'll be easy to learn and conveniently integrated into a single device. You know, a platform that expands along with your needs. They'll also likely be based on the most intelligent and accurate technology available. And most importantly, it's pretty much guaranteed that they'll be more comfortable for patients and produce better outcomes. Put simply, the nursing tools of tomorrow will look a lot like what Signostics is developing today. It's called the AI Nursing Station, and it's a set of integrated tools designed specifically for nurses. Backed by an electronic hub and using intelligent AI-driven ultrasound technology, the AI Nursing Station will combine a highly accurate bladder scanner with new vein-finding technology that you will have to see to believe.
This is going to be the world now.
These tools will also be joined by a groundbreaking technology for cardiopulmonary assessment. its proprietary artificial intelligence capabilities, the AI nursing station will provide nurses with more accurate data, even on patients with different body types and veins that are hard to find. Bringing all of these emerging AI tools together will not only make life easier for nurses and save hospitals money, but provide a new level of care for patients. Visit the website today and start learning about the future of nursing tools.
Then this is other technological innovations: speech automated automation, simulated aids for nursing, artificial intelligence supported administration, artificial intelligence enabled cyber security. Everything is to be, whenever you are using the technology, everything has to be robotic image analysis, dosage detection and correction, digital consultation, robot aided surgeon that you all know, and this all is speech. Benefits, we have, they has already take high quality, high accuracy, reduced cost, higher employee engagement with patients, streamlined workflow, high employee efficiency, decreased labor, reduced workload, enhanced protection. Only thing is that we should have the technology and we should be able to utilize that. Here also there was one video, I don't know.
Hello, ma'am. I'm Ryan.
This is virtual.
Hi, my name is Jen.
How are things going?
This is virtual reality, this one.
She's crying a lot.
See where he is sitting and where she is sitting.
She wants to be held all the time. Whenever I put her
This
down,
is the
she
example
cries.
of virtual reality.
Okay.
He is using the hand, right?
Calmed her down a little bit. I'm going to check her blood glucose here as well.
Okay. So what is wrong with my baby? Thank you.
So, aside from
People,
you
this,
mentioned that she's
everybody can stay in any location and they can see all this.
have you noticed?
She doesn't feed much, and I feel like she vomits after every feeding. She sneezes and yawns a lot. She doesn't sleep more than an hour at a time.
Any abnormal body movements or shaking or very tense or
I feel like she shakes and jerks around, and her muscles seem so stiff.
sometimes it's helpful also to understand a little bit about your medical history and things like that so we can understand everything that might be going on around the baby. How is
I don't have any other medical problems.
and the pregnancy was normal, no complications at all?
I didn't have any prenatal problems.
Looking at the record, it looks like it was a normal vaginal delivery.
My delivery was painful, but it went fine.
Okay, that's good. And then any allergies, medications?
No.
Any medications you're taking on a regular basis?
I take pain medication.
Okay. What is that for?
I have chronic pain after a car accident and used painkillers for a long time. There's no way I could just stop.
What kind of painkillers do you use? Is it like a Norco or Percocet?
The doctors prescribed the pain pills.
Any other drug use at all?
Why would you ask that?
But it's just something that we ask of everybody just to get a better understanding of medical history. Sometimes it's relevant, sometimes it's not.
What does that have to do with anything?
Well, it could be relevant actually, just because sometimes the medications and even drugs that you might be taking as a mother could affect the baby.
I started using heroin last year.
And when was the last time that you used any pills or heroin?
I didn't do it very often, and I definitely cut down once I knew I was pregnant. Did I hurt the baby? I used pills about a week ago.
Right. Well, it's certainly good that you were cut down. As far as whether you hurt the baby, it is possible that the baby's symptoms now are caused by your use of the pain pills and even the heroin during pregnancy.
What have I done?
Well, I do worry that perhaps some of what you're seeing here in the baby is something called neonatal abstinence.
I feel terrible. Do you think I'm a bad person?
No, it's not about that. You're going through a hard time, and it's always very hard when you have chronic pain to keep that under control. But I think the important thing now is that if we have a good understanding of what's going on, then we're going to be better able to help with the right people taking medications.
No.
That you're thinking about those sorts of things. Is that comfortable now that we've swaddled her and fed?
Thank you. Thank you.
So we cannot so we have to face this world, and this is a new era arising. So all of us have to acquaint ourselves with this, and this is already coming. This has already come in India also. Even the team had come to the IGNU when I was there at IGNU for they had done all the procedures this way for certificate in community health, and also talked to Ministry of Health and Family Welfare, and we also accepted, because since IGNU is a highly technologically advanced institution, so we told them that you can take an letter from Government of India, then only we can implement this for, because we were not able to meet the target. They said this way you can meet the targets, and they had taken full day presentation on virtual reality at IGNU, and but we only told them that we had a big presentation with VC and all, and we said once ministry tells us, we will utilize this virtual reality for training the community health officers, but at that time it did not happen. Now I do not know what has happened. So we have to be increasingly involved in large scale population health management programs, which can, because this can be the reality. This is happening in some of they are also already doing this with MBBS doctors in some of the pilot institutions. So there's a need for shift towards registered nurses playing a critical roles in the development of software and its application. ये तो करना ही पड़ेगा नए new era में, what Gopi has already started doing, and others, many people have started doing. The roles may include informatics will become the order of the day, informatic nurses, and then with informatics you can do any wonders. Then if informatics design, the application, and also the implementation across the various settings, and adapting the technology to the particular setting, that can also be done. We can use high tech, and we can use middle level technology and low grade technologies, or appropriate technologies, wherever the as per resources in appropriate technology also can be utilized. So this is telemedicine cluster for villages. In most of the health centers, health and wellness centers, there are the facilities of telemedicine and telenursing. And during COVID time, I made one of the PhD scholars also to do the study on these community health officers, and they found that there were certain telemedicine or nursing lectures going on during the COVID time, and there are these facilities in the upgraded centers, that is health and wellness centers, which are upgraded sub-centers. And research, we know that is the education is also very important, highly decentralized, internet moderated, and distance learning, accountability shifted to the students, because now the teachers everything is learner centric. There is teacher centric education focus has gone, everything is learner centric. Then accountability shifted to the students, portable digital assisted learning, faculty role from provider to the facilitator. Now we don't say teacher, we say facilitator. Then this is the coverage, universal health coverage, that telemedicine will address to this. Whatever slide I have shown to the telemedicine, that is addressed to this. So universal coverage means universally equitable, protection of rights of the patient, community participation, financial protection, accountability and transparency, social inclusion and non-discrimination, promoting rational and quality care. And this all are the areas where universal health coverage has to be achieved by following all those things, and ultimately we focused on telelearning and telemedicine. This is the last slide. The right to health means access to universal health coverage, timely, good quality, acceptable, appropriate, affordable, and timely, using the telemedicine and telenursing. Thank you. I will not ask any question because I have already bored you. Everybody is ready to go, na? So अगर कुछ पूछना है तो पूछिए. So no questions, na? Everything, the minds were somewhere else, na? While we are listening to the session, है ना? अभी भी minds कहाँ पे है? It was an after lunch session, and we expect the after lunch session like this only, passive session.
Thank you, ma'am, for your informative session. I would request Professor Poonam Thakur, ma'am, to present a memento to Professor Dr. P.T. Kaul, Dean, SGT University, for her excellent presentation. Please have the memento ready. Thank you very much, ma'am. Now I will have Professor Shri Sarkar, ma'am, Principal of PG College of Nursing, on the stage to honor Professor Poonam Thakur, ma'am, with a memento as a gesture of gratitude. Please welcome. Thank you. I am assured that all the participants must have gained immense knowledge We will be glad to have our feedbacks in the form of post-test, the same process you have attained in the pre-test. Check your link, check the link on your mobile for the post-test. Please take part on the post-test. After the post-test, we will have the valedictory session for the certificate distribution. Our chief guest B.R. Srivastava is arriving in a very short while for the valedictory session. वो रफ वाली I am assured that you have taken part in the post-test. I salute to your patience for being here for the International Conference 2023. My friends, सफ़र में धूप तो होगी जो चल सको तो चलो, सभी हैं भीड़ में तुम भी निकल सको तो चलो, किसी के वास्ते राहें कहाँ बदलती हैं, तुम अपने आप को खुद ही बदल सको तो चलो. We will have our chief guest in a very short while. Please have some patience as you have shown throughout the international conference. My dear participants, our chief guest has arrived for the valedictory session. Please take your seat. न हम सफ़र न किसी हम नशी से निकलेगा. My dear friends, न हम सफ़र न किसी हम नशी से निकलेगा, तुम्हारे पाँव का कांटा तुम ही से निकलेगा. Now I would request respected Dr. B.R. Srivastava sir to be on stage for the valedictory session in which the certificates will be distributed to the representatives of the different colleges. Please welcome our chief guest. And I welcome Abhishek Srivastava sir from UNS College to receive the certificates on the behalf of the participants from the colleges. Please welcome Abhishek Srivastav sir. I would like to call upon any representative from BRIMR Institute of Nursing Sciences to be on a stage to receive the certificates on the behalf of the participants. I would like to welcome any representative from RDS College, Gwalior to receive the certificates on the behalf of registered candidates. Any representative from RDS College, Jaunpur. Okay. It gives me immense pleasure to welcome Professor Nimmi Alpana Gopali ma'am from Ratan Jyoti Institute of Nursing Sciences to receive the certificates on the behalf of the registered candidates. Please welcome. In addition, I cordially welcome any representative from IDS College, Gwalior to receive the certificates. Thank you, sir. And now we will have any representative from Dayal Nursing College, Gwalior to have the certificates on the behalf of their participants. Any representative from Dayal Nursing College, please come on a stage. Any representative from Dayal Nursing College? Okay, any student is from, please come on the stage to receive the certificates on the behalf of other participants from Dayal Nursing College. Please come. And here the valedictory session and the certificate distribution ceremony has ended. Now I would like to request Dr. B.R. Srivastav sir to please take your seat. And it is time to welcome Dr. Gunjan Srivastav ma'am on the stage to felicitate it with the memento, for which I would call Professor Poonam Thakur ma'am on the stage to felicitate Dr. Gunjan Srivastav ma'am with a memento as a gesture of gratitude. Thank you, ma'am. Now I would again request our Honorable Dr. B.R. Srivastav sir to be here on a stage, join us for certificate distribution to the faculty members of the PG College of Nursing. Please welcome Dr. B.R. Srivastav sir on the stage. And now please welcome Professor Shushil Kumar Gupta sir, Vice Principal, PG College of Nursing, to receive the certificate from our Honorable Chief Guest. Professor Gaurav Kumar Tamoli sir from PG College of Nursing, please come on the stage to receive the certificate. Mr. Sunil Namdev sir from PG College of Nursing. Mrs. Sanju Patel ma'am from PG College of Nursing, please come on a stage to receive the certificate. Mrs. Pooja Ahirwar, please come on a stage to have the certificates from our chief guests. Mr. Krishna Kumar sir from PG College of Nursing, will join us on the stage to receive the certificate. Mrs. Angelina Singh ma'am from PG College of Nursing. Mr. Brijesh Kumar sir, please come on a stage to receive the certificate from our chief guest. Mrs. Sonal Bundela ma'am. Mrs. Sonal Bundela ma'am, please come on stage to have your certificate. After that, I would request Mr. Pavan Tyagi sir to have on stage for the certificate. It will be the turn of Mrs. Varsa Prajapati ma'am from PG College of Nursing. Please be on the stage to receive the certificate from our chief guest. I may call Mr. Mudassar Beg sir and Mrs. Preeti Prajapati ma'am on the stage to have their certificates in their hands. Mr. Pavan Gurjar sir from PG College of Nursing. Mr. Ambar Jaiswal sir from PG College of Nursing. Have the certificates in sequence, please. Mr. Ambar Jaiswal sir, is he here? No. Mrs. Asmriti Sharma ma'am, please welcome on the stage. Asmriti Sharma ma'am for the certificate. And in addition, I would call Mrs. Rekha Prajapati ma'am to be on the stage for the certificate. I think the certificate distribution has ended. I may request Dr. B.R. Srivastava sir to be on his place. Please take your seat, sir. Thank you, sir. Now it is time for the milestone to which we have gathered here. I would call Mrs. Professor Siuli Sarkar ma'am, Principal PG College of Nursing, to be on a stage for the vote of thanks and have some words of greetings. Thank you.
A very warm good afternoon to all of you. Myself Professor Siuli Sarkar, Principal PG College of Nursing, here to give thanks to all of you. First of all, I would like to thank our chief guest, Dr. B.R. Srivastava sir, Managing Trustee Janvika Sneas. Next, I would like to thank after our guest, Dr. Gunjan Srivastava ma'am, Medical Oncologist, Cancer Hospital and Research Institute. Next, I would like to thank all the resource person and chairperson for their wonderful presentation that make us a high level of knowledge to enrich us. Next, I would like to thank all the organizing chairpersons, co-chairpersons and members for their effort to make this conference successful. I would like to thank all the principals, teachers and participants who make this conference success. Next, I would like to thank all the media and IT team for their efforts and make this conference success. Next, I would like to all the person who work behind the stage and make this conference success. I hope you all enjoyed and gain a new knowledge from this international conference. Thank you to all.
Thank you, ma'am, for the words of greetings, and thank you all participants to make this international conference memorable. सितारों को आंखों में महफूज रखना बहुत देर तक रात ही रात होगी, मुसाफिर हैं हम भी, मुसाफिर हो तुम भी, किसी मोड़ पर फिर मुलाकात होगी। मैं आप सबसे अनुरोध करना चाहता हूं कि राष्ट्रगान के लिए अपने अपने जगह पर खड़े हो जाएं और इसके बाद हम इस इंटरनेशनल कॉन्फ्रेंस की अंत की ओर बढ़ेंगे। धन्यवाद। जन गण मन अधिनायक जय हे, भारत भाग्य। भारत माता की वंदे वंदे। धन्यवाद।
Now this is the time for the tea break. Not for the tea break.